Minister, Chancellor, esteemed guests, colleagues, ladies and gentlemen. Warmest welcome to this unique AI conference titled AI Healthcare and Human Rights. My name is Tuula Helander. I'm from the Department of Safety, Security and Health from the Ministry of Social Affairs and Health. And I have the honor of serving your chair today in this event. And I'll be guiding you through the entire program. So making sure that we stay on track with the schedule and helping to create a smooth and engaging experience for us all. So it's really wonderful to see you all here. And if I understood correctly, there are about 300 people online. So I must say that when I was thinking about this event, so that as we know, the clock speed of the societies and the development, so where technology is so advancing so fast, so I was thinking that what about the next meeting, so that are they like that we are attending as digital twins or avatar versions of ourselves, or so that's why it's great that we are physically here and we have the possibility then to stream the whole thing as well. So, but we have a very full and exciting agenda ahead of us. Brilliant speakers, moderators, 6 panels, thought-provoking panels, and meaningful discussions. My most important task, I suppose, is to ensure that we respect the schedule so that every speaker gets the time needed and it's a fair share, that every participant, whether here or online, follow the program as planned. So I kindly ask all the speakers to keep an eye on the clock there and then the stage, so that we keep the time. So thank you for this cooperation. So this just a few housekeeping things. So there is a message wall available on site. On-site participants, not for online, apologies for that. And we can use the attached QR code to join with your phone. And we encourage you to participate actively. So as we all know, the input is extremely valuable, and we are collecting all the comments and questions. And the working language, yes, the conference is English, but with simultaneous interpretation in French, available on live streaming. So people they have their own headphones and choose the French channel. And the conference will be recorded, and it will be made publicly available after the event. And the venue, there is a wireless codes, as you see here, the Wi-Fi. And as a reminder, for those who have registered, there is also a cocktail reception for speakers and other participants starting 5:30. And the restaurant is just across the street and floating on the water, so don't be afraid. So that I think it's in a way, when I was to think about the place floating on the water, the restaurant I mean, I think it's a fitting place to conclude the day, because in many ways AI is still in its early stages, so that they're not yet standing on a solid ground, I mean, so that we are navigating sort of uncharted waters full of potential, but also with uncertainty. So let's continue the conversation there with floating together toward the future. But now I have the honor to present the next speaker, so that we explore the landscape of AI. So please join me welcoming our Minister of Social Security of Finland, Sanni Grahn-Laasonen. Please.
Good morning. Thank you, Everyone, greetings from the WHO General Assembly. I came almost directly from Geneva, just a couple of hours of sleep before this very important conference on AI. And it's a great pleasure to see you all here. Thank you, Mr. Huber, to you and your team at the Council of Europe for cooperation on this event. Artificial intelligence is one of the most significant technological advances we've seen in recent decades, that's for sure. The opportunities it brings to healthcare are enormous, but at the same time it also brings with it challenges that we must respond to. AI can revolutionize healthcare by enabling, for example, more accurate diagnosis and personalized treatment pathways. At the same time, it must be ensured that it's used ethically and responsibly, and that patient safety and privacy are always a priority. Finland has a long tradition in healthcare and pharmaceutical industry, and we're known for our high level of expertise and high quality products. Our experts rely heavily on innovative solutions and high quality products. As an industry, health technology employ thousands of Finns and create significant added value for our economy. Promoting innovation is essential in order to maintain our competitiveness and offer even better solutions to healthcare challenges. Digital development enables continuous development. However, this requires strong cooperation between the public and private sectors and investments in research and development. As the nature of AI is global, Finland is also actively seeking for international collaboration in health AI. Finnish organizations have seen the need for the social and healthcare AI ecosystem. The ecosystem was launched in June 2024. Now there are more than 240 public, private and academic organizations in it. In the ecosystem, we've investigated that there are already about 200 significant AI solutions in use or under development in the welfare counties of Finland. Welfare counties, AI companies and researchers have also started a set of new AI development projects with the ecosystem support funding. These projects aim to develop solutions that can be launched for a very large number of users and therefore bring significant benefits. For example, solutions support interaction between customers and professionals in daily routines. These AI solutions are utilizing the Finnish superpower of extensive and good quality databases that we've been developing for decades. The Finnish ecosystem is also dealing with workforce competence development and risk management. These are key issues in order to benefit of health AI. Finnish Ministry of Social Affairs and Health is using the feedback from these AI development projects to prepare enabling legislation changes. Smooth regulation is of key importance for the competitiveness of Finland and Europe. It's of course particularly important that regulation is both predictable and practically enforceable. This is the interest of both industry and especially the patients. A human-centric approach is the starting point for both Council of Europe Framework Convention on Artificial Intelligence and Human Rights, Democracy and Rule of Law, and EU AI regulation. Both the Framework Convention and the EU AI Act aim to ensure that AI systems placed on the market and put into operation do not pose a risk to health, safety and fundamental rights of people. AI Act prohibits particularly harmful uses of AI and may impose stricter requirements on certain high-risk AI systems. It aims to ensure that AI systems are developed and used in a human-centered and trustworthy manner. It must also be applied in accordance with the values of European Union. I look forward to interesting discussions over the next 2 days. On the first day, we will focus here on cooperation within the Council of Europe. And on the second day, we will take a closer look at development opportunities of health AI in Finland. I hope we will continue fruitful cooperation in utilizing AI in an ethical and human-centered way. Thank you very much, and I hope you all enjoy your stay in Helsinki. Thank you.
Thank you, Minister, for sharing your time and your expertise today. And then, my pleasure to introduce the next speaker from the Council of Europe, bringing the vital perspective on how international cooperation and shared values shaped to the future of AI. So please join me welcoming our distinguished guest, Head of the Health Department, Dennis Huber. Please welcome.
Thank you all. Thank you, Tula, for your welcoming words, and thank you to the Minister also for welcoming words. I'm quite happy to be here in Helsinki, and I'm impressed by the richness and density of the program. Wow, we have a lot to talk about. It will be very interesting. And I want to share some introductory words with you. Minister, Chancellor, Permanent Secretary, ladies and gentlemen, dear colleagues, artificial intelligence is helping to improve millions of lives. It has the potential to improve diagnostic and therapeutic outcomes for patients. New AI implications in health continue to grow, especially in imaging, radiology, where it demonstrates significant promise. Further, AI is helping to identify disease and diagnose health conditions, to predict the risk of disease and potential complications, and to personalize and tailor treatment plans for individual patients. AI is a boon for the protection of health, which is a fundamental human right. However, AI deployment in healthcare must be assessed as that any threats to people's human rights are mitigated. When a state pioneers the use of technology, it bears a special responsibility for promoting the potential benefits of the technology, while at the same time protecting human rights and fundamental freedoms. These rights are enshrined in the European Convention of Human Rights, as all of you know. The jurisprudence of the Court of Strasbourg underlines that states should, inter alia, legislate to protect individual health and lives, to uphold high professional standards among healthcare providers, to take practical measures of protection, notably informing people of health risks, and protect individuals' integrity. Besides the European Convention of Human Rights, other Council of Europe treaties build on these obligations to provide member states with a common legal basis on which to examine and act on the abundance of opportunities and challenges in the field of health. These treaties include the European Social Charter, which guarantees a broad range of human rights, including health, medical assistance, and social protection. The Charter enshrines the right to the highest possible standard of health and the right of access to health care for everyone without discrimination, including people and groups in vulnerable situations. Interpreted in the light of evolving societal and technology issues, the Charter is relevant and applicable to the challenges posed by AI systems. Second important treaty is the Convention on Human Rights and Biomedicines, the so-called Oviedo Convention. It's the world's first and only legally binding international treaty to protect the dignity, identity, and integrity of everyone in the biomedical field. The third treaty is the Convention, so-called 108+ on data protection, which protects individuals regarding the automatic processing of their information, including data processed by AI systems. The Convention operationalizes the right to privacy in different settings, including healthcare, and underscores, inter alia, the need for consent and meaningful control over personal data. And last but not least, the convention already mentioned by the Minister, the Framework Convention on Artificial Intelligence and Human Rights, Democracy and the Rule of Law, which provides member states with a reinforced basis on which to uphold existing human rights principles, identify, assess and mitigate risks, and advance remedies for the application of AI systems, including in healthcare. These legal instruments, which I just mentioned, provide a strong basis to address human rights challenges raised by the application of AI. In healthcare, of course, but also in other matters. They provide us with the point of departure for this conference to enable to explore issues and challenges, uncertainties and disruption with regard to notable dilemmas. I would like to mention a few of those dilemmas that we have to face today, and not only today, but also in the future. To which extent should AI applications be used in access to primary healthcare services? In other words, can AI applications be deployed to serve everyone in an equitable manner? First dilemma. Second dilemma, will all AI applications empower and/or disempower the participation of individuals in their healthcare journeys? Third dilemma, what does effective and meaningful responsibility and oversight of AI applications mean for health professionals? Fourth dilemma, what are the implications for medical confidentiality as AI systems form part of the patient-doctor relationship? The recent report of the Council of Europe Steering Committee for Human Rights in the fields of biomedicine health, CDBO, which is available at the entrance, on AI impact on the patient-doctor relationship, explores the human rights implications of AI systems, notably by underlining the need to, first, educate and train health professionals to use AI systems with the necessary skills and competencies to address the challenges posed by AI systems, for example, linked to their opacity and probabilistic outcomes. Second, to support individuals in assessing the benefits and risks of AI-supported medical interventions so that they can reach decisions about consent based on preferences and values. Ladies and gentlemen, it can be said that the inherent value and worth of each individual, regardless of background, characteristics or circumstances, makes every one of us much more than a series of data points prompting machine-driven insights into patterns and correlations of biological functions. Cognition, empathy, and trust between human beings are vital for people facing illness and disease who seek professional contact and guidance. On this basis, we are gathered here today to explore the roles of healthcare professionals in respecting the autonomy and right for information of the patient and in maintaining transparency and patient trust as critical components of the therapeutic relationship. This provides us with an opportunity to contextualize the deployment of AI systems in healthcare settings and to openly exchange views on the risks and challenges that they pose. More specifically, our main objectives today are to explore, first, international perspectives and strategic thinking of key actors. Second, equitable access to healthcare, considering the difference between access to doctors and access to AI-enabled health services. Third, patient autonomy and AI systems, notably the information and critical thinking patients to be able to introduce their own values, preferences, and perspectives in patient-doctor communications. Fourth, professional responsibilities and AI systems, notably the professional responsibility, transparency, and discretion needed when using AI systems, and the standards, education, and training needed in terms of transition and deployment. Fifth, health data and AI systems, notably the place of informed consent for their collection and processing. To conclude, I would like to thank our excellent colleagues from the Ministry of Social Affairs and Health of Finland, Tuula Helander, Joni Komu-Lainen, Minna Westerholm, and Sala Rosenberg for their invaluable support, guidance, and efficient organizing of this event, and also for the nice reception we had yesterday. I want also to join these thanks and congratulations to my Council of Europe colleagues, Li Hibard and Päiva Suonen. The Council of Europe is very pleased of having supported and contributed to this event together with you, Tuula, and your team. We look forward to lively exchanges, the successful conclusion of this conference, and our continued collaboration in this important field. Thank you.
Thank you, Dennis. And then I warmly welcome, we are honored to welcome the Chancellor of Justice of Finland as a key guardian of the rule of law and fundamental rights. So his perspective is especially timely and relevant in the context of AI and governance. Please welcome Chancellor Tuomas Pöysti.
Good morning, and pleasure to be here on this very timely conference about a very timely topic. It's a specific pleasure to address here because the Chancellor of Justice is given by the Finnish legislation also a specific mandate to oversee automation in the whole public sector and the public tasks, and in terms of the European Union AI regulation, the Chancellor's office is one of these fundamental protection authorities, and so this is slightly the background. But then to the topics, and I will specifically address here some preliminary thinking on this medical professional, healthcare professional, patient relationship, not generically AI. There is nearly every day somewhere several conferences on the generic AI, but this very specific topic, which is of utmost importance since the health sector as such is an information-rich domain, data-rich domain, which as a point of departure means that the AI could provide a lot. And the core of this healthcare is, of course, this what rightly is called healing relationship in this excellent background report for the committee, for the CDBO committee of the Council of Europe, this Brent Mittelstadt report, and the committee's own shorter report. This also brings a kind of a more like an industry and societal focused ambitions in the European Commission to integrate the AI in the core sectors, which is of utmost importance for the future of Europe in a nutshell, where healthcare is one of those areas. And then there is a promise of this kind of more personalized and more effective healthcare. On this last part, and going a little bit outside the scope of this conference, I would also put a little warning flag. We have been talking 10 years about this promise of the personalized healthcare, and of course there is a lot of progress, but it doesn't necessarily mean this kind of more effective and reduced costs healthcare. It might in fact mean more costs if it's not related to wider changes in system. And the same message also applies to any use of the AI. We should also have a look not only on this kind of technicalities, which are important on the AI, but also this kind of wider societal impacts, what will follow from this exercise. Finland has some interesting experience on it, and the minister already mentioned that we now have this national ecosystem where things are quite, to a fair deal, in fact, mirroring this kind of wider perspective. If you look at patenting activities, so this kind of healthcare-related applications, like under the medical devices regulation, the European Union, so there is quite some activity on the new applications, and in Finland domestically as well. We also do have some also very positive examples from the public sector. There are some self-healing guidance tutorials on the various public services empowered by the AI. I, in a very different position, was on the very early stages even negotiating some AI providers, and it was a little bit challenging issue to open, in fact, this kind of AI-empowered self-help healing solutions to general public. Then there was, on some jurisdictions, there was reluctance to do so, but here it has been possible with also positive results. I can only cite the fact that during the pandemic, one of the ways in which this kind of pressure during the emergency times on the public health system was avoided was this kind of self-pre-diagnosis systems, which help, in fact, to triage patients to those ones who had a real risk of contamination to the others. It was a tremendous help during the times of stress to the public health system. My first message is, apart from this great potential, is that the legal and ethical context of the use of the artificial intelligence differs considerably in various use cases, also within healthcare. It's a very different thing to have like a generic service engine helping people to connect than, in fact, introducing AI as a really autonomous agent on this healing relationship. And the third thing are this kind of background function. There is a good classification. I'm not going into the kind of classification of the use cases on this background report, and there are in the literature there are some others. What is important here to see is that this healing relationship is very specific, and there are also some very specific legal and very old ethical requirements which have to be taken seriously. And this leads to my second point here, which is that this healing relationship and now this is a lawyer speaking, so from a legal perspective, it is a very distinct relationship. In the legal terms, it's a relationship with specific fiduciary duties with the human priority. The primary fiduciary duties for doctors and for other healthcare professionals are professional prudence in accordance with commonly established medical or professional practice standards, the required degree of skill, care and caution, of which a prudent professional would exercise. So the idea is that each healthcare professional shall be a good example of his profession, In ethics, that's called virtue ethics, or in fact phronesis. It's a very specific type of commitment where being a good example is tied to some moral principles on that, and also the loyalty to this patient relationship. The Oviedo Convention is one of the few, not the only one, but one of the few international instruments which are specifically stipulating out the principles of that. And that's in fact this kind of additional value which is not contradictory but complementary to this kind of generic EU regulation and then this Council of Europe Framework Convention, which is in a more abstract level. So the challenge here is in fact for the use of the AI is rather than how you in fact bring in this specific fiduciary duties in a meaningful way to a relationship where the AI is becoming a tool but also a semi-autonomous actor which shall, in accordance with the generic EU regulations and the generic framework convention rules, be meaningfully under human control. So in a nutshell, the issue is less about what, it's about how. And of course, this kind of liability issues, I have also myself a little bit engaged in this very intriguing questions about this distribution of the liabilities and this AI liability issues, and which are not clear, and particularly not clear for the medical profession, might have also a big retroactive impact on the issues. But at this stage also, as important as this liability clarity is also the how you in advance ensure that things are going right in the first place. And that's in fact one of the experience on this national oversight of this automated systems, that once a mistake is there, so then it's costly and difficult to remedy that. So it's easier to exercise prudence in advance. So the issue is in fact how to bring in these Oviedo principles into that. And before we look into more detail into that, so the idea is have to look. My idea is that what we need to do is to have a look what is in fact happening with the introduction of the AI in this healing relationship. And this is an old story with specific new features. Well, if you look at the humanity and the history of the medicine as such, it's a long history of introduction of new tools, more powerful tools to existing human relationship. And the AI, despite of all the facts, all this kind of hypes and great hopes, it's still a tool. So an additional tool is coming to the disposal of the professionals, and also, which is interesting, it might also come to the disposal of the patient in this specific relationship. However, this AI has some transcending capacities, making it more powerful than some of the previous tools. And this leads to the point that the way in which this should be in advance, ex ante thought, is rather this kind of a hybrid architecture, as some computer scientists are calling it, or leading towards augmented intelligence, where there are in fact 3 actors involved, roughly. The medical professional, the patient, the humans, and the AI, which has some autonomous capacity. So it becomes this fiduciary 2-to-2 relationship becomes a triangle. And it should be designed as such, because wonderfully functioning ICT system might develop dysfunctions when humans are coming into play, and that's also our experience with this kind of more sophisticated patient, electronic patient record systems, which, if they move beyond of this kind of archiving to assisting in this what is happening in this appointment room, so then things get complicated, and this kind of specific relationship between the human, the professional, and the computer become very important. That's, in fact, there is a whole bunch of literature about this human-computer interaction in some fields of the computer science, and this is highly relevant, in fact, in this AI context, but not only as a design, but seriously thinking that the machine's intelligence and the human intelligence are coming together, and then we have to keep the patient on board so that he or she is not excluded. So this is the point. So this requires system-level design and context-aware applications that adapts also to the user needs and environment. I had a quick look on this kind of existing literature beyond this kind of Finnish national like legal oversight cases, and found out that some of this kind of diagnosis tools and so on have also failed, albeit they have been very well tested. So, but then they are moving to specific data environment in a hospital and used by a specific, and then they start to produce non-accurate results, which is not good. And therefore also this kind of a context awareness is not a one-stop that and only a matter for this kind of AI industry to develop the software. It has to be run through the entire life cycle of the system so that it's there on the terms of this augmented intelligence perspective. The Oviedo Convention, the law's role in particular in this field is that the law's role is that to keep the AI under meaningful control, in a sense that this human agency is maintained, and the law exists to protect that human dignity and autonomy and these wonderful principles in the convention. And that's not easy, because sometimes this kind of the machine could have good functions, and this kind of erroneous human input also can cause problems. So with all respect for the underlying ideas, for example, for the Article 14 of the European Union AI Act, so this kind of human in the loop, but it has to be rightly interpreted, because sometimes, and that's something that I have been in exchange with several computer scientists, you have to also exercise cautious when and how the human is coming into play. And that leads to a very difficult point on this kind of opacity and transparency. The medical professionals should have this kind of critical reading skills, or this AI literacy skills, to be able to also rightly read the AI. And also the doctors have a very unpleasant role in this setting, in fact, to be the ones who are explaining to the patients how the system is functioning. There is some literature done in Finland that, in fact, this general knowledge of how the AI is functioning is having a big impact on the acceptability from the patient and consumer perspective of this application. And so a kind of additional task for the healthcare professionals is here to explain the AI to the patient. So there is this two layers of this general problem explainability. First, this algorithm, the software should be able to be explainable. Then secondly, the doctors in particular, and also nurses, should be able also to be like intermediaries of that explainability to their patients, so that this triangle would be functioning in accordance with the Oviedo principles. If that's done right, so then we arrive to the situation that we will have there is an idea in the report that this relationship would be more equal, not deliberately one, because there are some specific fiduciary responsibilities, but still that also the patient side is fully empowered. So this requires both this kind of technical and this kind of explainability issues. Some jurisdictions have a additional challenge, and I found that there is nearly no reflection about this nurse-AI relationship. Particularly in the Finnish public sector healthcare, we have highly developed this kind of division of tasks between the nurses and the doctors. And in fact, the nurses have spent more time with the patients in the Finnish public healthcare. I personally think that we might have gone a little bit too far on that, but that's my personal view. But at least that's the kind of policy, and that's in fact what's happening in the appointments. And so this also means that we should also reflect this kind of fourth actor in this fiduciary relationship. In fact, that's the nurse working with the doctor. So it's the nurse and the doctor, the AI and the patient, where we are talking about this empowerment and explainability. So my main point here is that we should move on this kind of interpretative model towards in this relationship in accordance with the report, and towards also some features of deliberable model, albeit we cannot for legal reasons fully go into this kind of deliberable level. This is a kind of also multi-layered regulation, because you see that there is this generic AI, there is on the European Union, there is this EU medical devices regulation, which is also highly important, but which is not fully covering this kind of large language models and this kind of general purpose AIs, which is also increasingly coming into play. So what is also needed is a kind of AI governance within the organization, so that this kind of requirements of different regulatory regimes are done. And this is also some area where the further guidance is needed. And I think the specific contribution on this specific institutional setting under the Council of Europe is in fact this healing relationship, because that's less covered by the others. But this has to be thought out, that any hospital, any doctor can in fact run through this kind of multi-layered regulations. And all this also requires also data policies. So the higher the quality of the data, better it functions. So you have to have a constant data cleaning, in fact, to maintain it right. So and to have this kind of accurate results. I'm not repeating here this kind of self-evident things, but this kind of medical preciseness is one of this kind of fundamental principles which are following also from the Oviedo Convention, which is kind of additional contextual interpretation of what you can read out also on this framework convention on AI, and specifically on the European Union, the AI Act is kind of accurate functioning of the algorithm. So this has to be interpreted with this kind of medical prudence standards, and that's an additional thing to how you interpret this kind of generic requirements. This is easier in some machine learning things than in large language models. The large language models have some specific difficulties, because this capacity to hallucinate somehow follows from this very technology, which is also giving this technology very powerful. So there's also this interpretations for this, what this governance and for this data cleaning means, may differ also depending on the AI technology which is used in the situation. But that's the thing, and that's the challenge, in fact, to meaningfully write this on this system, so that also they function also taking into consideration the humans who are involved. This leads to my two final remarks. In fact, if we want to maintain this medical preciseness, and we should have to maintain also this Oviedo Convention standard of prudence, professional prudence, which is well embedded in the national legislation. So this also means that the data governance, AI governance, and the applications shall be developed in a closer dialogue than what has been the practice in the AI industry with the medical profession, and it is a joint exercise between the data and computer scientists and medical profession, and yes, also to lawyers who have to help also in advance to provide these interpretations. And remarks here is that the Council of Europe is right, in fact, to take specifically this Oviedo Convention related thing, given that the healthcare is a very significant, rapidly evolving area of application, and this is also something where further work is needed. We also need, in fact, specifically kind of interpretative guidance to apply Oviedo Convention in conjunction with the AI Act, the European Union General Data Protection Regulation, and the equivalent Council of Europe Convention, the medical devices and in vitro diagnostics regulations, and both in the design and deployment, maintenance and repair of the AI applications, so meaning the entire life cycle, because the governance does matter. And a prudent work is required, but I still think that the AI will be a profound change in the healthcare professional-patient relationship, and if this is done right, it can be a step to good direction, empowering both the patients and the doctors and the nurses and all the other professionals involved. But of course there will be mistakes, and we also have to be calmly, without hype and without kind of throwing to ourselves to dystopia, also to dealing with this kind of mistakes we learn from the journey. Thank you.
Yeah, thank you so much. I was thinking of the multidisciplinary teams and look at Visa, so that you think about all the teams, not only the nurses and doctors, but what about should there be involved as well IT and AI professionals, so that it's, and as you said, the people's trust is the key whenever the data is, in a way, if there is access to data or how people want their data to be used. But then we move on. Thank you very much. We go to the first session. So the moderator of this first session is our boss, our permanent secretary, Veli-Mikko Niemi, who is then moderating this session, and then I call up the panelist, Thomas Dolezal. Please take your seat. Marco Marcella, Katarina Vujovic, and Aleksi Yrttiaho. Please.
So, good morning everyone here in the hall in Helsinki and everyone there online. We started quite early from the Western European perspective, but I hope you have all woke up now, because now we have a very high-level discussion on the topics. We have got already a good introduction from Mrs. Minister and Chancellor of Justice of Finland. May I introduce people here around me? First we have Thomas Dolezal, who is from the Czech Republic, but worked very effectively within the Council of Europe in this topic. Welcome. And then we have Marco Marcella from the European Commission. And then we have Katarina Vujovic from the OECD. And then we have David Ortiz from WHO Europe, and then Aleksi Yrttiaho from the Finnish Ministry of Social Affairs and Health. And the topic of today's discussion is really patient-AI-doctor relationship. What are we going to do that? What we must do on that? These three elements were already highlighted very well in the previous speech by Chancellor of Justice, and it is quite clear already from the work what the Council of Europe and others have done, that we have their possibilities, but we have also challenges which we must work on. And within these challenges we have, of course, things like what would be the access to healthcare within this new system, how we can ensure that there will be equitable access, what is the professional work, what is the patient autonomy, and finally, but perhaps most relevant, what is the privacy issue, what is the right to information, how we can cope with these kind of problems. There are a lot of promises, maybe a bit overloaded sometimes, as what would be AI, could it be a tool for patients, and would it be a substitute for human professional contact? Are there any limits? Should there be any limits? Then how we can ensure that every health professional, doctors, nurses, as was mentioned as well, what kind of education they need, what kind of training they need to that they can handle and they can understand these questions, what are relevant to the use of AI in healthcare. And then, of course, there's the public. How should we communicate to them, how they could understand when AI has been utilized in healthcare settings, what are the changes, what they should know, and as was highlighted also in the previous speech, that there might be also risks related to AI-generated information to patients, which are not perhaps based on the best available data. So we have roughly 1 hour time to discuss these things, but first of all, I would like to hear your first views and presentations. We have reserved some 5-6 minutes to each person, and then we have time to discuss. I may pose some questions, and of course we are waiting tough questions to the message wall. Just to inform, if you open the message wall, it opens in Finnish, but on the right corner you can change the language to English or even to Swedish, so it might be easier to use as such. But let's start with Thomas. So you have been working in the Council of Europe and in particular in the Committee for Human Rights in the fields of biomedicine and health. Please give your introduction.
Okay. Okay. Thank you very much for the possibility to have some introductory speech. Well, I would like to mention that the Steering Committee for Human Rights in the field of biomedicine is so-called CD-Bio. Yes, I have a very short presentation. Well, it's working under, let's say, on the Council of Europe, and works to protect and promote human dignity and fundamental rights and freedoms in the field of biomedicine and health. That is actually the reason why we issued the report, and the report is quite important document, and actually the whole conference is discussing the issues, particular issues which were actually mentioned in the report. I would like to mention actually that, quite for the Council of Europe, very important is the legal framework, but on the other way, the previous speakers already somehow preempted my speech, so this is somehow I was ready to talk a little bit more about Convention on Human Rights, European Convention on Human Rights, and the role of the Convention, Oviedo Convention, and European Social Charter, so I will just maybe leave more time and space for other speakers. But I just would like to mention one thing which wasn't mentioned until now, and it's the role of the European Court of Human Rights, because, well, by the interpretation of the European Convention on Human Rights, the court plays really very significant role. And to be honest, until now we have no cases concerning the AI, but as we already know, the court itself anticipates the possibility for unforeseen developments, and so we can let's estimate that there will be some cases in the near future where the court will take active role. Maybe a very important issue which will be mentioned again in the next sessions is the Framework Convention on Artificial Intelligence and Human Rights and the Hudhira methodology, and then our report. But looking actually at the, let's say, topic from the wider perspective, I don't want to mention and to go into deep into details in these conventions, but I would like to focus from the human rights perspective on this topic. So what kind of human rights are at stake? So if we look at the convention, it was already mentioned by the previous speakers again, it's the human dignity and individual autonomy. There will be session about this problem. Equality and non-discrimination, so it means from the perspective of the Oviedo Convention, it's the Article 3, equitable access to healthcare, and then privacy and personal data protection. And there's one very important issue in the Framework Convention, and it's the safe innovation. Well, that's this topic we actually are somehow, I wouldn't say missing in the Oviedo Convention, because the safe innovation is somehow part of the assessment of ethical committees of the developments, well, new drugs, new procedures. So this is already inherited somehow in the convention, but not that explicitly like in this Framework Convention. Well, maybe well, we are expecting in the CD Bio that we will have to just do some follow-up on the report. So we are expecting some new inputs and interesting discussions during the day, which can enrich actually our future work. So because we are right now in the stage where we are building new SAP, new strategic action plan for next 5 years. So we would like actually to just put our focus more on AI and the relationship between doctors and patients in like with the focus on the use of different uses of AI. And I think one of the biggest issues right now, and it was already mentioned, is and maybe it's one of the future work of CD Bio, it's how to actually build the AI literacy and critical thinking. Because we know that a lot of people are really relying on AI applications. They are using AI as a, let's say, especially the chatbots, as a psychotherapists, and they really trust to AI. And right now, a couple of days ago, actually, I read the news that OpenAI has introduced a shopping feature to ChatGPT, and it's a conversational shopping assistant. And well, until now, according to OpenAI, the product recommendations are generated independently, but focusing on previous scandal, for example, for Meta, where the advertisement was targeted based on mental states, then we just we be really careful, and we have to focus on building, let's say, the critical thinking by patients, but not only by patients, by healthcare professionals as well, because it's really important. So it's probably one of our main tasks in CD Bio, one of the future perspective. But I think there is another thing which we could probably do in the near future, because many member states of Council of Europe are right now in the process of developing AI strategies. So maybe we just can provide some guides for national states how to implement and how to interpret the Framework Convention and Oviedo in the light of the Oviedo Convention, and well, to really just build a, let's say, safe and trustworthy AI, and in this context to just put the trust into the relationship between patients and doctors. So the other ideas, I'm looking forward to hear from you, and we will just probably somehow summon all these ideas, and when I will come back to CD Bio, then I will just present them, and I hope we will have like building up on this conference, have a fruitful conversation and discussion within the CD Bio as well. So thank you very much.
Thank you very much, Thomas Doisal, on this very practical examples already. So, Marco Marcella, how is it going on within the EU?
Yeah, so, well, first of all, let me thank you for first the organization of a meeting on a subject that is very timely. And by the discussions that we already have attended so far, you can see that this is going to be very full of thoughts. So thank you to the organizer, thank you, Tula. It's very interesting to come to Helsinki for several reasons, not only because of the beauty of the country, but also because you get innovations in thoughts. And by the way, the discussions on the relationship between patients and doctors, mediated by in a trialogic approach, as our Chancellor of Justice more or less alluded to. I remember this was part of a meeting in 2016 in Oulu, where the first observation in say, if I have an AI system that is capable of determining the risk of having a secondary effect on the replacements of a hip based on the data produced in that specific hospital, should we tell the patient? Should we tell the doctor? How do we tell? And that, in a way, was the beginning of a journey that we are now assisting. And I say that it's very timely, this discussion, because as pointed out by the Minister and by the Chancellor of Justice, what we are talking about today, it's not yet another medical device. We are talking about an agency. And thank you very much for differentiating between, let's say, the different degrees of legal and ethical implications when it comes to AI, because in healthcare, because yes, talking about deep learning technologies for imaging analysis is not exactly the same as talking about digital therapeutics in mental health. So this is a very timely discussion, because those who like to read Nature, Lancet, Archivics, you see every day a new development in all possible directions, and they are very interesting, because it's pretty obvious that this technology will bring us efficiency, it will bring us precision, and it will bring us insights. So now the report, and I would like to congratulate the Council of Europe for the excellent report that is underpinning this discussion, because it does not only highlight the ethical issues, but it also underlines very much where one would see the future of technological development in this area, from imaging analysis to mediating the relationship between the doctors and the patients. So the first point that I want to make is that the European Commission here is looking, say, in two directions, two-dimensional problem. On the first dimension, we can include, say, the value chain where we are investing. And this covers research, it covers innovation, and it covers large-scale deployment activities. So we cover these three aspects, and I'm very happy also to see Saila here from the department, DG Connect Digital Department, because this is a joint, say, work across these dimensions, and it requires, as rightly pointed out in the final notes of the Chancellor, the convergence of thoughts of diverse community, which by per se it's a challenge when it comes to sharing vocabulary. But so the first I mentioned research to deployment, and when I talk about deployment, I would like to underline that this includes the way in which the medical professions will appropriate the technological solutions. And then the other, say, dimension, it's what we, so how we are going to address in which parts of the journey. And I think that we cover from prevention to early detection, to diagnosis, to treatment, and to care, the path. So the development of these technologies, say from research and innovation's point of view, to large-scale deployment does cover these aspects. And it creates, per se, a very interesting, for those that are working in this sphere, space on which we can work together. Now, if this technology, so the way in which this technology unfolds, it's pretty obvious, as we have heard. Even just looking at the ethical dimensions of the interventions by the Chancellor of Justice, it touches upon legal elements, ethicals. By the way, ethicals, as underlined, they cover the epistemic of AI, but it also covered the normative part of the equation and also the transparency part of the equation. So what one needs, and what is the approach of the European Union here, it is to create a conducive legislative environment that promotes innovation, that promotes safe innovation, that promotes trustful innovation. So the way in which we are working with this regulation is that essentially we, under everything that is, let's say, every legislations, by the way, recalled and mentioned today, are strongly underpinning on fundamental values, by the way, on our rights, or fundamental rights. And yes, we have the pillar regulations like the AI Act mentioned. We have the medical device and the in vitro diagnostic regulations, which will look at the safety of the solutions when it's put into the market. Let me also remind that you have the basic underpinning of developing good AI, which is data. You know, if I don't have the right data, you don't get the right AI. That I can tell you. I mean, I have personal experience on that. So the third, say, regulations which composes this conducive environment, it is the European health data space. So now, if we take the stance of creating AI, safe AI, trustful AI, the fact that we inject trust into these solutions, I can tell you that will also generate the demand for the technological solutions. You know, you don't want to put untested AI into a real clinical workflow. What you want to do, what we want to do, it is to create a legal framework that accompanies us in the development and deployment of technological solutions which require, as I say, different lenses. And let me distinguish between, let's say, deep learning approaches and generative AI approaches, because they bring, as mentioned this morning, different, say, ethical and legal implications into that. But we are very well equipped in Europe, because technically speaking, we have the two framework which are, it's a prime worldwide, because the EU AI Act, it does work on this risk-based approach to assess, say, and by the way, looks into generative AI aspects specifically for the development of technological solutions and for, the rights and obligations for those who develop technological solutions specifically to respond to the issues of accountability. We do have the elements of medical device regulations for the safety. By the way, both of them are based on the concept of notifications bodies in the member states, so there will be an articulations around that. And then the European Health Data Space, which will solidify the work in which health data is accessed across Europe for developing, including for developing AI solutions. And let me say that this is a Copernican revolution, because in an act that deals with data for primary use, so for curing Marco, we also have a part which is totally dedicated to health data of Marco to help somebody else. That is an incredible step taken by the European Union, totally underpinned by the General Data Protection Regulation, totally underpinned by the Network and Information Security Directive, which for those who like the subject is totally dedicated to cybersecurity strategy, which is the element which we need, and also by another regulation which is about identities online. So in a way, we have a unique legislative framework which we believe will be conducive to creating technological solutions that will be adopted. Let me close. I'm sure that we will elaborate over the panels and the day with a message that is very much linked to the closing messages of the Chancellor of Justice. So this framework has been created by us in Europe, completely enshrined in values, but it is exportable. But what I want to stress is that it is a shared responsibility to put these technologies at use in clinical workflows. So the meetings like today, when we exchange views from different domains, are not only interesting and important, they are needed. So thank you again very much for inviting us.
Thank you, Marco Marcella. And then from the OECD, Katarina Vujovic, what are your steps ahead? Thank you.
Thank you very much, and as well for me to extend my gratitude to the invitation and of course for the fantastic organization of this event. Now we heard that we're talking about the dimensions, and at the OECD, the current work that we are mostly doing is how to bridge two directions. We have on the one side innovation, where we're trying to speed, we're trying to have all of those solutions that are brought to the market. But the other one that we're trying to converge is actually how not to create harm to patients. And that's where we're trying as well to abide by the Hippocrates oath of doing no harm. And I would say as a general sentence that this is the main work that we are conducting currently at the OECD. But let me take a step back as well to what the Chancellor of Justice also said, is that we can all agree that AI is already impacting the patient-doctor relationship. How does it do? It helps to rehumanize this relationship by freeing up the time of the healthcare providers for tasks, for example, that are time-consuming or that they're being repetitive. And this as well helps to improve the quality and as well the trust in that relationship. We've conducted a recent study across OECD countries, and we found that in 95% of countries, AI is becoming almost a standardized practice, for example, in radiology, where it helps to improve the accuracy, but as well the speed of the diagnosis, and as well for administrative tasks that the providers is going to save up to sometimes 30% of their time for clinical notes, for billing, for scheduling an appointment. However, what this study also showed that despite those two wide use cases, they're still being localized and developed mostly in hospitals that do have the resources. However, we are not yet at the stage where we are capable of scaling up those innovations either at the national level or the cross-border level. Then the second point that this study found out is that in this relationship, which is being augmented by AI, there are new roles that are being created. And we came up with those so-called hybrid roles where professionals have one foot in the health sector and another one in the technology sectors. And for example, in the United Kingdom, we have the so-called digital specialized nurses or the AI safety officers in Japan. So this is already being created, and it's not just about new jobs being set up and created, but it's really how to support the workforce in transitioning into this new era, which is already here. We're not talking about a faraway future, but it's already in the present. And in parallel to those hybrid roles, we also have the back office workforce. Now, this spans across administration, technology, but as well managerial roles. And this is the part of the workforce which is important to sustain, but as well to help frontline professionals in how to learn and how to best leverage those tools on a daily basis to improve their daily workflow instead of creating an additional burden. And we see, for example, AI scribe are being widely used, but they save time, of course, but they save time if frontline health professionals know how to use it. And again, this is as well a tool to rehumanize this patient-doctor relationship. Now, as I said at the beginning, we are at this crossroad. We have to bridge innovation with professional responsibility. We have this sheer volume of technologies that are being made available at the health market, but the study I just told you about showed that healthcare professionals are not quite satisfied because it doesn't answer to their needs. And it is clear that clinicians are willing to use those AI tools. And across the OECD, more than 70% of clinicians are not being afraid by being replaced by AI, but they're afraid that they're not going to be included into this deployment phase of the AI, and as well, one is it being integrated. And even the recent report for the American Medical Association study found that one of the top priorities, top 5 even priorities of clinicians is that they require more guidance on how to use those tools. And this is where, again, we see that we are in this critical phase on how to bridge innovation with professional responsibility and effective leverage of those innovations. And this as well brings to the fact that there's as well cost behind this inaction. And according to this recent report of the OECD related to patient safety, we found that up to 20% of healthcare costs are related to misdiagnosis. And it's exactly what Marco said, actually, is that to have a reliable, safe, and trustworthy AI, we need to have the right data at the right time, for the right people, at the right place, that are going to ensure the scaling of AI. And lastly, there's also this importance to include, to co-engage the public and as well healthcare providers. And this is also aligned with one of the core principles of the OECD recommendation on health data governance. And we are, with any new integration of technology, we saw it with iPhones, for example, even before that with fax, with people who might have seen that. But we are, as I said, in this phase where we are trying to scale. Countries are still blocked at this level of scaling this innovation, either at a national or at a cross-border level. And countries should also be able to include the public and the healthcare professionals. And we are seeing momentum across OECD countries, for example, where more than half of the countries have set up formal processes to integrate both the public and the healthcare professionals. And I can just name one of those examples. Is, for example, France has set up this citizen assembly, which they started the work already last year, and they came up with this set of recommendations on how to continue the development of AI in the health sector by including the public more actively. And this is also one of the ways that the convention that we will be talking about today is also reinforcing.
Thank you. Thank you very much. Then David Ortiz from the WHO Europe region. What are your insights?
Good morning, everyone. First of all, I would like to thank the Ministry of Social Affairs and Health in the person of Tula, but also the Council of Europe and Lee for inviting us to this important event. And in these few minutes, I would like just to go very quickly through some actions that WHO is putting together at the moment to move in this area of work. Unfortunately, there is a lot of work to do ahead of us, and you can see, right? And this has been already highlighted for all my colleagues. We have basically split in these actions in 3 lines of work. The first one related to the country support that our member states, in the case of the WHO European region, represents 53 member states, about assessing country capacities to work on AI. So we have also conducted a study for our member states. We have a response from 50 out of 53 of our member states. So we have very good, solid data as an evidence-based organization that we are to really move safely in this area work. Well, safely is a critical word right now, but at least to move in a solid way. What we have found out, and the Councillor mentioned this as an important point, is the lack of governance. That is going to be a priority. It's a priority now, but it's going to come even higher priority for the coming years to come when it's about supporting the member states, the countries in governance on AI. This is a critical gap. From infrastructure, from the health workforce to the relation to the patient, and this has been highlighted in the report that the Council of Europe has published. But also we have the commitment and the request from our member states to come with a regional roadmap on AI in health. That is also a priority. And we feel very comfortable doing this due to this survey that we have. So we have the facts about how the European region should move, of course in close alignment with our partners, with the European Union, with the OECD, with the International Telecommunication Union, to try to have guidance in how we should move in this area of work. When it's about moving about technical work, practical technical work, of course, we don't have all the answers. We cannot do it alone. That is completely impossible. For AI and for everything. We are always relying on external support, right? So for that, we are establishing a technical advisory group that in WHO wording means the high-level advisory group that a regional director can have to advise in this area of work. So that is something that we are putting together. It will be composed of 10 experts. And I am so very pleased to say that one expert from Finland will be part of this technical advisory group for our regional director. As I have briefly mentioned, we conducted this survey. As a result of this survey, we are producing this report, the first of this kind, on the use of AI in health for our member states. And it will be published in 19 November, Malta. So it's a date that we already have to publish this report. Also linked to the first point related to assess country capacities, we are developing a toolkit for artificial intelligence in readiness and capacity assessment. That is something that we need to know and we need to do based also about what I have said, right? Technological infrastructure, health workforce, etc., etc. So that is something that we really need to move in this area. When we are moving about capacity building, we are producing a lot of research, but we also know that there is a lot of information and knowledge that is still not publicly available. So to address this important gap, what we are doing is to establish this kind of knowledge communities, communities of practices, to gather the real-time knowledge that is happening at the moment, but is still not captured in the literature. And this is the only way. As a result of the report that you have seen presented, is basically to put all the experts, all the knowledge, and start producing all this evidence that is still not available, but is very much needed because there is a lot of work to do. We have been also requested to develop high-level courses on AI for policy makers, particularly targeting secretaries of state, ministers, because there is a need to continue understanding this. We have seen that when it's about capacity building, there is a lot of work ahead of us. Based on the available data that we have, only around 20% of our 53 member states have pre-service or in-service training on AI in health. So this is a critical gap that we need to address. We need to address together, and we need to tackle from the universities for the health science curricula. So I know that this training for the ministers is not going to be the solution, but that is a starting point to also to work together to really change and shape the curricula in the health science degrees. And finally, just some basic information, but I'm not going through that, but just to know that we are planning different events on AI, that of course you are more welcome than to attend. I'm looking forward to the discussion to go in deep details about this topic. Thank you.
Thank you very much, David Ortes. And then Alex Yrttiaho, you are, after these international and intergovernmental organizations, you are representing a national government approach. And in fact, to refer already to the message wall, there is some particular questions concerning how we're doing this in Finland. But what is your perspective?
Thank you, and it's been already a learning experience to be with these experts. First of all, let's start with that the Finnish government restated in the government fiscal plan a couple of weeks ago that the well-being services counties that are responsible for public healthcare, public well-being, social welfare services and emergency services should fully utilize the possibilities of artificial intelligence to improve the quality of care and to reduce the burden of administrative work. So, from my perspective, I have to accelerate the adoption of AI in Finland and find ways how to do it in a safe and responsible manner. What we've done so far is that we have been looking at different use cases, about 50 use cases. What is the feasibility? How easy are they to implement? What are the impacts? And also their legislative boundaries. And we've found these 6 different contexts that are in the screen at the moment. And as Chancellor Post said, the legal bases differ based on which kind of a use case there is. So it's a lot easier to find the way forward when you go and examine a different use context or use case instead of looking at artificial intelligence as a whole in the healthcare sector. It's too easy to find challenges, to find problems when you're talking about that. In a general case, it's a lot easier to find solutions in the specific case. And in the excellent report, I found that it said that you have to balance progress and protection in adopting and applying AI, and that's something that we have to work with together to find the balance between the progress and protection of these technologies. We are, as the Minister said, we have around 200 different projects that we are monitoring on adoption of AI in Finland, and one key thing that we found is that since about last year, when people talk with me about adopting AI, it was always the regulation is preventing the use of AI and adoption of new AI tools. Now, in December, in November, quite a lot of people say that it's no longer a problem. It's something that we can work with because we know the regulatory guidelines and regulatory boundaries of using AI. The problems are more now in: do we know how to use the AI? Do you know how to change the processes and operating models of healthcare? Do we have resources to adapt to tools to support the healthcare sector? And these are very much different questions than 1 year ago we had. For some of the examples that I thought to talk about is what Katarina also said, is about automated scribing, listening into the patient-doctor conversation, patient-nurse conversation, creating summaries of those conversations, creating structured data out of that discussion, or automatic interpretation of those conversations, that you don't have to have a third party to make sure that the doctor and the patient understand each other. And in most cases, the summaries, the text is more understandable for the patient than the one that the doctor might write with all the shorthands and all the special medical jargon that they know, but the patient doesn't. So having better text, better summaries, it's something that makes it easier for the patient to understand what is happening, what are the things that I have to ask about, to make sure that I have autonomy? What are the questions that I can ask from somebody else, or go to ChatGPT and ask some advice from there? And having these tools, it does reduce the burden and the time spent with the computer, on writing on the patient summary, with writing structured data. But the question there is, what do we do with the spare time? Is it a time that is distributed throughout the day, so it doesn't really affect anything? Is it something that we can use to be more present and emphasize the contact with the communication between the patient and doctor? Is it something that we can use to get more patients treated per day? So that is a key question. What can we use with the time that we save by using AI tools in these matters? But those were the first thoughts for the panel.
Thank you, Alexei, and other panelists. I think it's quite clear that we see plenty of opportunities in the using of AI in healthcare, but there are some challenges as well as been highlighted already, and the work is going under. And there's a good discussion also on the message wall, not quite detailed questions indeed, but maybe one question I would first take on board is somehow there is need for kind of clear criticism in the use of AI, which all those involved should have. But whose responsibility would that be to learn the users, patients? Is it up to administration? Is it up to those companies producing these tools? What could we do even more to learn and teach those users of AI on, let's say, the good way to use AI in healthcare? Who would like to respond? Yes, Marco, please.
So, say that I can take this from the perspective of also the way in which the legal framework that I mentioned before is articulated, and essentially the producer of technological solutions, or those who put into service AI systems, they do have the legal framework for making sure that once there is an approval and you get the CE mark for putting the systems into services, this is done on the basis of a solid scientific evaluations with robust, data that you can show what you need to show to get the CE mark. The second passage, and that is introduced specifically with the AI Act, is that when it comes to technological solutions that continue their learning, it's not just a matter of, let's say, rechecking or repositioning or re-getting the CE mark, but is in a way to follow the way in which these systems evolve into this degree of autonomous that was mentioned before. Well, then the kind of rationale that you have in developing the technological solutions gets more stringent. And let me do one case, because here we seem to, I like very much Alex's distinction. I think that I will add a third dimension so it becomes a space, because it's true, you can cluster, let's say, the AI for quality of care and the AI for reducing administrative burden, which may probably be different. Now, sorry, I will get to the point, but allow me this. So one of the elements of reducing the administrative burden that Alex was mentioning is the scribe. So essentially a technological solution that mediates the discussion and takes note. Okay, so now let's take us 5 years along the road. And I say 5, and I think that I will be wrong for many years. 5 years along the road, the technological solutions will not only, make the summary, but it will also start interacting with the patients and the doctor. So when I start talking, well, the systems will tell me, well, there is a 5% possibility that this will develop a sepsis over the next 5 years. Now, to whom do you tell this? To the doctor or to the patient? Or should you tell it to both? So when I go into this exercise, well, then it's evident that the way in which the technological solution is passed into the market, it's included into the market, and the way in which you have trained the systems. For instance, if it tells me that there is a sepsis, imagine if there was a flow less into the data that led the system to say that it's 5% sepsis, you know? So this is the real advantage of the AI Act, and I'm very pleased to learn that it's not considered to be a barrier any longer. By the way, this is what we were predicating. This is a competitive advantage. It's not a barrier, because essentially it will help the professional also to manage with the output of a technological solutions where you can identify that there was a problem. So this accountability element is what is probably part of that discussion. Sorry if I was long.
And please give it to David next, and then we'll get Thomas.
Thank you so much. Very quickly, when it's about responsibility, I always like to talk about joint responsibility, right? I think that some of you, you're medical doctors or nurses, and you have been involved in developing electronic health records 15, 20 years ago. We were not involved enough developing these electronic health records. So we were basically told to say, hey, now you're not looking more at the patient anymore, you're looking at the computer. So now this is the new paradigm. So we have now to deal with AI, right? And I think that it's very important that we use this as a digital health literacy opportunity in which the doctor needs to know, and the nurse that needs to know that this is going to make them better, not worse. And that is the approach that we should take, right? I know that later today we will talk about health literacy, and Christine is here, that is the global expert on this. So looking forward also to that discussion in how with digital literacy we can really expedite this implementation. Thank you.
Thank you. And Thomas.
Well, actually, I would underline what was said right now by David, because I think it's a shared responsibility or joint responsibility. It's a part of the responsibility. And actually, well, it depends whether you are like looking at the responsibility from the ethical point of view or from the legal point of view, because then you can just come to the different, let's say, perspective and different results. So from the ethical perspective, definitely it's a shared responsibility. The one part is on the side of the producers, other side, like on the part of the healthcare providers, but definitely we can't underestimate the responsibility of the patients or consumers in a certain way, because it's the thing of health, AI literacy, critical thinking, and so on. And well, from the legal perspective, there are different angles, different, let's say, regulations on the national levels. So, well, the AI Act, well, actually, I think, will put aside very, like, intentionally the question of liability, and there was the intention to make a directive. Maybe you could probably just say something more about it, but as I understood it right now, it's like it was just put at ACTA, so it's not on the table anymore. But definitely there was maybe one of the future and possible burdens for, let's say, implementing AI Act, and so the legal perspective is completely different than the ethical, or not completely, but in a certain way.
Thank you. And Katarina, please.
Yeah, just if I may quickly jump on what David said, we have the opportunity not to repeat the same mistakes we have done with EHRs. And in this survey that I mentioned, what we see so far is that healthcare professionals are integrated into the process of developing those tools as well with technology vendors. But then suddenly, once it's being deployed in a clinical setting, and that we're also evaluating, is it really meeting the needs of the clinicians? What kind of impact does it bring to the patients? Then there's suddenly complete absence of those end users. And I think there's a real opportunity right now to bridge that gap, and as well from a technology point of view, to have tools that are not creating fragmentation and additional burden, but they're really augmenting and helping healthcare professionals in how they're delivering care. And this is something, an opportunity that we should take into account. And as well, when it comes to responsibility, this stage of deployment evaluation is critical in upskilling the professionals to provide them as well the critical judgment of the impact of those tools on their work and again on patients.
Thank you. One thing that AI does not help us is to avoid that time is running. So we are now approaching to the end. This has been a very, very nice discussion and at least for me a learning session. But to conclude, I would like to ask you to make one suggestion on or one statement. This is in relation to the question we have in the wall, which says that what topics should international standards address that they are not yet addressing, but maybe there are also other measures we could do. But if you have to choose only one, what could be your preference for the most important step to take? And let's start from the national perspective. Alexia, please.
Oh, maybe I'll say the same thing again. So find ways to split the problem in more to smaller problems, like what do we do in clinical healthcare, what do we do in the administrative works, and so on, so that we can actually find the right questions that are applicable in those specific cases, so that we can go more forward and faster forward.
Thank you. And David.
Thank you. Very quickly, I think that we need to fight, this is not a standard, it's just a thought, digital inequalities. So we are bringing and amplifying the gap, and we are leaving people behind. It's time that we are implementing this kind of technologies. I am not against technology, of course, because I work on that for obvious reasons, but I can see how we are leaving people behind, and definitely we need to consider the equity dimension with developing these kind of solutions.
Katarina.
It's tricky to come up just with one idea, but perhaps to go a step above to what you said is really to bridge again technology with the health sector. In that sense, to as well come up with AI health sector specific frameworks that are going to help us, individuals, populations, governments, to help to navigate this revolution that we are going through and how to best develop it that it would help our life on a daily basis.
Marco.
Yes, I agree. Reducing to one message is complex. I would, if I have to choose, I would build on the fact that this is a shared responsibility and that we need to focus over the entire value chain from research to deployment. And when it comes to deployment, it is there that it becomes a shared responsibility with the dimensions of engaging the profession. So continuing the debate and getting the, let's say, insights to inform further the way in which we go forward, also from a technological point of view, it is paramount.
Thank you. And Thomas.
Okay, I agree very much with the speakers. So it's very complicated to actually highlight only one thing, but definitely I think just we have already general principles for use of AI. Well, we have quite a robust regulatory framework. So now probably we have to really focus on responsible and safe implementation of those principles.
Thank you very much. These were 5 excellent statements, and I think we got a good agenda how to move forward, and many of these topics will be discussed during this conference later on. So I think our panelists need a good applaud. And then we will have a break of 20 minutes. Let's keep moving to get better health. Thank you.
Dear colleagues, now for the second panel. And our moderator is Pauliina Nykänen-Rettaroli. And I think you're presenting the panelists. So stage is yours, please.
Thank you very much. So my name is Liina Nykänen-Rettaroli. I work as the senior lead on human rights at the World Health Organization in Geneva, but I'm actually from Finland originally, so I'm very happy to be joining this event in my home country. It's really great. And I'm pleased to be moderating this panel which focuses on equitable access to healthcare and AI systems. We will be examining during this session on whether and how artificial intelligence can help expand equitable access to health services, and also to improve acceptability and quality, and to better respond to people's diverse needs. But we will, of course, also examine the risks and pitfalls and discuss what actions are needed to ensure that AI does not perpetuate or reinforce the existing bias and discrimination that currently undermines equity in our health systems and in our societies. We will also explore how AI systems are already shaping decisions about access in healthcare, whether it's through triage tools or diagnostics or other AI-enabled services, and how in this context do we ensure that we do not inadvertently further disadvantage those who face various forms of discrimination, whether it's based on gender, age, disability, gender identity, sexual identity, or any other status. And we have a really wonderful panel with us today. I think this is going to be really exciting. I'm just going to very briefly introduce them, and then we'll just delve straight into the discussion. So on the panel we have Ivana Bartoletti, who is a Global Privacy and AI Governance Officer at the Wipro, Digital Transformation Services for Global IT Solutions company. We have Sarah Cunningham-Burley, Chair of the Nuffield Council on Bioethics, Aleksi Pajunen, Teacher of Ethics at the University of Helsinki, Faculty of Medicine, Milana Trukl, a Senior Policy Officer at European Patients Forum, and Sinia Del Villar, Director of Data, Technology and Innovation at Data Pop Alliance. So let's start by just if each of you could identify one issue that we need to consider to ensure equitable access to healthcare and AI systems and to guarantee human rights. I know you are all experts and you have many different issues that you could raise, but if it's just one, what is that one issue? Let's start with you, Sarah.
Thank you very much. Is the sound okay? I have quite a quiet voice, but okay, that's good. So obviously very difficult with one issue, but I thought I would raise the potential expanding role of AI-powered health prediction tools and what this means for patient autonomy, collective versus individual responsibilities for health, the patient and healthcare professional relationship, and trust in our healthcare systems, particularly around the use of data and the need for AI literacy in that context. So following on from a point that David made in his presentation in the previous panel, preventive healthcare has to be considered in this AI space, and it's one that we might kind of put to one side, particularly if we're thinking about human-centered care and the specifics of a sort of consultative relationship. But nonetheless, this is a really important component of health systems, also one where we have to address the systemic inequalities that we all have to tackle in our societies. And in the context of the UK, where I'm from, those inequalities are widening. So what this means for public health is really important, but also kind of self-care and individual responsibilities. It's something that the Nuffield Council on Bioethics and Ada Lovelace have focused on in terms of the potential role of AI genomic health prediction. And while that science is still uncertain, there's a lot of investment in this area. And in the UK, with the kind of economic drivers for AI innovation, perhaps a little bit less critical attention to what the challenges of such a potential introduction of such health predictions into our healthcare systems. So there are numerous ethical and human rights issues. I'll just mention a couple before passing on so that we can all think about these. There's the potential risk for increasing genomic discrimination and amplifying health inequalities where patients' own capacity for making improvements in their health is limited by their social circumstances. Maybe problematic in terms of resource prioritization. If an emphasis is on providing efficient systems and kind of reducing demand for healthcare, the expansive potential of AI-powered genomic health prediction actually could expand the remit of healthcare with earlier and earlier diagnosis based on perhaps problematic risk factors and the potential for early intervention to be seen as the solution to what are often fundamentally social problems. So I'll stop there, but there are many, many more ethical and human rights issues, of course.
Thank you. Yeah? My voice is also quite low, so I hope you hear me well. Well, thank you very much for the kind introduction, and we're quite happy to have been invited to be part of this discussion. And going back to your question, we have discussed several times with patient organizations, individual patients and patient communities about risks, benefits, opportunities of AI. And the issue that has always been identified as the major risk for patients was the issue of bias and discrimination, as it was already mentioned. So really the issue of training AI on non-representative and biased data, which historically has excluded women, minorities, black people, people with disabilities, or even older people and those with the lower literacy, digital literacy. There is also the issue of anything coming from AI sometimes being seen as more objective. And so this kind of thinking that then this cannot be biased because indeed it's objective. So we have also seen that some patients have also identified this as an issue. On another note, when we discuss this issue of bias, sometimes we're asked by different stakeholders, is it really such a big issue, given that nowadays, I mean, historically, data has been biased, healthcare professionals, as every other human being is biased. And while that's true, on the one hand, we also need to think about how scaled up is the issue of AI. And it's if you use the data for, let's say, on a large scale, as AI could do, and then you use these inputs for national screening programs or anything that could impact millions, that it's not just as being one person that's biased or simply having a non-representative set of data. On the other hand as well, one issue that we usually point out is that even if something has been historically as it is, it doesn't have to be that we need to carry on like that. So this is now really an opportunity for us also to think about how to make those data more representative and how to use the inputs coming from AI in a more representative way, so that we don't use AI just for the sake of using AI and digitalizing the system just for the sake of it, but really trying to use these emerging technologies to do something for the healthcare system that can make it more equal, more equitable, and have a better access for everyone. And maybe it's already too long, so maybe I can pass the word to you.
Thank you so much, and I'll try to bring together in a couple of minutes sort of the perspectives of the more academic research I've done, together with many years in the NHS working on patients' data when I was living in the UK, and the business, so the companies actually developing these products. And I try, and I hope this is helpful. So I think the key issue, first of all, there is a lot of good potential, right? So I've been working on, for example, the improvement of data sets for clinical trials, making them more representatives, addressing an issue about the allocation of resources. So there is a lot of potential. The issue that I see across all levels is that in the 3 stages of the process, so the administrative task, the diagnostics, and then the choice of the treatment, across all these, we haven't got a clear understanding of what is fairness, for example, how bias may arise across all 3 specifically, knowing that there are different elements, the administrative, the choice of the treatment, the diagnostic and the choice of the treatment. And what I find is that organizations, often because they do not involve patients enough, stakeholders enough, they find it difficult, first of all, to understand what is fairness, technically, how it translates into sort of a technical methodology. So, of course, for example, if you look at breast cancer, it cannot be demographic parity because it wouldn't work. It only affects women, right? So what is the fairness? And the wider understanding about the structural inequality behind it. So we've been focusing a lot on technologies to debias these tools, okay? Which are very important. So, for example, we're looking at making better data sets, for example, by using and creating synthetic data. Synthetic data is something I work on a lot, and it's not an easy task because it does help us create data sets, which means that it helps you fill in the gaps when you look into them, to make sure that they are representative. Nevertheless, we're still not at a stage where we have the good representative synthetic data that does not de-anonymize after potentially anonymize the data. But there is potential in there. And I'm going to close on this. And what I was saying is there isn't a deeper understanding of the structural element of bias. Bias is not a glitch. It's inherent with our society, okay? So at the 3 stages that I was mentioning in the beginning, we need to understand the wider complexity of it. For example, let's look at the administrative part of the health. On the one hand, you could say, yes, I could use AI to automate, to make it easier for people to get in touch, to call us. But if you're not looking at the structural data inequality, at the fact that, for example, you can have some groups that are more reluctant to get in touch, more reluctant to want it to, or even more prone to cancel an appointment for many different reasons, maybe because they've got gig work, they're gig workers and they work in the gig economy. So the wider structural elements, I think, are very, very important. I am concerned that without a clearer understanding about the wider complexity of what fair and equitable healthcare means with their regards, we'll not be able to tackle the full spectrum.
Thank you. Well, thank you very much for the invitation and for the introduction, Lina, of this panel. So, well, I agree with all these issues that you talk about, and something that is I think that is very, very dangerous right now, in specific in the current context about the crisis, global crisis that we are living, is the commercialization of these tools and the profit-driven mindset of these companies that are behind these tools. Because what is happening that in general in Europe, for example, we have a crisis in the public health sector. So sometimes this type of tools take a look like an easy tool to take into my diagnosis, for example, if I am a patient. But in the other sense, I know that I'm leaving behind marginalized people with this type of diagnosis. So what kind of law, what kind of regulation we need to cooperate with the business? We need to take all this advantage of these tools that are in general, the private sector that is really, really advanced in that sense, but how we can cooperate as a government with this type of tools to avoid leaving behind people.
Okay, I really echo all the previous statements, and for me, I think the main thing we need to address, figure out, is what we actually want in the first place. Like saying we want more health and more value for life, those are good things, but we live in the world of finite resources. We don't have everything, and at some point we have to decide what we're going to do and what we're not going to do. And on top of that, our knowledge is not unlimited. We can't actually treat everything, and some treatments are more effective and some are less effective. the age-old philosophical question is the trolley problem, whether or not we say 1 person or 5 person, and if those 5 persons are going to die within a year, should that impact our decision? That has long since been a bit of thought experiment. That's not real. Nobody's going to tie people on rail tracks until we got self-driving cars. And now we have a unique chance to actually make it right and discuss it beforehand, what kind of heuristics we want to use to solve these kind of problems. And of course, in healthcare system, they are usually more sublime, but the same effect of like what we want to do is going to be there always. And if we don't know what we actually want, what kind of decision making we are going to use when we face these kind of problems, we are going to have a bad time. AI, as Chancellor Pösti said, it's a tool. At the end of the day, it's a mystified, glorified abacus. It's a really powerful abacus, I'm not saying otherwise, but at the end of the day, it's going to do what we teach it to do. And it's not going to have a bad day. Computers don't have good days, they don't have bad days. They are consistent, and they are, in that means, fair. But the problem is that it's going to amplify whatever we teach them. They are going to amplify our virtues, or they are going to amplify our flaws. And we need to be really cognizant at this point. Of course, the development and research of AI, we need to be ambitious. But when we are designing systems that are actually going to be utilized in public healthcare systems, that's the situation where we really need to know what we want in the first place. Otherwise, there is no discussion of how we are going to achieve that.
Thank you so much, everyone. Super interesting. I think from this panel, the first round, it's very clear that we need to think about the equality and human rights issues in each step of development and deployment of AI in the context of healthcare, from the building blocks, which is the data, to ensure that the building blocks are not themselves biased, so that we don't have then biased products. And then throughout the whole patient pathway, from the administration, diagnostic, treatment, how decisions are being made. And underlying all this, it's the structural inequalities, like you've mentioned, Ivana and Milana, you as well. And I think most of you have addressed this, that underlie the current inequities in our health systems. And these are either going to be amplified or reduced depending on how we deploy AI. And another important point about whether it's the development and deployment is motivated by a quest for profit or efficiency, or if it's motivated by a quest for increased equity in healthcare and in protecting rights. And you said, Alexi, that there's a potential to AI either amplifies our virtues or our flaws. So my next question to you is, how do we make sure that it amplifies our virtues and not the flaws? What actions are needed and by whom? Let's start with Sarah again.
Okay, thank you. So I think there's a lot of policymakers and health system managers in the room. So I think, and this was the case in the previous panel and the discussants here, how important it is to embed ethical analysis, including a human rights framing, but also beyond that, from the very earliest point of the development of innovation, and then to continue that all the way through to post-deployment evaluation, and they're including through trials. So we know how to generate evidence-based policy. That doesn't mean that policy making remains a political process, and we should take that knowledge into this arena as well. And we have to do that to prevent the reproduction of inequalities, but also ask the fundamental question, as Alexi has said. So what are we doing this for? To improve health and to improve health care. And so AI, if we use it uncritically without this deep and cautious approach to development, which is a real challenge given the pace of change that we are all directly experiencing, it will shape our systems and society, as we also are all directly experiencing, in ways that become impossible to unwind, even with good legislation and regulation that may be protective of some fundamental rights. And by that I mean that we may lose knowledge, both patients and healthcare providers, that will not be retrievable once AI is used in a much more embedded way in the healthcare system, or in a way that hasn't been critically evaluated. And as has already been mentioned, there will be processes of exclusion that will be also hard to overcome, which will result in continuing inequitable access, and all healthcare systems haven't cracked the problem of equal access and meeting the different needs of different patient groups. Thank you.
Thank you. So there are many stakeholders that are involved in this, of course, and I don't think that any of us could do it alone. So it's really important to ensure that there is this coordinated approach, but also the willingness to center the regulation, deployment, research, development on the real needs that a healthcare system has, healthcare professionals have, patients have. There is sometimes the issue of having a solution, looking for a problem, as some people say. We need to do the opposite. We really need to look what are the real needs of the systems and how we can address them. When it comes to policymakers, of course, there is a lot that can be done from the regulatory perspectives, and we already have the AI Act, which is great in that sense, but we'll still need how the implementation will happen, and then we'll see how we need to adjust some things, especially for the high-risk systems. Then on the side of the technology developers, it's very important to have this culture shift of understanding the importance of patients and healthcare professionals' involvement. That's not something that's nice to have. It should be something that's embedded, but it also, we have to avoid that it's kind of a box-ticking exercise, that you just have patients and healthcare professionals there and just saying that you have them, rather than really having the feedback loop where you can see if what has been expressed in terms of both nice things and bad things that they see, any fears that they have as well, it has actually then been implemented. And also, one thing that we usually support is, apart from indeed involving these stakeholders, is also in the technology developers, let's say, research team, have this diversity of people. And this way you can already, from the beginning, try to avoid this bias, because when you are hiring people, you can already have this diversity of perspectives, of backgrounds as well. And another thing I would highlight is to clearly communicate if there are any flagging systems for flagging up bias and discrimination, and then also try to explain how you're actually then acting on that.
Thank you. So I think a lot of organizations will either produce, or for a lot of people it would be in working in healthcare institutions, will be around procuring AI tools. So I think what is really important here is to make these systems work, is to really start, the key thing here is embed privacy, security, legal protection and human rights in the design, obviously. What does it mean? It always starts with the data sets. Really looking into these data sets and being able to interrogate them. This is the key point for me, interrogate them. It means asking the questions around why is this data here and why isn't this data here? Because every choice of elevating somebody to becoming a member of a data set is a choice that somebody has made. So it's really important that there is a clear interrogation of where is this data coming from? Who collected this data? Do I need to modify, massage the data sets? Do I need to identify other components that are not present into these data sets? But also look at the wider dimension, for example, of the equity into this. Because bias does not just come from a data set. If, for example, you're purchasing a system that is being trained with data in the US and you're deploying it in Helsinki, that's not going to work, because it's very likely that the system has been latching on to data coming from that area in the US where the system has been trained on. So all these questions are very important. That's why AI governance, which is crucial in deploying and developing and deploying these systems, has to bring together different areas of the organizations, including procurement, for example, when we assess these systems. Second, be aware that engineering fairness is absolutely difficult. So we should be looking at outputs, we should be looking at encouraging people to tell us when they think that the project, the AI outcome is not fair. And there's one thing that I wanted to say. We say these systems have to be explainable, and I really wanted to do like a bit of a provocation here. Explainable to whom? We've got to understand that in healthcare there is a conditions where if I go to an healthcare provider as a patient, right, I go in a situation of trust. I don't necessarily want to know how the system works. And I know the Chancellor first explained, how you can be the sort of doctors and nurses have to be the bridge between the patient, the AI system and the patient. But I think we have to be really careful when it comes to explainability. To me, it's the most complicated word and the most complicated concept when it comes to healthcare. First of all, because better explainability does not necessarily mean better functioning of the system. Although I believe that the system must be explainable, there has to be a reasoning behind them. There has to be, especially when it comes, for example, to ascertaining where the liability lies. But in terms of the explainability to patients, I would question that a little bit. Because again, we have to be careful in this field that we do not put too much emphasis on the recipient end of an AI system, rather than actually on the organization, the business that has developed that tool in the first place. Because if there is an imbalance in here, the concept of explainability, the system has to be fully explainable to the doctor. Obviously, although we are risking automation bias, although we are risking over-alignment where doctors feel emboldened with the use of AI, we face these problems. But we have to say that the doctor needs to understand what is happening. But when it comes to the patient, I think we have to be a little bit careful, because ultimately there is a relationship of trust where you trust the healthcare provider, the medic, to do what is right for you, and you are not always in a situation to really understand what the system does for you. I just wanted to point this out because I find that too much emphasis on explainability can be counterproductive.
Well, I will try to summarize my ideas, and I think that a key idea to try to improve all this strategy that we want to create is the co-design of AI system. And in this co-design of AI system, it's essential that these 5 persons or profiles need to be there. That is the policy and decision makers, the health minister, of course, university, research, and medicines, and not only in health expertise, but in other type of expertise like economics, demographics, etc., that are really related, climate change right now, that are really related with the health of the society. The civil society, with examples like the one of Milana, that is a great example that they understand the needs of the persons directly, and of course the tech companies. And in this case, I will highlight this strategy of French government, for example, that put together all the startups in the French tech, and they are doing really great jobs in each region, putting together the knowledge in tech with specific objectives, and that each person know each other, know what they can do, what they can't do, when they need to partner with other type of companies, etc., etc. So decentralization of tech startups is essential to understand the needs of each region of each part. So I think that with all these actors, we can co-design together AI systems that are completely useful for the society, and of course, design ethical frameworks that respect the human rights.
Yeah, I think I'm going to mainly echo what has been previously said, but as Sarah said, we really need to start the ethical discussion right away and before we start doing anything else. And we need to be conscious about all the steps, as Milana said, like what kind of key ethical issues there are going to happen, because they are going to be different along each step of the way. And if we are not if we don't have a clear goal in mind, we are going to have a bad time. When you are trying to deploy new technology, there are always a few options, and the main two are either that you first figure out what you want, and then you start to build from there, and that's going to be way slower. The other option is to kind of utilize something we already have, but then you have the question of whether or not this actually fits what we are trying to achieve. And in that case, we are going to face also the problem of who created this AI and what kind of assumptions they had, or whether or not they actually ever pondered the ethical questions, whether they pondered the questions of threshold values. We are going to have decisions like how much glucose is going to need to be in your blood in order for you to get diagnosed for diabetes, in order to get treatment for diabetes. And if we are not going to have that discussion, who gets the treatment, who gets not, and which treatments are available for who, then it's just going to be some random number somebody just puts there, most likely half an hour before they go to lunch, and they have low blood sugar at the moment, and they are not making their best decision. So it's either conscious or it just happens, and I would much rather prefer the first option if possible. So yeah, being conscious along all the steps is going to be important, or the most important action we can take.
Thank you so much, and it's very clear from this discussion that the action needs to be multi-sectoral. It cannot be just done by the health sector alone, and I think this whole conference is a very good example of having a conversation that goes beyond the health sector but includes law and ethics and technology. Aleksi, one of the things you said was, we really need to think about what we want, and sometimes the perspective of what people on the ground want, what patients want, what communities want may be forgotten, because it's the whole development is pushed by this quest for efficiency. So a question to all of you, anyone who would like to answer, how do we better ensure civil society engagement, patient engagement when these tools are developed and when these systems are put in place? Who would like to go first?
No, yes, yeah, it does. Maybe I can just start by replying what Ivana was saying about explainability, and I do tend to agree. Even now, when you think about many things, a patient doesn't know how it works. MRI, X-rays, and some of them have actual AI component. But what patients know is that those things have been embedded in the healthcare system for a long time, and they feel like they can trust this, they know that this can be safe. With AI technologies, it might be a bit different because it's something new. It doesn't mean that we need to know how every technical part of it works. But it's very important to know that healthcare professionals indeed know, that hospital managers know, and that there is a clear liability perspective. So who would be liable for that? And also, when something goes wrong, it's always good to know that these things are not hidden, that we are not trying to just pretend like we do sometimes with cybersecurity issues with hospitals, and that these things, that we know how we are actually addressing them. And then this connects also to your question, Lina. for example, what we do as the European Patients Forum in trying to engage more the civil society, we have the Data Saves Lives initiative, which is awareness raising about responsible use of data, basically. We're also trying to touch upon many different issues of digital health, including AI. We're developing very user-friendly tools like toolkits, we're doing boot camps, and we're just trying to address this thing objectively. So what's AI, how it can be used, what you can expect, liability issues, and then respond to any questions that patients can have. And then this can prepare them also for maybe being part of research groups, sitting together in the cohorts, trying to understand how things work, and then having actually meaningful opinion on something as well.
Great, thanks for those perspectives. Let's go to Alexi first, and then to Ivan.
Yeah, thank you. About the question of like how get people involved and how get their voices heard, we already have a handy tool for that, and it's called democracy and political discussion. Like that's the way it's supposed to work. That we actually give. Through the elections, we give power to people to represent us and take their time to actually explore the questions and hopefully listen to the professionals, both in healthcare system and ethics and philosophy, and whoever others voices are needed. And of course, this is a slightly idealistic view, and we definitely need to remember that democracy, or just having elections, is not alone enough. Democracy needs to come hand in hand with education and feeling of involvement of the people. This is going to go slightly on tangent on our topic, but that's kind of like my answer for the question. We just need to make sure that it works in the way we have intended it to work in the first place.
I just wanted to say on this issue around sort of patients and patients' involvement, and first of all, on the explainability side, I wanted to say one thing. I think we're talking a lot about trust, okay? And yet we are in a moment around the globe, yeah, where we're basically told that the European Union is lagging behind because we have the European AI Act, which I think is a formidable lie. The way we build trust is by making sure that whether it's an MRI scan, which has a component of AI, whether it's another machine that we're using that has an allocative function, defines whether you are in or not a service, the place where you end up in a list of patients going for a transplant, yeah, that system undertakes due diligence before hitting the market. This is important as much as you would not go on a plane if you didn't know that that plane had gone through diligence. You wouldn't simply go in because you'd be worried that the plane falls off. The same happens. This is why there is something positive, not all great, but in the approach of the European Union of saying high-risk AI undertakes assessments so that from a product legislation with a twist of the fundamental rights dimension, it's not purely product legislation, but what we say is before hitting the market, this is what it has to go through. Okay, this builds trust. Trust builds use, and use builds, I think, sort of growth within a country. Now, this is very important for patients. The reason why I'm always concerned when I see things like explainability is because I come from the privacy world. And the privacy world is all the onus on you as an individual that you need to know what happens to your data. Whilst in reality, we live in a black box society and digital ecosystem where you can't possibly know what happens to your data. Nevertheless, you're responsible for it. And the same to me applies when it comes to these machines. Because I wouldn't want to have the onus placed on the user, the final recipient of that, having to check whether that system is fair or not. But I would want the design to have fairness and legal protection and equity inside of it. It's not, if not, to me, shouldn't even go to the market, as we're doing for other industries. I do believe that the civic society, as well as patients, talking with a medical language, are the immune system when it comes to AI user deployment, in the sense that patients, they are the ones who basically, and all of us, are the ones who in the face of so much hype around artificial intelligence, are the ones who can say, actually, you know, the using it for purely efficiency is not going to work. Using it for pure productivity is not going to work. Also, we know that until now it's not that we've had so much progress in terms of productivity gains across sectors. So what I'm trying to say is patients and civic society role is crucial in here. And because it's actually us all together then who are the ones at the recipient end.
Sarah, did you want to come in on this as well?
Yes, so just quickly, 2 points. So one is in relation to data. So of course there's no AI without data, as Ivana has said, but we also have learnt a lot from how we have handled health and health-related data, particularly in the UK and in Finland as well, I know, and elsewhere. So we should take that learning. How have we engaged publics and patients in that to develop robust social contracts, as well as the legislation that frames some of that? But contemporary moment challenges that. And it challenges because the boundary between those data-generating activities that are for research and care, in the context of research and care, then I think we have to rethink what consent and autonomy means in that regard. If your data are going to be used for your care in increasingly complex ways, and that will also include the interface between population data and your contribution to those large data sets that will impact on your care. So we can learn from the way in which we engaged publics and other stakeholders in shaping how we frame our data practices into this new arena, and we should start doing it straight away. So we develop a new kind of social contract for the AI-enabled health world. Coming back to explainability, I think there are situations, in particularly kind of high-stakes prioritization, and you mentioned transplantation, Ivana. So one of my PhD students has been looking at this area, and actually, as the Chancellor of Justice said, we can look at kind of prior technologies that can really help us deal with what we're having to deal with now. So we already use algorithms. They've been used in healthcare setting, you know, for decades and decades, and they are becoming ever more complex, and they are used for prioritization, including in the transplant world. But you would want to be able to explain to your patient why they are or are not top of the list for the next organ. And an intrinsically opaque machine learning system will not enable you to do that. Other systems might enable you to do that. And so it might be important in a clinical context to demand explainability in a particular application of AI. In other contexts, it might not be important. If it's a kind of national context of where do we put the most services, because we have worked out using complex AI-enabled algorithms to do that well, that might be much less important that you need to explain that. But there are situations where you definitely may need to explain it. So context becomes very important, and there's definitely not a one-size-fits-all approach to how we manage that.
Thank you. Did you want to come in as well?
Yes, I think that it's really, really important to take into account the main principle of responsible AI, that is that we need to create human-centered AI systems, especially in the health of people, and that we need compassion and empathy for these systems. And what the people need is not the trust or the veracity of the diagnostic or all that. Is the compassion and the empathy of the person that is in front of these people, right? So this is a tool for the medicines. This is a tool for society, but we need the human there with compassion and empathy before all the things. We can come back 50 years ago and remember, for example, the medicines in your region, the medicines that are the preference of all the people were the ones that they are really compassive with their patients, that really maybe they were wrong in their diagnostics, but this type of relation is the relation that remember us that we are humans before the tool, right? And not to put the tool inside of the decision of all that. Okay, the tool will do the decision. Maybe it will be wrong because it is, of course, we have a lot of metrics to measure, etc., etc. We will try in the technical part to improve all these metrics, etc. But sometimes maybe the tool will have wrong results. But the important here is the compassion and the empathy between humans.
Thank you so much, everyone. We still have almost 15 minutes left of this discussion, and I'm hearing many things. On the one hand, AI is just another tool, like other tools that have come before, but we are right now in a situation where we don't know yet enough. The development is turbocharged, it's moving fast, and we need to make sure that human rights, equality issues are addressed when we are moving forward. But some things remain the same, that they need to be at the center of the discussions. And one thing that I've heard a lot is trust during this discussion, but also the previous discussions. And of course, when we are talking about the accessibility to healthcare, it's not only about access, it's also about the acceptability of services, the quality of services, and trust plays a very important role there. So how is all of this development impacting trust between the health service provider and the patient? And who are we trusting? Are we trusting you, Milana? You said earlier that we see often the AI as more objective than a human healthcare provider. Perhaps we think that the same biases that the human provider might have are not present in the AI. Are the patients empowered because they can get more information from these language models, or on the contrary, are they getting this information that disempowers them and makes the doctor-patient relationship more difficult and impacts negatively on trust? Any thoughts on this issue? Alexia, I think you want to go first.
Thank you. I don't think patients need to get this information for being unempowered. Even with information, without proper training to put it into context, you are probably disempowered quite a lot. So on top of that, if you get problems over there, that's going to be an issue. I think how we keep people involved in the decision making and deployment is definitely a question, but also there are going to be some kind of temptations we have to deal with when we develop the AI systems. The main question is whether or not the research and the development and deployment should be driven through public and government or private sector. And with public sector, we have two temptations. They are inefficiency and corruption. And with the private sector, we have one temptation, and it's greed. And we need to be cognizant of those temptations and evaluate how we can dodge those. Also, speaking of trust, I think we have talked a lot about trusting the AI and AI systems, but in every possible tool we have, the user is actually the most problematic part of the chain. As long as people keep using their birthdays as passwords, we can be certain. If you didn't laugh, you should probably change your password, I'm just saying. As long as that's the situation, somebody somewhere is going to copy-paste all the patient data into some kind of let's say, just any open internet AI that we have at this moment, and then all that person's private information is who knows where. And there are going to be so many different ways we can mess things up on the user level. And in order to create security measures for those, that's going to make the systems more complicated, and that's going to, on the other hand, limit the equitable access for people if they are not tech savvy in the first place. So how we deploy things and how we deal with temptations of inefficiency, corruption and greed are definitely going to be a problem, and we need to address the question of how the people are actually utilizing the AI once we give it for them for their everyday work, for the situations where they contact the healthcare system, or you name it.
Who'd like to go next? Ivana? And then Milan.
Choose. I think there is a trust that's got a lot of elements, but I just want to name three very briefly. The first one is, and I don't want to be polemical, but is that I think one of the key risks for health is disinformation. And that has a massive impact in the relationship between, I think, the healthcare system and the user. I mean, the pandemic was an infodemic. Before people would go to a doctor having Googled all the potential symptoms and say, I've got this and this and that. Now, a lot of the things that they would ask the various off-the-shelf API, whatever, LLMs, they would eject a lot of disinformation, or there'd be a lot of generative AI being used to produce and target individuals based on specific characteristics, or what is so-called clustering. So first thing is, I mean, how much is disinformation, fake news and all of that artificially generated impacting on the relationship between the individual and the healthcare institution? And don't we in healthcare have to start to consider disinformation as a public health emergency? One. Second, relationship with the doctor. Again, trust is a very complex issue, because you would, if a doctor comes to you and says, well, actually, I have failed, you would understand, but patients wouldn't understand a machine failing, right? So we've got to consider, how that, how how is the patient going to react to the machine failing compared to a human failing? Because the humans failing, making a mistake, and doctors making is very much in the norm. So I think it's accepted. But these machines do fail, and they do fail a lot. And so we have to understand how that is also going to impact the relationship. And the last element, which is the one I'm most concerned about, is the automation bias. I mean, the fact that you're going to have loads of people across the various stages of healthcare relying on these tools, thinking that they are better, and also having this issue of over-alignment, because you feel that you're using them. When, for example, a doctor or asks one of these tools, am I correct in saying this and this and this? You may notice that all these tools, they say, yes, your response is great. So we are growing up with a generation of medics who are basically being pumped up and saying, yes, it's like a generation of medical students, because these tools, they act and they always encourage and push you and say what you've done is great. So how this is going to impact on medical knowledge, how this is going to impact on the relationship with the machines. I mean, to me, these are the three trust issues that I would like to, if I go back into academia, I would like to study, but...
Sarah.
Yes, I agree around, we really do have to deal with knowledge and the construction of knowledge and the training of the next generation of our healthcare professionals here to guard against a loss of what is sometimes deeply experiential clinical knowledge that will have fed into the AI systems, but once that knowledge becomes diminished, it will no longer feed into the data in the AI system. So there's a kind of a loop of diminishing returns there. But I wanted to come back to the role of the commercial sector here, and the importance in the UK context, and I'm sure elsewhere, of novel public-private partnerships, sometimes not-for-profit, but not always not-for-profit, and the real need to engage civil society in those partnerships, and to have increased transparency about the role of those partnerships, and sometimes indeed the individuals that are advocating for them or leading them as well. And I think that getting that right, or getting taking society along with, civil society along with, will generate effective partnerships that are trustworthy. And I think the trustworthiness in those emergent systems is what is really important. And one way in which one might consider how to do that is having some really good models of benefit sharing. So being able to articulate what the benefits are and for those to be shared in a sharing of profits, for example, back into the health service. I think there are also issues around trust at the kind of level of interaction, kind of one-to-one interaction. But I think that kind of trust is easier to preserve in some ways. It's the very basis of the relationship between healthcare professional and their patients, but much harder to maintain if the healthcare system within which that is embedded ceases to be trustworthy. Thank you.
Milana and then Sinia, quick reflections on the issue of trust.
Briefly, even as a patient representative, it's very difficult for me to explain who we trust most, as you were asking, because it's a really personal thing. We cannot think about patients as a one whole community, because our trust really depends on the experiences that we had, on disinformation, of course, on how much we're exposed to it, but also how tech savvy we are and how tech enthusiasts we are. So every patient will have a different relationship with trust, and they might trust the doctor more or the AI system more. And now we are doing another survey on AI, and we hope that it's going to be quite representative. And we ask this specific question. So if there is a difference in opinions between AI system and the doctor, who would you trust? Would you ask for a second opinion, and whom? Doctor or AI? And I'm sure that there won't be a representative answer, that there won't be a decisive answer. They will be all very different. So we need to take into consideration also the personal experiences and environment of the patient.
Well, I think that one of the variables that is really important to take into account is the age of the patient, that we don't need to take all together. For example, teenagers right now, when they are interacting with generative AI algorithms, they think that ChatGPT, it knows all the things and it's the only answer, right? But it's completely different with persons that, or with older persons that they don't trust at all with ChatGPT. So how we can manage this with programs and strategies of AI literacy, capacity building of the population, etc. Education programs that includes artificial intelligence really in their education of our new generations.
Thank you, everyone. We are running out of time, but I hope everyone in the room has enjoyed this discussion as much as I have. It has been very interesting. I think from my perspective, the key takeaway is that all this development is happening in the context of existing inequalities. And we have to take that into consideration as we move forward, because we are going to move forward very fast. And we need to think about what we want. Do we just want more efficiency? Do we want more profit for our tech companies? Or do we also want increased health equity for all populations, and keep that in mind when in all different parts of designing and deploying of these systems. Thank you very much to all panelists. It was really great. Thank you so much.
Gosh, I wish pieces of it.
Thank you, Lina, the panelist. And we go to the next session before lunch. So the third session is about the patient autonomy and AI systems, and Christina Sørensen is already here, the moderator, founder of the Global Health Research Academy Denmark. And then I call upon the panelists, Isabelle Abrayi, yes, please. Legal advisor, Yerevan State Medical University, Armenia. Thomas Dolezal, Good. Yeah, good. And then Enni Sandmark, Ersa Selmani, and then Ildiko Vadja. Yes, please.
Good morning. Yes. So nice to see you here. I know it's a very intense morning with very packed sessions, and it's been really very interesting to be here. And I'm honored now to be moderating this session on patient autonomy and AI systems. My name is Christine Sørensen. I'm the director of the Global Health Literacy Academy. I have a background in public health science. I've been working with the Council of Europe to develop a guide on health literacy for equal access to healthcare, which was launched 2 years ago, I think. And then last year, I had the opportunity to work on a report, a technical report on health literacy as a human rights concern. And basically, it was absolutely devastating because if you look into different population groups, it stacks up with adversity and difficulties in our societies on how we shape health literacy and equal access. And this is why it's so relevant now to discuss patient autonomy, patient empowerment, patient health literacy. So in this panel, we will talk about the patient's perspectives first and foremost. I've asked our panelists to introduce themselves shortly, just very general introduction in the first round. And maybe Ildiko, we could start with you.
Yes, thank you, foremost, for inviting me and the opportunity to share our experiences in the Netherlands. My name is Ildiko Vajda. I'm a senior advisor, policy advisor in the Netherlands on digital health. I'm working at the Dutch Patients Federation. That's an umbrella organization of almost all disease-specific patient organizations. And I'm there working on secondary use of data and AI. The past 5 years, I've been leading projects, but also participating in projects aiming at the development of trustworthy AI that is patient-centered and that really meets the needs of patients. As we heard in the previous panel, sometimes it's not the case. But most importantly, in co-creation with patients. And that's a journey we have undertaken and we are pioneering in. And maybe just to say that the Health Data Access Body that is being set up in the framework of the European Health Data Space, I'm chairing there the Societal Advisory Board.
Thank you. And a general introduction from you, Ersa.
Yes, thank you. Good afternoon, everyone. It is an honor for me to join this conversation at the intersection of AI, healthcare, and human rights. My name is Ersa Selmani. I come from Kosovo. I'm a digital health researcher. And over the past few years, I've been testing a humanoid robot intervention. And so many questions have arisen all the time, especially regarding autonomy. And despite the fact that the intention was never to replace healthcare professionals, and the intention of the research was good, there are still questions like, for example, can AI actually respect a person's agency? Or can AI truly understand why someone would want to make behavior change or resist behavior change? Because that is the topic that I'm researching. And then also if people, me for example, I do not understand how AI works and I do not understand how it is engaging with me and where does my data go, am I truly giving informed consent? Is it really informed consent? So this is something that I would like to explore in this discussion with you, and maybe discuss whether in this AI age are we empowering patients, or are we stripping them of their autonomy? And my input will be based on the experiences from my research, but also the talks that I have daily with young people from different countries, different backgrounds, and representing the diversity of young people.
Thank you so much. And then we have the research perspective represented by you.
Yes, my name is Enni Sanmark, and I'm a physician, and that's like a one point of view I watch this issue, that's like a physician and interface with patients, and then I'm like a researcher and research group director, and we are studying the AI, and we are like in my research group we are studying the performance of AI, but also like measurements and effectiveness, because it's not only about the performance. We know that technology is good, but is it like how about its effectiveness? How about like a patient interface or professional interface? So is it still something we should use, and where and how we should use that? So it's like my issue and topic here.
Thank you, and over to you, Thomas. I know you've been on the stage already, but please introduce you again, your general work, day-to-day work.
So thank you very much one more time for inviting me. I would just take the opportunity to maybe introduce myself from other perspective, because I'm not working only in the steering committee for human rights in the field of biomedicine, but I'm a lawyer, and I am actually teaching at the university. And I am the head of the Department of Civil Law and the Research Unit for Medical Law and Bioethics at the Academy of Sciences in Czech Republic. And I am lecturing at the Institute of Medical Law and Public Health at the Faculty of Medicine. And I have courses on medical law in the Faculty of Law in Prague. So I'm focusing for quite a long time on the issues of autonomy and the relationship between doctors and patients. I just listed 4 monographs which I published actually during the last 2 decades. The first one was the doctor-patient relationship in the private law, from the perspective of private law, then was protection of patients' rights, and the last one, which we published actually last year with my brother, it has more than 600 pages. It's informed consent, ethical and legal perspective, where we just describe, like we have, I would say, over 100 pages about the problems of autonomy.
Super, thank you so much. I think many of us are wearing many hats, but it's a pleasure to have you here in the session. And then we have Isabel. Yeah. Yeah, I think it's on from Armenia.
Good afternoon. My name is Isabel Abgaryan. I'm from Armenia. I'm representing Yerevan State Medical University. I'm a legal advisor to the rector, but I'm also a chair of Medical Ethics Committee of Armenia, which is investigating the breaches of Code of Conduct, Code of Ethics. So fortunately, we haven't yet any complaints about AI ethics breaches, but I'm afraid in future we definitely will have, because AI is increasingly dominates and increasingly encompassing in our lives, in every aspect of our lives. So I'm definitely sure that problems, of course, artificial intelligence, and especially artificial intelligence in healthcare, is a tremendous boon, and it can give great benefit to people's healthcare and overall healthcare system, but it also can inflict many problems, autonomy-related problems, because people sometimes do not know what they use what is artificial intelligence is. We have a problem, lack of understanding what is, because we are coming from a different part of society. We have different understanding of things. We have different education levels and different maturity of understandings what is healthcare. When we are using AI, especially when we use AI systems autonomously, just for us, not communicating with doctors, we can have many problems of understanding, and we can harm ourselves. It especially is very serious in the countries where the health systems are developing and not everything is regulated between doctors and patients.
Yes, I think you're raising a very valid point here, that it's kind of everyone is on a journey. Some are front runners, some are just at the start trying to set up systems and frameworks, and before that filter through to daily practice. It's a long journey and a long-term vision that we are on, and that it can also be a curse and a blessing. We try to make use of the best opportunities, but there are lots of challenges. And may I ask you, Thomas, to kind of set the scene. What are the challenges that you see from a patient perspective with regards to autonomy?
Well, yeah. Should I go straight to the challenges? Okay, because I thought I will just...
I think this is what we're here to address.
Yeah, no, I was thinking like to maybe summarize some key messages from the report.
You can do that, yeah.
Well, because then we can just build on those key messages. So I would like to highlight some key messages from the report. As we already have heard, the AI is rapidly changing and transforming the healthcare. It brings promising improvements in diagnostic, treatment planning, administrative efficiency, but also, as was already mentioned, it raises complex ethical and legal questions, especially concerning the patient's autonomy. And when I summarize the main findings from the report concerning the autonomy, then patients should be more aware and critical of AI system used in their healthcare, to know when they are interacting with an AI systems, to be clearly informed and explained about the use of AI in cases which matters to them, and to be able to accept or refuse AI in their care or treatment, and to this end seek a second opinion without the use of AI systems where possible. So those are the most key element of the report concerning, let's say, the autonomy and issues of autonomy. And well, going straight forward to the challenges, I think we already heard some most important challenges here from the previous speakers, although the session was about the equitable access. Then it was mentioned that one of the most problematic aspects is the explicability or explainability of the AI. And well, right in the beginning, I would like actually to disagree with the speakers from the previous panel, because from my perspective, the AI is not just another tool as the other tools are. It's completely different. It's completely different, and maybe there was a certain lack of differentiating of the tools which are used in the healthcare sector, because completely different story we can say is by using the AI as a diagnostic tool, but very complicated issue and concerning the autonomy are raised by using the AI tools as a chatbot for mental health and probably as a prognostic tools. It's completely different, and why I don't disagree that it's just another tool as a previous tools. Well, because AI, well, and one of the main features of AI is the opacity. So there's the AI is actually learning, and in a certain extent we don't know how it's learning. So there are used the opaque algorithms, and it's called like, well, we are looking at the AI sometimes as a black box. So for example, by the examples which were like discussed previously as by the transplant algorithm, well, we know the algorithm, and they are used, and they are explicable, they are explainable. But AI doesn't work in all cases like this. Well, there are algorithms which we are right now not able actually to explain. And therefore, I think the explainability, or as many I think legal documents or recommendations are calling this right, it's right to notice an explanation in healthcare. It's very useful and necessary to mention as a basic right of the patients, right to know that the AI was used. And then maybe we can discuss further other issues, but this one was like the main challenge from my perspective.
Thank you so much. Actually, I'm having this discussion with my ChatGPT at home. So I'm asking, so what is health literacy? And it defines health literacy as the ability for individuals to find, understand, judge and use information to manage their own health. Then I say, dear chatbot or dear ChatGPT, this is not true. Health literacy is a two-sided approach. The system also has a place. It's not just to blame the individual. So what happened is that it's learning. So now when I write, what is health literacy? It says health literacy is an individual and systemic approach. And according to the model of Christine Sorensen, you will see that it's interactive. So it's telling me what I know, of course, but I don't know if it's only telling me because I trained it, or it's something that it now shows to everybody that health literacy is an interactive approach. So we have these discussions and trying not to blame patients only, but because they have an autonomy role. It's about having discussions with their healthcare providers. Can we have your perspective, and then we will have from Annie afterwards?
Yeah. May I just briefly reflect on the previous speaker before I sum up my challenges? I agree. And I also disagreed with the previous panel on the issue of explainability. I haven't heard the word interpretability. I think it's very important for the doctor or the nurse who is using in the medical setting the AI to be able to interpret the outcome. What does it mean? What does it mean for the patient if it is shared decision making and discussing the options and the preferences of patients. So that's one point. The other point I also haven't heard is the lack of causality that AI is having. So it's all associations and correlations, and that's also very different characteristics from previous device or technologies. So the arguments like patients do need not to know that AI is being used is not really a favorite of ours, and that leads me to the challenges that I have identified. Again, based on the many projects we are involved with concrete use cases. First challenge is that the doctors, the healthcare professionals, are prone to withhold information of that AI is being used because they find it very difficult to explain to patients. So there's and also a little bit of fear, like if I use it, I will get a lot of questions, and I have no time anyway. And also they think that patients will be confused by the information. and also they don't need to know. So these paternalistic attitudes are coming back when we talk about AI. The other challenge, I think, and that I conclude from the projects we are doing and we did on preventive medicine, is the right to remain uninformed, because that aligns with patients' value of psychological well-being, not worrying, etc. And I think that as AI predictive models are becoming more common, it will give a kind of pressure, maybe a moral pressure, maybe societal or peer pressure, to use these devices and models, and that respecting the right not to know, to remain, uninformed, is a real risk, I think.
Thank you. And let's ask Annie if this is something you recognize from your work.
Yes, and maybe I'll take that physician role now. But like, I really agree that we should be like transparent towards the patients. But the doctor's profession is not easy at this point, and when like adding AI and explaining patients how it works, is it like can you trust AI, everything? So to that like 15 minutes you have with patient, and then you should educate that patient not only like regarding their health, but also about like using AI in a medical system. So it's like a mission impossible, and it's something like I think that one main point is like whose role is educate patients, whose role is educate our system, because maybe doctors are not like a best like choice for that. And if it's doctors, then we need to resource and educate those doctors to do that, because they are not like maybe good and like prepared for that. So I think I really understand that we need to do that, but it's like a systemic choice. And as I maybe mentioned, that I think technology is ready for diagnosis and everything, and it's good, or it's good enough. It's better than we as doctors. But like, and I think the main issue now, which is like linked to that like earlier, is that change management. The change is so huge. It's like bigger than that we have like an interpretation of the like ECGs or some like a small AI tools there, or more like automation tools. But it's like a so huge step that like a change management, how much we resource, how much we educate those systems and those professionals, is something we really need to do, because otherwise we cannot provide patients to their rights, because we are not like able to do that.
Thank you. So you're kind of indicating that the digital revolution has not yet reached the medical schools? Or?
No. Or if it's reached like medical schools, it will take like 6 to 10 years that it's there in a field. So I think we need education like for those professionals who work there, and they really need time. It's not only one day education and then like the same thing like working, but we need to resource that like over the time, so that they really have time to understand those technologies, so that they can explain this to like patients. And maybe we need to educate patients like through communication, media, something which is not happening there in a doctor's appointment.
Thank you so much. Ersa, can we ask you about advice on digital health transformation? And I would also be curious to hear from you whether it's a generational aspect. Can we just take for granted that all young people, they know about AI now?
Yes, and I was so happy when Zinja earlier talked about how young people see or think that ChatGPT knows everything. I would take it kind of a step further and say that young people right now think that ChatGPT knows them best. And this is where it becomes very scary in a sense, because they automatically kind of transfer the right to ChatGPT to make decisions about them or to influence their decisions, because they believe that ChatGPT knows me best already enables them, ChatGPT in this case, to make decisions for us. So this is kind of where the generation stands right now. And as I said, I have talks on a daily basis with young people, and it's a huge amount of people that tell me that they are using ChatGPT as a mental health support, and they are not paying their therapist anymore. And the thing is that, okay, right now this is the reality, but in a 3 years, 4 years, 5 years time, it could reach to the point where ChatGPT detects, or whatever system detects, some patterns of potential suicide, and let's say notifies the authorities without asking us, would you want to call the emergency or the hospitals? And or other potential scenarios where a system, just because I'm feeling sad or depressed, disables all the sad music for me or all the sad content, when in reality my dog just died and I really need, to listen to a music that I like. So, and this without asking us, without, getting our consent on this, becomes very dangerous, and it has the potential to diminish patient autonomy and not deepen it at all. and sorry, I just would like to bring this new cool kind of fancy word that I've been hearing recently, which is digital paternalism, and the kind of potential that systems make decisions for us without even including us or keeping us in the loop. And this kind of trend with ChatGPT and other AI tools and systemic tools might also lead us towards digital paternalism.
Before we take a new round, I'm also curious to hear from you, Isabel. What are the challenges that you see? You alluded to a few in the beginning. What else have you on your table that you try to deal with in Armenia?
Well, again, it's about literacy and maybe about education overall, because we have to understand to what extent we should deliver information, who should deliver that information, and questions like this. So maybe we miss something, our generation, and must think about future upcoming generations. So first of all, we should think not only raising literacy, but we should educate people, and it should be started from the beginning, from the general education. As I'm not mistaken, recently United Arab Emirates makes mandatory AI learning in elementary schools. So I think this is the right way for us as well. It's very difficult to change educational syllabi, to make very modern and understandable educational programs for youth, and again also for the universities, for medical professionals, make educational programs or change them about AI learning. It's very difficult, costly, but it is the way that it's the way that can make our healthcare system very patient-centered and protect our right to know, to be informed, because only informed and educated health professionals can give us necessary healthcare, and they can give us necessary information to make very thoughtful decisions. So I think the first maybe thing that we should do to make necessary changes in our educational system, beginning from the general education.
So you're raising the point that we need to bring the digital revolution to the teacher schools as well as the medical schools. Ildiko, we're now changing from challenges to solutions, because if we just keep on making a long list of challenges but not bring up any solutions, we'll not come anywhere. So what are you doing in your organization, and what are the things that you can recommend that we can move on to?
Our role is twofold. So we are at the national policy tables, discussing with the Ministry of Health and all other organizations about the AI roadmap. And there are some priorities made by the minister on generative AI and using it for speech-to-text use cases, like summarizing from EPDs, but also recording the conversation of patients with the doctor and putting it as structured information in the electronic healthcare records. These are all nice initiatives, and we have to fight for our place, not only at the policy tables, but also in these projects that are aiming at co-designing with patients and citizens, because I think that is really important. And the Chancellor said, like, how or asked, how can we in advance ensure that a certain system is ethical? I think we can't. I think that this is happening during the development, because in our experience, when you tackle a certain issue, ethical issue, a conflict or a trade-off, a dilemma, and you go on in the development of the tool, from prototyping to testing, validating, new issues arise that you couldn't have foreseen, and for that we need methodologies, we need tools to know how to deal with that. And we are, for example, developing a so-called value dialogue tool in a health technology assessment framework, where we together with all stakeholders, and this is very important, so the patients with lived experiences, the healthcare professional for that use case. So, for example, for Parkinson, it will be the neurologist, and it will be the patient with Parkinson's disease, the policymakers, the developers of these tools, but also sometimes the health insurers are at the table, and we are discussing the values. Everyone is eliciting its value and presenting that to the rest. So these are interests that are at play, and we are actually trying to pinpoint what a certain ethical or a certain value means for whom, and whether that aligns, and if it's not aligning, how to make it align. So these are really very concrete projects, and we see that this is the way to do it. So these are opportunities for the patient movement to get hands-on experience, how to co-create AI. And yeah, well, more opportunities I see, and we see in generative AI. That is well, this medical jargon being made easy to understand, and that will absolutely enhance autonomy of people, because they will comprehend the information, and it will give them the sense of empowerment, self-determination, and maybe also becoming more independent if they use the AI tool itself, so when they are the end users. So these are, I think, things that we are doing and seeing, and I'm being very excited about.
The new values-based AI practice, and Annie, can we shift over to you to have your views on the solutions? Is it something that rings a bell?
Yes, but I think my point of view is even more practical or hands-on there, and I think most important thing is that biggest problem we have in patient autonomy and AI systems is that if there's only ChatGPT and we cannot take those AI systems into a healthcare sector, and they're really helping doctors' work, because then there is a huge imbalance between patients and doctors, and we know that kind of when we are staying on different levels, it's never good. So my point of view is first that take those AI systems into the healthcare system, pilot them, study them, because we know that there is a lot of capabilities, but we need to select those ones which are to prioritize, which are really helping our system to work more effective, better, providing more health, saving costs, and we need to decide that and study that and find that which are biggest wins and biggest losses, and really dive deep to those losses, and that's why not only testing capability, which is really nice, it's super nice to show in a research paper that this is good, but go that effectiveness and equality, and really go there and find out that what to do, what to understand, how we select those best issues, and then do that change management so that our professionals know what to do.
And you raise a new perspective about efficiency and effectiveness, but I'm also asking effective for whom? Because we also heard from Ildiko about value. So Thomas, maybe you have some reflections on how do we make sure that we really adopt the AI approaches to patients' needs and autonomy?
Well, actually, I don't want to focus on different AI systems, but I just want to stay more on general level about and talking and thinking about the autonomy. So, well, many things were already said. So, well, we have to focus probably on the education. It's a critical issue, and well, I can say that actually, I think it was last week when in Czech Republic was organized a conference for the students of medical faculties and with cooperation with Slovak Republic, and they were just discussing the issues concerning the use of AI in healthcare, so that we are somehow just trying to progress. And then I think very important thing is to just develop national tools for really somehow implementing the principles from different conventions to real life and practical and daily practice. This is quite important because we know that the doctors in many times are really struggling. The time is well, let's say it's expensive, and I don't know if we have this saying in Czech, but I don't know whether it's you can translate in English, but definitely it's time consuming, and then they need some guides, definitely, how to just explain something, how to notice, how to notify the patients about the use of the AI. And I think it's the way to develop those tools on the national level and maybe even on the international level. So maybe I see there are some role of the Council of Europe as well, and then just give some advices to national bodies to actually follow those let's say guidelines made by international bodies. And and not to forget, I think very important is to highlight the role of academia as well. Because until now there are many articles about the right to let's say, to notice, the right to explanation, and the principle of explicability, and they're mainly academical. But I think they are just those articles are really just doing a very good job to bring the topic closer to the public, and well, we can actually inspire ourselves from those articles, because in many cases you will find the solution for what we already discussed here, because in certain cases it's useful just to say, right, just to notice the patients that there was the AI system used, but there are different, let's say, uses of AI when it's actually it would be unethical and maybe even illegal not to explain how the AI system works. Because when we think about the AI as a prognostic tool and the tool how actually the AI might make like the decision, for example, for admissibility to hospitals, then you have the right to be explained why you are not admitted, for example. Well, I know it's like extreme example, but in this case, well, the lack of explainability, it's really critical.
And Ildiko, do you think patients are ready to take that discussion with health professionals, with the systems?
Increasingly, I forgot to mention also together with the European Patients Forum, Data Save Lives, but also nationally we are developing an e-learning on AI for patient representatives, because they just don't know how to participate in these developments. So that's very, very important. And the other thing you said, and I also heard practicality, and that's also, we are very practical. So we take all these use cases, different use cases, for example, indeed prediction tools for whether you will have a certain comorbidity in your life, or a wellness application, or stroke viewer, or discharging from the IC, etc., etc. And every use case is really different, and what we try is to instrumentalize actually the ethical requirements. And one of the very important documents is the high-level expert group on trustworthy AI and the ethical guidelines they developed in 2019, if I'm not wrong, with 7 requirements, and one is human oversight and human autonomy. But what does it mean in this concrete situation? And this is what we are doing. And also, are you going to safeguard that with a technical solution or with a societal solution, so with a non-technical solution? And that is also what we are learning. You have technical solutions for certain dilemmas or certain challenges. Are they sufficient or not? What is the must-have that we have to do in a certain concrete use case to go on further in the development? So this is what we try to do in consensus with all of the parties, so healthcare professionals, patients, developers, which is not easy, but this is the only way to dig into the concrete use cases and to learn from that. If you are not doing this, you will not learn it, because we are just learning how to do it, and it will take time, and we are in this transition phase that the AI is going from pilot to the real world medical setting, and also we need to do these kinds of value dialogues and ethical weighing what justifies what, also in the real world medical setting, which is not so easy, I must say.
Thank you, Ildiko. I'm curious to hear from you, Ersa, because you mentioned that the younger generation already experienced that AI systems are there for them, that the systems know them best. So are we seeing a whole change here in how they actually can use AI to support them to develop health as a trainer, like a physical trainer, a mental coach? We don't even need to go to the healthcare, the old school healthcare system, because they are not available, they're too expensive, and they don't understand what I'm saying. And so where do you see this moving on? You know, where will we be in the future?
To be honest, I am quite hopeful because I have seen something remarkable happens when trust meets tech or tech meets trust. And maybe it's not exactly what was discussed in the previous panel, but I've seen it happen. And because the thing is that whether it's a chatbot or an app or anything, it's always there. And it doesn't judge. It doesn't bring any past bias into the room. It doesn't rush at the same time. So this makes a huge difference for those people that are in vulnerable situations and that are misunderstood or misrepresented. So if we look at this, then there is some hope, but it is really up to us. How do we decide to move forward? And how are we ensuring that the tools that we are developing and deploying are focused on humans and not necessarily tech or tech first, but also that they act as companion and not as controllers, and they serve the human, not only the system. So to do all that, I think it's important, going back to what was discussed before, that we channel the voices of all stakeholders involved and all people that will receive these services or will interact with these tools, and involve them in the designing, in the development, in the testing, in the deployment. But also we need more co-creation in general, more education, and more digital health literacy skills.
So listening to you, I kind of envisage AI as a guardian angel that can help me, or is it like the devil sitting giving you wrong information?
Yeah, you're not wrong to envision that, because I kind of created both portraits of AI. But the truth is that it is creating space, you know, for people to have access to healthcare, those who live in remote areas. It is providing personalization and at your own language, you know, anytime you need, and at your convenience. So, and then it's predicting outbreaks and potentially identifying patterns of illnesses. So there are all these great things going on. We just need to be responsible when we design them and deploy them moving forward.
Thank you. Thomas, guardian angel or a little devil sitting on the shoulder? What's your opinion?
Well, I think it's both, but it depends what we do from it. Like it might be a devil and it might be a guardian angel. So
it's not a binary answer.
Well, yeah, it's up to us how we deal with it. And I think we are more or less in a good way, like to just put there some safeguards to use in a proper way, and then it really depends very much on the implementation and on daily practice, because we know already from like previous experiences that while having a good legal framework and ethical framework doesn't mean that we have a good practice. So while we were struggling a long time with medical paternalism, although we had, let's say, a very good regulatory framework, which brings me actually to the let's say notion of digital paternalism, which is I'm quite happy actually that you mention it, because from my perspective it's something what's really approaching, and in many countries, especially those developing countries, but we are just actually in the phase that we are leaving the paternalism, and we just tried to really introduce shared decision making and so on. When now we will be facing to new, let's say, challenges to face the digital paternalism. So we'll see what happens. But definitely, it's a big danger for the autonomy.
Yes, just to react briefly. Indeed, I think the main point is how will it be used in the practice. And what we are seeing in the Netherlands, we have this national platform or program, if you want, that we are testing all kinds of digital tools because we aim at more hybrid care. And some of these tools are AI tools. And what we see is that the developer is trying to make it, to make it like, oh, it is not as MDR. It is not even class 1 MDR. And even devices or solutions that are MDR, we also see that there is a big risk of function creep, that people will use it not as intended. And I think that is how to safeguard this, how to be, this moral compass of being, on the straight, to obeying, let's say, all the rules and guidelines and legislations. I think it will be a very big challenge.
Well, I think we are living in times of transformation, and we are witnessing things that we can't even imagine before. Unfortunately, wars and so on, even in Europe. So AI can, of course, bring tremendous benefits to humanity, but it also can damage, bring harm to population, and we should be very careful using AI and for the large scale of population, because even if we are talking about autonomy, if we think from long-term perspective, if AI-driven healthcare, if we already have AI-driven healthcare systems, and there will be another alternation of some data, it can bring to tremendous harm, because people will make their decisions according to that altered information. So it can be very, very risky, and even when I'm thinking, I have great fears about using in systems, not just for the personal uses. So it has, from one hand, yes, it can bring great benefits, and from other hand, it can be very, very dangerous. So one thing is for me very important, that I understand, but maybe I'm wrong, as I'm just lawyer, not specialist in AI system, that AI does not replace human creativity. So we should always rely on humans as a last resort, and not undermine human knowledge, and understand that yes, it is a unique tool, but it is a tool, and we should understand that everything in our hands. So we should be very careful using AI in our everyday life, and be more let's say careful using the systems in our lives, because it is great thing, but we should understand in depth in order to make changes in our lives. Thank you.
We've seen from history that data can change elections results, it can change society, so I think we still have to be aware, as you say, about protecting our data one way or another. And then I have Annie, you had some responses too.
You can see that I'm not a lawyer, and I'm not like too worried. Or I think, alcohol was denied in like a Finland 1920 or something, and people were using more alcohol than ever. So even and that's true. So now, because we have those AI tools, we have that ChatGPT already. So even we try to avoid using that like AI tools in healthcare, people will still use those, but then they are using those tools which are not under MDR and we cannot regulate or we cannot control. So I think we are, after ChatGPT was launched, we somehow went over with that AI war, and it will come. And if we are only against or too worried, then we cannot control. If we are going towards that and try to find solutions which are like there in healthcare and audited and everything, and they are good enough, then people don't go with those which are not audited.
So we should not have fear, we should be fearless, and we should steer and control.
Or like controlled, but somehow go towards that because it's available already for patients.
So we are coming to an end. I want to invite our panelists to just conclude this session with a couple of sentences that describe your takeaway from this morning, not maybe this session, but the whole morning here. What is it that you want to share as an impression from this conference? Ersa?
Okay. To conclude, I would just say that at this time, the opportunity isn't just to innovate. It is also to reimagine care that is more human, more just, and more respectful of who we are as humans and who we want to become. So I'll leave you with that.
And Ildiko?
Yeah, I think that the individual patients and their lived experiences are very, very, very important. And as we are going toward gathering more data, people may feel that their preferences and values are being overridden by these database recommendations. So be aware of this datafication danger, I would say.
Thank you. Annie?
I think we need to be like a brave but humble, like if we think about the AI, that we need to be brave enough to go there even we don't know what's happening, but humble enough to learn when we go there.
Thank you. And Thomas?
Yeah, okay. Just I will very briefly say concerning the autonomy that from my perspective, the takeaway message is that we have right now ethical imperative to inform the patients about the use of AI and how the AI is contributing to the diagnosis, to treatment decisions, because and it brings me again to the principle of explicability. And somehow I have the feeling that the doctors, although it will be very demanding, they have to know how it works, because in the end, the doctors, they have the responsibility and the accountability for the results. So therefore, although many people would be happy with this message, but I think, this is something behind it, that if you want to use something, then you have at least have certain amount of knowledge how it works.
Thank you. And Isabel?
As I say, AI is a new reality and we should live with it. So better to have benefits. And I think the take home is for me that we should in Armenia thinking about new ethical norms, it's concerning the AI ethics in medical work. So this is thing that I will think about at home.
Thank you so much. I think from my own experience now is that I speak for myself. I have to be careful not to be lazy and just, forget to think. It's so easy to just ask a question to ChatGPT or experts and get their opinion, and then I adopt that as my own opinion. I think it's still important that we keep that. You said be brave enough to think for ourselves, because that's the autonomy. It is that we are asked about our own opinion. We are asked to raise our voices. We do matter as a patient, as people, as humans. We matter. And we can enjoy all the facilities, all the things about AI to make our lives better. But if we do see that it makes harm, then I think it's for us to raise our voices. Thank you for raising your voices. And give the hand for our panelists here. And have a nice day. Thank you.
Thank you so much, Christina and the panelists. Yeah, once again, who is the servant, who is the master? That is a question, as always, when we are talking about the new tools. But now I think that it has been very heavy, as we know, very heavy, great panels and panelists, so that now it's time to go to the lunch, and it's just, let's say, behind the corner to the left. And coffee and tea is also served at the restaurant. After lunch, you can take it with you if you wish, and then cookies and some sweet, of course. But then please have a great lunch. And I know maybe this was quite difficult to digest so much info. I hope that the lunch is not that heavy, so that the digesting will be great. Okay, everybody, dear colleagues. Woo! Yeah, please have a seat. Hopefully you had an enjoyable lunch. We move on to the next session, moderated by Saila Rinne. So that, and she's head of a unit in e-health, well-being and aging from DG Connect. And the panelists. Yes, please. So Isil Denemets, Virpi Koivu, Krista Oinonen, Mario de Patronevs. Yeah, please, Saila.
Thank you very much, Tuula. We are still missing one panelist, who is actually the first speaker. So maybe as an introduction, so this session is a little bit different from the previous ones in the sense that we are going to provide a lot of information. So hopefully you stay awake. It's a challenge after lunch to do this. But our distinguished experts, panelists have prepared very brief and let's say easy to understand presentations and giving an overview of the Council of Europe work and norms on AI. These instruments and documents have already been cited many times during the morning. And also what I would like to do after the presentations is to also hear from you a bit based on what you have been hearing this morning, like how do all those conversations that have been taken place until now, how do they relate and link up to the instruments and norms that you're going to present? So I propose that we start with Isil Denemek, and we decided that the speakers this time would go to the podium and they can change the slides themselves. So over to you. Thank you.
Thank you. I know we're very short on time, so I tried to keep my slides brief, and in the discussion section we can elaborate on the issues. So today I will be talking about the Council of Europe's Framework Convention on Artificial Intelligence. It is the first ever legally binding global instrument on artificial intelligence, and I will do so from the perspective of healthcare sector. To briefly introduce myself, I'm Işıl Selen Denemeç, and I serve as the head of the Turkish delegation to the Council of Europe Committee on AI. I also serve as a bureau member. So we know that AI is disrupting everything, and it's providing a lot of comforts, conveniences, efficiencies, but it also comes with a price, and there are some risks related to the use of AI. These are some of the issues. I apologize. These are some of the issues that come with the use of AI, and these can be elaborated. This list can be extended. Some of them are related to data as the fuel of AI, which can be patient's data, can be leaked patient's data, can be collected and processed without his or her consent. It can be used for commercial purposes. So these are some of the issues that are very much related to data protection. And then we have issues related to the system itself and the algorithm. There is a risk of algorithmic bias, as in all the uses of AI, and this can lead to discriminatory outcomes. This is even a bigger issue when there is a lack of transparency, because the opacity of the AI systems are actually one of the biggest issues when it comes to finding the problem in the system and its deployment. So, as I said, the list can be extended, but I don't want to spend too much time on this. All I want to say is that all of these problems may end up eroding the patient and doctor relationship and the trust in healthcare system in general, which is a problem. So what can we do? We actually have two conventions that I would like to mention today. One is the Oviedo Convention, as you've been hearing ever since the morning, and one is the Framework Convention. So the Oviedo Convention actually is a general tool that wants to place patient in the center of healthcare in the face of the technological developments. But when we look into the Framework Convention on AI, it's just mostly AI oriented, but it's again putting AI subjects in the center. So we want to promote and protect human rights, democracy, and rule of law with the CAI Convention. When we look into the provisions, I made this comparison table. They may not be the same wording, but these provisions are actually relevant to each other. So, for example, primacy of the human being is very much relevant to the protection of human rights and human dignity, individual autonomy, and we see in both conventions the provision about non-discrimination, which is one of the biggest issues when it comes to technology. Again, protection of consent, personal data protection, these are very much relevant to each other. So both of these texts are available online, so I didn't want to crowd the slide, but you can check for yourself if you're interested. And I would like to also mention that the CAI Convention has been open to signature on September 5th of last year, and it's still not in force, but hopefully it will be soon. I don't want to spend too much time on this, but I want to spend time on the impact assessment portion of my presentation. So one of the outputs of the CAI, the Committee on AI in Council of Europe, is the HUDERIA document. HUDERIA is the Human Rights, Democracy and Rule of Law Impact Assessment document. We've actually divided into two. One is the methodology part, one is the model part. We've actually released the methodology and are currently working on the model, which will hopefully be released by the end of this year. What is important about HUDERIA is that the Framework Convention actually mandates the impact assessments to be done when using AI. And this document, as a standalone document, which is not legally binding, and it's a guidance document, actually provides us with the tools to conduct the impact assessment for ourselves. It's tailored to promote and protect human rights, democracy, and rule of law. And there is it provides for the creation of a risk mitigation plan to minimize or eliminate identified risks. And as I mentioned, the model, when we finally release it, will be offering supporting materials such as tools and scalable recommendations to aid implementation and serve a resource for broader risk management approaches. One of the elements of Huderia methodology I would like to mention today as it relates to healthcare sector is the context-based risk analysis. Because as you are aware, it's an AI system may be an AI system, but the context in which it is being used will change the whole impact assessment. We cannot conduct the same impact assessment for an AI system that is used for predictive maintenance of, let's say, machines in a factory, whereas we have a medical device that's embedded in our bodies that's continuously monitoring our blood sugar, let's say, and administered insulin on its own. We cannot put these in the same scale. So the context-based approach is very important, and that's why I wanted to mention this more than the other ones, because the methodology, when you look into the methodology, you won't see anything specific stated about the healthcare sector. But when you're actually conducting the impact analysis, you will have to focus your assessment to the context, which is the healthcare sector. There will be, although I cannot say much as of now because it's not public yet, but in the model we will have sections, I believe we will have sections about healthcare, but it will all end up in the application process where we focus our assessment to healthcare issues. With that being said, I would like to thank you for your attention, and I would like to yield the floor to the next person.
Thank you very much. And the next speaker is Virpi Koivu. Over to you.
Thank you. My name is Virpi Koivu. I come from the Finnish Ministry of Justice, and I also work as a committee bureau member of Convention 108+. That is the topic of my intervention today. I'm also going to be rather brief with this topic. It's a waste topic, but I have tried to pick up the most important elements that are of relevance for today's discussions. I picked up something from the previous panel. It was suggested that it would be illegal not to inform the patient. That is correct. It would be illegal. Convention 108+ means the revised Data Protection Convention of the Council of Europe. The most essential principles of the processing of personal data are the same as in the existing convention. Convention 108+ is still not in force. We still need 5 more ratifications to come, but we are rather close to it entering into force already. Data protection contributes to the protection of other fundamental freedoms and human rights, in particular the right to privacy. Convention 108+ provides for legally binding standards of data protection. It is also supplemented by non-binding guidance, and already in 2019 our committee prepared the first guidance on artificial intelligence and data protection. Healthcare is a special category. Health data is a special category of personal data. It means that the convention standards alone are not sufficient, but you need to provide for something more in national legislations to provide a higher level of protection for this category of data. What is particular about this convention is that although it's legally binding, it has to be implemented in national legislations of the state parties to the convention. Convention 108+ also introduces some important new elements that are of particular relevance in the context of AI-enabled healthcare. And those elements would be the provisions on automated decision-making, data protection impact assessment, and risk minimization. Those provisions have also quite a lot in common with the AI Framework Convention that was discussed in the previous intervention. I have prepared a brief list of key provisions of Convention 108 plus that I believe to be particularly important when you are processing personal health data by means of AI applications. This list is not an exhaustive one. This represents also my personal view on what I consider to be important. Other data protection experts might have different views, and it's important to remember that the whole convention would apply to the processing of personal health data, even if it's processed by AI applications. And also, the convention has a lot in common with the GDPR of the EU. Those two instruments have been aligned, and the GDPR would be the instrument, for example, in Finland, that implements the Convention 108 plus. One of those key provisions that I wanted to mention is the quality of data. You have already been discussing quite a lot about the importance of various aspects that you need to take into consideration when you are processing health data by means of AI. If you don't pay attention to the quality of data, for example, if you use inaccurate, excessive data, or irrelevant data as an input when you are using the AI application, the output as a result might not be relevant or not appropriate in the particular context. I'm not going to go into more details about these key provisions of the Convention 108 plus. The list is more for your information, and it's also relevant to study the whole convention to see what is important in the context of processing personal health data. I'm getting back to the issue of informing the patient. If I had to choose a set of provisions that I like to underline the most in this context, it would be the convention provisions on transparency and the rights of the data subject. Those provisions of the convention are legally binding, and if those applying its rules violated the rights of the data subject, it would be illegal. There's a clear link also with Articles 5 and 10 of Convention 164, in other words, the Oviedo Convention, which provides for the informed consent of the patient to health intervention. It also provides for everyone's right to know any information collected about one's health. There is an added value with Convention 108 plus. It sets out in more detail what you should inform the patient about. You should provide basic information on the types of personal data collected and processed, on the means and purposes of processing. If you use an AI application, you should also inform about its use and of the logic involved. You should inform the patient who has access to the collected personal data, and the patient's rights that he or she would enjoy as a data subject under the convention. And it is important to pay attention to the fact that if you use an AI application to process personal health data, then it would be extremely important to inform of the significance and consequences of its use, and how the use of an AI application would affect the patient's rights. So this is very important from the point of view of the informed consent that has been discussed already in the previous panel. Very often the use of AI also means automated decision-making, which is a novelty brought about by the convention. Even the creation of a patient's profile, which is done exclusively by automated means without human involvement, would be an automated decision. And then you should also inform the patient about the right to challenge the automated decision. The patient should be able to present his or her views and, if necessary, to contest inaccurate data. If you pay attention to the transparency requirements and to the rights of the data subject, then you would already be able to effectively contribute to the implementation of other rights of the patient. Thank you.
Our third speaker is Krista Oinonen.
Good afternoon. First, thank you for the invitation to speak today as chairperson of the Council of Europe's Steering Committee for Human Rights, CDDH. This is an intergovernmental committee that works under the authority of the Committee of Ministers of the Council of Europe. Yes, now we have my slides on the screen. So my name is Krista Oinonen and I work at the Ministry for Foreign Affairs of Finland at its legal service on Finland's international human rights obligations and in general on human rights treaty issues. This is such a timely and important conference and I'm really pleased to share the work we are doing in the field of artificial intelligence and human rights at the moment. Our steering committee CDDH focuses on two main issues. The first one, and I always say that this is really the jewel of the crown at the whole Council of Europe system, is the European Convention on Human Rights. It is really the cornerstone of European human rights law and also of the Council of Europe. And we work on the development of human rights standards in emerging and challenging issues, including artificial intelligence. And at the moment, under CDDH, we have an expert group which is preparing a new handbook on artificial intelligence and human rights, and it should be adopted by the end of this year. My key message today is artificial information systems do not operate in a legal vacuum. Our existing human rights obligations, including the European Convention on Human Rights and the European Social Charter, apply to activities within the life cycle of AI systems. And this new handbook, which is now being prepared, will support government officials and policymakers in the Council of Europe member states. It should provide very practical sector-specific guidance on applicable human rights standards and the risks and implications of AI. As the handbook is still work in progress, I will be sharing preliminary insights that reflect the current thinking of the drafting group. But please do note that this may evolve as the work advances. At the moment, the handbook draws on the European Convention on Human Rights, as interpreted the European Court of Human Rights, the European Social Charter and its interpretation by the European Committee on Social Rights, and other key instruments include this new Council of Europe Convention on Artificial Intelligence, Data Protection Conventions, of course Oviedo Convention, and also other important recent contributions like CD Bio's report on AI in healthcare and the patient-doctor relationship. The handbook takes a sectoral approach. It identifies 8 key sectors of public governance where AI impacts human rights, and one of these sectors is healthcare. And for each of these sectors, we identify key AI use cases that are already deployed or those that are reasonably in prospect. their impact on human rights, and relevant legal standards and principles, notably taking from the ACHR case law, ECS practice, and how these may apply in the context of AI. And as the European Court of Human Rights has no case law yet, and here I emphasize yet, specifically on AI systems, our analysis is also guided by the general principles of the Convention, which provide, I would say, a very solid foundation for assessing the human rights implications of AI systems and by case law on related issues. The drafting group has identified that some human rights issues consistently emerge and cut across all sectors, and these include effective remedies, data protection and privacy, and non-discrimination. The handbook also addresses business and human rights. States should ensure that businesses respect human rights where their activities in the AI field may have an impact. Let me now focus on the healthcare sector. The handbook examines artificial intelligence in healthcare and assesses developments in light of the state's ECHR obligations. While the ECHR lacks a specific right to health, the court has addressed health-related issues under other rights, imposing negative obligations, that is, for example, to avoid harmful interference, and also positive obligations, that is, for example, to protect health, inform individuals of risks, and ensure high standards in care and regulation. Though states retain a margin of appreciation in healthcare policy, they must take practical measures to safeguard life and health. The ECHR framework interacts with other instruments like Convention 108 and the Oviedo Convention. The European Social Charter explicitly guarantees the right to health, requiring states to prevent illness and accidents, promote health education, and address causes of ill health. Then let me briefly highlight three key issues the handbook addresses in this sector. First is privacy and data protection. Article 8 of the European Convention on Human Rights protects personal health data. As AI systems may rely on large volumes of very sensitive data, this in turn may raise concerns about confidentiality, misuse, and individuals' control over their own information. Therefore, safeguards are needed to ensure compliance with the requirements of the ECHR and also Convention 108. Non-discrimination and equitable access. The ECHR and the ESC both prohibit discrimination. It is documented that AI systems trained on biased data may misdiagnose or overlook the needs of certain groups, such as ethnic minorities, older persons, or, for example, persons with disabilities. And states should ensure fair, inclusive, and geographically balanced deployment of AI in healthcare. Informed consent and patient autonomy. Under the ECHR and ESC, informed consent requires clear, objective information. The complexity and often opaque nature of AI systems makes informed consent difficult for both patients and healthcare professionals. Another issue relevant to the healthcare sector is the right to an effective remedy. Article 13 of the European Convention on Human Rights guarantees the right to an effective remedy, including violations involving AI systems in healthcare. While the ESC lacks an explicit remedy right, the European Committee on Social Rights has interpreted it to require effective remedies in some cases. AI systems lack moral agency and legal responsibility, and their complexity, opacity, and multi-factor supply chains make it very difficult to identify rights violations and assign accountability. In sensitive areas like healthcare, a clearly responsible human must stay in the loop, and remedies must be accessible and effective in addressing harms caused by AI systems. In conclusion, the work of the CDDH, our steering committee, through this ongoing handbook seeks to facilitate the application of human rights law to the evolving realities of the AI by complementing existing standards and clarifying the human rights obligations they entail in practical sector-specific ways. As artificial intelligence transforms sectors like healthcare, we must remain vigilant and principled, ensuring that technological innovation reinforces and does not undermine human rights. Thank you once again for the opportunity, and I look forward to discussions today.
Thank you very much, Krista. Then we have our last speaker, who is Maria Patrao Neves. Over to you.
Thank you. Good afternoon. I hope we are still all awake. After lunch is difficult. Well, at this moment, I take the stand representing the European Group on Ethics. And that's why I will start by highlighting two major European contributions. That is the creation of the high-level expert group on artificial intelligence. And this group has laid down the ethical foundations for the AI Act. And then the AI Act that started already to be enforced and will be completely enforced in 2026. Very briefly, I would say that these documents present three major characteristics. The first one is that the development strategy is grounded in ethical values and principles. We already mentioned a few, so I will not take time referring the major principles. The second characteristic is a risk-based approach. 3 levels of risk, each one with different requirements. If we talk about an acceptable risk that is prohibited, high level risk, major healthcare applications are at this level. This means that we need strict regulations and additional protection measures. And the other, the limited risk, most of them require just more transparency. The third characteristic of these documents is to be ethical, human-centered design practice. And that means, as it was mentioned before, not to replace human by AI systems, and requiring that the final decision be always a human decision. I must say that most of these documents, of course, they talk about healthcare, but it's one activity among others, is not specifically their aim. And it has been mostly the Council of Europe that has issued a number of documents about AI and healthcare. The bottom line is that they are all grounded on the convention. We talked about that already. The major principles were also presented, so I will just skip that point also. What do I wanted to say now? That I was asked to present just the one that is on blue, and I will do that as briefly as possible to stick to the time. So, let me see. Yeah, I see exactly the same. Well, these report on patient and doctor relationship focus in 4 selected human rights, and it focus on the new context that we are dealing with, also new challenges, and drawing some recommendations. So these are the 3 levels that we have. About the 4 selected principles, the first one is autonomy. We heard talking about autonomy, mostly Thomas, so I will not spend much time on that, but I would like to add just something that I consider to be important, that is, patients' autonomy can indeed be strengthened by AI, but for that, they need to know they are interacting with the AI systems, so more information, more transparency. They also need to keep the possibility of a second opinion that is not equal to the first one, and they need a higher level of health literacy and critical thinking. So my proposal at this level would be to review the requirements for informed consent, considering that the specificities arising from the merging AI systems with the convention traditional standards of care do raise specific issues also. So they have to be addressed in informed consent. The second is about professional standards. Well, they create a commitment for doctors, and they are also very much needed to protect patients. However, professional standards depend on the state of the art, which means that today they must integrate AI systems, sound, robust, accurate. This is very difficult. We heard talking about that this morning. So it's very difficult because it requires the doctors to carry out an updated daily assessment of the many risks that AI can involve, namely the fact they are probabilistic and they are the danger of being biased. But they need to understand them, and they need to be able to explain them together with a clear assumption of responsibility, which in any case is becoming increasingly fragmented and diffuse. But if we don't have responsibility from someone along the line, it means that the most vulnerable will be even more vulnerable. So if professional standards are clear and updated, if doctors are held accountable and users are educated, then trust in the relationship will be maintained. At this level, we need an agile classification of the risk level for AI systems. There are to be integrated into healthcare services, and proportionate measures for the safe and beneficial use together with prior certification. That would be my proposal. Third principle, about private life and right of information. We have been talking about this also. I hope to add something by saying that doctors maintain their role as guardians of the data they collect, enrich, and the responsibility for their protection. But this obligation is becoming increasingly difficult due to the expansion of the health data space, in which data are aggregated, shared with other AI systems. Patients are finding increasingly difficult to keep track of their data, which are becoming more dynamic and complex. To protect confidentiality within the patient-doctor relationship, automatic decision-making by AI systems cannot be accepted. Rather, we need to provide the possibility of different types of options for making healthcare available by the patients themselves. When reviewing the requirements for informed consent, it is important to consider the type of data to be made available, for what purpose, and but what access safeguards. And the last principle is about equitable access. We talked about this this morning also, and I would like to add that AI can either contribute to mitigation existing inequities or aggravate them. AI promotes equity if it facilitates and broadens citizens' access to healthcare, for example, through remote assistance. If, however, due to its high costs, it does not have full geographic coverage, if it favors those with more financial power, it worsens inequality between citizens. Equitable access requires maintaining different ways of assessing healthcare. Face-to-face by a human doctor and online enabled by a chatbot with patients' free choice and non-discriminatory decision. Besides, the approach of AI systems is more focused on specific problems, and the human's approach is more holistic. The holistic approach gains a broader perception and is more respectful of the patient's uniqueness. I know this can be challenged. Therefore, the benefits that AI offers cannot suppress the possibility of an in-person support, human doctor assistance. And I would conclude by saying that equity of access does not accept that one way to deliver care be replaced by another that is not adapted to some citizens, namely those with disabilities, but rather requires that benefits from a dual system be available to all. Thank you.
Thank you so much to all the speakers for excellent presentations, bringing forward the essence of these documents that may be hard to read for all of us, so that it was really well done from all of you. Of course, we have all these different norms and instruments in place now, and some of them coming into force soon. And as always, it's the next step is, and the next thing to look at is like, how do we actually implement these rules, and what does it mean in practice? And there are often these situations where you really have to balance between different interests or different, I would call like use case scenarios, and it's not like one size fits all. And one of the such scenarios is about ensuring high level of protection of fundamental rights when AI is used by healthcare professionals on one hand. So these are medical devices, it's a very controlled environment, providing care using AI. And the other scenario is when you have citizens, patients using all kinds of AI-based tools out there that we discussed this morning. So what is your view on this, like how to make sure that these rules and rights are protected in all scenarios? I would like to start.
Thank you. I was the last one to talk, and I'm the first one to take the micro. Sorry for that. But just wanted to say that somehow the question that you addressed to all of us now here has been the major question that we have been facing since the very beginning of the day. I mean, this is very important what we are doing here, discussing, exchanging ideas. This is indeed the basis. But we have to move forward. So I would say the first step is the one that we are taking here. Also putting in writing what we consider to be important. But from this on, we have to go into practice. And to go into practice means to try to coordinate, to articulate the different initiatives that are taking place nowadays, to see how they can become complementary, engaging the different sectors, the different segments of the society in a representative way. And engaging means also to make them feel the need of thinking about these issues. Because if we take a top-down approach, we are saying what we know, we have been reflecting on this for so many years, we have been writing about this, so now here is what we think about. This will not work. So we need to engage in such a way to try different ways of different strategies of communication to make the public, the citizens in general, to feel the need for themselves, for their families, for their group, to think about these issues and to see how important for them. It's important for them as citizens, as members of the community, to strengthen their autonomy. It's important for their health and to make decisions at that level. And I think that's what we need to do. And we are all agents of these transformations because we are coming from different institutions and from different countries. So we can do a change in our geographic or institutional place from a common or consensual thinking to an action that is really transforming society. I truly think that that can be done. Otherwise, there would be no point of being here, really.
Isil, would you like to, or Virpi? Go ahead, Virpi, if you have, yeah.
Okay. Well, data protection framework is something that provides solutions. So if we think about the need to ensure the protection of fundamental rights or human rights, then there may be differences in those two scenarios mentioned by Saila. And if medical practitioners are using AI applications, for example, to support their work, I would probably underline the importance of paying attention to data quality. Every patient has the right to be assessed in the light of correct information, accurate information, information that is relevant and not excessive. On the other hand, if we are talking about citizens using AI applications, for example, a chatbot on the website of a medical service health provider, then you would not expect the same amount of knowledge from the patient as you expect from a medical practitioner. So in that situation, it would be very important to pay attention to informing the consumer or the patient about what's taking place if you use the AI application, which is the chatbot, what it would mean, what kind of information should be inserted, and what you would expect as an output from the AI application, and how it would then affect your rights as the patient.
So the explainability that was mentioned earlier also in this context.
Precisely.
Thank you. Adding on to everything that has been said, it's a really big challenge to maintain consistent rights-based protection across different contexts, like in the case of patients using the system personally and the doctors using it. Well, institutional use is almost always regulated somehow, but when it comes to personal use, the rights can erode very easily because of the problem of AI literacy, basically. So we need to be aware of the problems that may come with the use of AI, and whether or not it's worth it with the use. I mean, I'm not talking about healthcare sector specifically, but all applications of AI. So that is a big problem, and I think the most efficient way of overcoming this is AI literacy. So it all boils down to that. Thank you.
Thank you. I would say that we Council of Europe member states, 46 of us, are really in a unique position when we develop artificial intelligence in the healthcare sector, because we have such a firm base. The Council of Europe has over 220 treaties, legally binding instruments which provide obligations. And majority of these treaties have also independent or other type of monitoring mechanisms. So we Council of Europe member states are constantly being monitored regarding, for instance, human rights standards or artificial intelligence in the healthcare sector. So I think that we are really in a unique position when we have such a firm legal base. And we have these firm institutions and structures in the Council of Europe. Council of Europe as an organization is also very quick to adapt. When there are new emerging issues, it's very quickly that, for instance, one of the steering committees establishes a new working group, drafting group, and we are addressing these needs which are emerging. And one what is, I would say, really a miracle, and that is the European Convention on Human Rights, which is celebrating 75 years this year. And think about in 1950, nobody knew anything about artificial intelligence. And now the convention is adaptable and the court has a huge capacity to address this kind of issues and provide new case law to the Council of Europe member states. So I think that we have such a firm legal basis here. We have these mechanisms and structures that it's a really unique, good position. I wouldn't be afraid of all regarding developing artificial intelligence in the healthcare system when we are at the Council of Europe member states structure.
This is very reassuring to hear. Then I would like to also ask about the earlier discussion was about AI having more and more agency, so that we could even talk about having like a third person in the room. And on the other hand, we have the human in the loop, and you said AI never can decide independently. So any views on this? And because probably this is something which is going to happen. I mean, technologically it's possible, and these agents are becoming better and better, and for sure also the healthcare professionals see that they may at some point consider them really like as a third person in the room. So any thoughts about this?
Well, I think there's no discussion about this anymore. I mean, we have three elements. I remember that this morning there was the possibility of talking about a fourth one that would be the nurses. I would not add, I would just talk about patients, healthcare professionals in general. Not only doctors and nurses, there are so many others that are there taking care of the patient. And AI, absolutely. And we have to be much aware that AI, it's a mediating element. So instead of having a face-to-face, a direct relation between two persons, we have technology coming in as a mediation between these two persons. I also trust that we humans create the technology. So technology is our creation. So I would not say stop innovation, not at all. We just need a critical thinking about what we create, to be sure that we take the most advantage of the benefits and that we have mitigation measures for the harms that potentially are there also. About technology, and I'll stop, I very much agree with what Thomas said before. AI, it's not a tool. It's not a conventional tool. And it's not a tool because, first of all, it's learning by itself, and it's becoming, has gained agency also. And in addition, it influences and shapes our own behavior. So it's not like, we talked about this during lunch, it's not like a washing machine these were tools and are tools that we integrated in our daily life. They change the way we manage householding, but they do not change the way I think, the way I act toward the others, and they do not have any kind of agency. So to say that AI is just a tool, like a knife that I can use to eat or to kill someone, is the first problem that we have if we really want to face what we are dealing with. It's not bad or good to say that it's not a tool like any other, but we have to acknowledge that it's not. Because if we do not grasp the reality as it is in our daily life, how can we interact with that reality that is between me as a patient and the doctor?
Thank you. If I may continue, just what Maria said, artificial intelligence may assist, but it is always an individual, a human being who gotta make these decisions and bear responsibility as well, and accountability with regard to artificial intelligence and its use, deployment, that is really a key issue. And therefore our steering committee is now working on this handbook. We put together standards, and our genuine aim is to help the Council of Europe member states and their authorities that how to implement these standards in this new environment. And of course, we governments, we bear the responsibility that, for instance, when the handbook will be finished and published, so of course we are wishing that it will be translated in the national languages, minority languages. It will be explained, for instance, healthcare professionals at the local level. So there are many opportunities how to enhance the understanding of this new framework. And I think it was very important what was mentioned, it is digital literacy. It's not only the professionals, it's also all people, starting from very young children at school, that we learn this digital literacy, because that is a skill to be needed. Thank you.
I can fluently continue to what was just said. From the point of view of data protection legislation, indeed, there is always someone responsible for the processing of data, and particularly personal data, by means of AI applications. From the point of view of data protection, an AI application or AI system is the means of processing personal health data. And from the point of view of data protection, it would not be possible that the AI as such would be responsible for what takes place. It would be the controller. The data protection legislation designates the responsibility for compliance with its rules to the controller. So whenever there is personal data processed by automated means, even if it's an AI application, the controller can be held responsible. So you would have to pay attention to how the AI application is used and what it's used for.
You mentioned agentic AI. AI applications, and especially agentic AI, will have many impacts. And us, because we are not an AI native generation, can still have some objective approaches to this technology. But the AI, especially agentic AI native generation, will not be asking the questions that we are asking now. So it will change the social fabric, and we need to be very careful with this as well. For this reason, I believe that interdisciplinary approaches are very important, not just legal, not just technical, but also societal approaches, social, philosophical, economic, obviously. So I just wanted to also add that upon everything that's been said. Thank you.
Thank you so much for covering all these different aspects of the question. I think we are almost like running out of time. So would you have just one final comment to say, also based on what you have been hearing this morning in the other sessions? I wanted to give this opportunity still before we finish.
My final remark would be the importance of responsibility and accountability matrices. They have to be done for AI uses in any context, because otherwise we will be pointing fingers and we won't know who's going to be responsible, who did what and at what stage and what is causing the problem. This is actually a key for transparency as well, not just accountability. So I think this is one of the most important things for AI.
And from my point of view, I would underline the importance of being transparent. The data protection legislation does not prevent innovation. It does not prevent the development of AI application to benefit community and to benefit the well-being of patients. But it's important that the patients are aware of its use.
And my final remarks will be advertising and marketing our fantastic new handbook, which will be published at the end of this year. So please do take opportunity to study that handbook and do use it, because it should be really a user-friendly tool for all authorities and also other actors to implement human rights standards in this context.
Okay. Well, final remark is the following. We are all gathered here because we are sticking to human rights. In this case, human rights and how they can be affected by artificial intelligence. I would like to say that we want to defend human rights, not for the sake of it, not in a formal way, because we truly believe that if human rights are not protected in healthcare as in any other human activity, the weakest will become even weaker and the powerful will become even more powerful, and inequity will be aggravated. And we truly believe that we are all equal human beings, and we foster for equality in our societies. And that's the real reason that we defend human rights, not only at the legal level, but at the existential level. And if we can pass this message, I believe that we will engage people also to our points here.
It's a great final message of this panel. Thank you so much to all of you, and we continue these discussions in many other fora in the future. Thank you so much.
Thank you so much. And I noticed that they opened the door. I think there is a coffee and some cookies served if you wish, and you can take a cup and come back. So that, but then we move on to the fifth session, professional responsibility and AI system. So the moderator, is she here? Mindy? Yes, great. Mindy Dufroux, assistant professor of law, Maastricht University. US, and then Janne Aaltonen, I noticed probably he's here as well. Yeah, great, Janne. So it's European medicine, is in the CPMA, okay, it's French, but anyhow, so it's a head of delegation. So please take a seat. Then, is it Michael, yes, good. Krauthammer, professor of medical informatics, University Hospital Zurich, Switzerland. And then we have Andrei Volny, good, Deputy Head of Department of Neurology, University of Ostrava, Czech, welcome. And then we have Katarina Vujovic, Health Research Officer, Organization for Economic Cooperation and Development, OECD. Yeah, great. Good, Mindy, please.
Wonderful. Thank you also to the organizers for this great event, and to all of the panelists and moderators and speakers who have come before us. You've set a nice foundation for us, I think, to dive into our discussion. I was going to introduce our panelists. Maybe I'll do it very quickly because we have a bit of introduction already, but we have quite a lot of clinical expertise on this panel, and I'm excited about that because I think we can really dive into to the role of healthcare providers themselves. So Jana Aaltonen, the CEO of the Finnish Medical Association, in addition to being a medical doctor, anesthesiologist, also experience with medical research and development and bringing innovative tech to the market. So we have that perspective as well. And Michael Krauthammer, professor of medical informatics in Zurich at the University Hospital there. And again, clinical expertise, internal medicine and surgery, but also a PhD in biomedical informatics. And then we have Andrei Volny, professor and department head of neurology and the Vice Dean of Science and Research at the University of Ostrava, and also the chairman of the Czech Society for AI and Digital Innovation and Tech. So quite a lot of activity in the area. And then, of course, Katarina, we saw her on the first panel, but she's our policy expert here, and she's a health research officer at OECD, and particularly she works with digital health technologies and leads the work on digital health impact of AI in healthcare, indicators, and also on the healthcare workforce as a whole. So our panel is going to dive into the role of healthcare professionals in protecting patients' human rights in AI-driven healthcare. And I'd like to start the panel, I think, and just to pick up a bit on something one of the last panelists said, which was that we are not an AI-native generation, which makes the transition period over the next 3 to 5 years, I think, really important. So I'd like to maybe just do a quick opening round with our panelists and ask them, what do medical professionals, or maybe I should say healthcare professionals more broadly actually, need to be aware of right now to protect patients' human rights in this important transition time, so in the next 3 to 5 years. So I'll just kind of maybe pass down the row.
Thank you. Good afternoon, everybody. It's my pleasure to be here. Thank you for kind introduction. This is, I would say, a very important question. To be honest, I don't know if I can tell the audience the proper answer to this question, but I completely agree that definitely we are in the middle of something new. AI is here, and not only, let's say, the general AI, like chatbots and other tools, but also even new AI tools certified by the MDR certification process are coming to the medicine in terms of diagnosis, treatment, decision support, because still we have only certified medical AI tools which are decision support tools. Even the term tool was said that we shouldn't use it, that AI is not a tool, but I think that we can use it for this kind of discussion. So yes, I think that the most important thing is even this event that we came together, we can discuss, we can also discuss some bottlenecks, because it's not only about the AI and its level right now, but it's also about the adoption of AI by healthcare professionals. And some of us are more innovative, they like, or we like innovation. Others are more conservative. So there will always be some pros and contras and fans and, let's say, other people who will be against the innovation. So that's my, let's say, first few words onto this topic.
Okay, thank you, and thanks for the invitation. I'm impressed by the level of discussion. I'm learning a lot. I'd like to make 3 points. I did some thinking here. So this is about healthcare professionals, how they can ensure that trust remains with the professionals. So we have to educate ourselves continuously, obviously. First off, we have to understand these systems. We have to understand the pros and cons. We have to tell our patient if they choose not to use, maybe we should convince them they should use it, because not using might also have risks. We can talk about this later. Like, for example, in AI-guided colonoscopy, should you use it or not? Second, interestingly, we call for the systems to be less biased, that provide explanations and so forth. Well, that's important, but as we do so, these systems are actually getting better and better, right? And at one point, who can blame the doctors to use them if they're really good, right? So we have to be aware that this inflection point is coming soon, and so we have to be aware that we don't lose our skills, right? And how can we prevent de-skilling? And we can hopefully talk about this later. And third, patients are also using those chatbots, right? And so how is that changing our interactions and the trust in physicians, right? If patients might have more knowledge than the physicians themselves. So it's actually almost a race, right? Who has the better chatbot, maybe in the future, the doctor or the patients? And how do we keep abreast of these developments? And I have some thoughts on that too. So yeah, these are my first intro points.
Thank you. Good afternoon, everybody. Nice to be here. My 3 points to start would be all concerning to the field of medical technology in general, since I see the AI is a similar kind of technology which is widely used in healthcare every day, not perhaps the AI, but the other kind of the technology. And the AI systems used in care of patients are medical devices. There is no question about it. And then they are under medical device regulation, and the manufacturer of the system, not the user of the system, defines on what purpose and how it can be used. And all physicians should acknowledge this. And I see that not all are aware of this. If you use the thermometer to measure a body temperature, you should use the thermometer intended for that use. You cannot use any thermometer and measure the temperature. And the same is obviously for the IT systems. The second point would be that all technology in healthcare should be proven both safe and effective before it's taken into the extended use. And of course, to be able to do that, it requires research and experiments. And that would be the third point. If the experimental technology is used, there should be a consent, and it should happen only in a formal research setting, not just thinking that, well, I use the AI today and learn how does it affect. It shouldn't be allowed, and it's not ethical.
Good afternoon, everyone. I'm here again. And thank you, Mindy, as well, for kicking off with this rather broad question, but I think it's a very valuable one. And perhaps I might take a step back and to think as well, what are the risks of using AI and not using AI? And I think it's been said already plenty of times throughout the various panels, we do already see now potential and benefits of those AI tools, whether they're being used in diagnosis, for administration, but as well prevention in some countries where they already have the infrastructure that is ready to sustain them to do so. But on the other hand, there's also risk in not using it. And I think this is as well where we should bring in the healthcare professionals in understanding that. And I think Andreas as well might bring us more practical examples about that. And this is also tipping into the necessity of starting as well to educate healthcare professionals. Michael, you talk about the skilling, for example, but we should also think about upskilling healthcare professionals, and not just those that are directly exposed, such as nurses, community health workers, or clinicians on the front line, but as well those that are in the back office workforce that are going to sustain them to effectively and responsibly use those tools to augment their work. So I think we're exactly at this crossroad, if I may say like that, on how to best leverage AI to have this more educated health workforce.
Yes, indeed, and I think I'd like to actually maybe bounce right back to you on the skilling issue, because there's been quite a lot of discussion about AI literacy, education, worries about de-skilling, what should happen in medical school, what kind of educations do patients need about their own use of AI, and what's the doctor's or healthcare provider's role in helping guide patients. And then we heard from a doctor who said, well, doctors can't do it all. We can't know everything and explain everything to the patient. And so maybe, I'll just want to put it back to the panel. What does this look like? What do these new skills look like, or upskilling, or yeah?
Yeah, we're revising the medical curriculum right now at the University of Zurich for the advanced students to responsibly work with the AI tools. But I think upskilling and prevent de-skilling or whatever, I think should go in parallel. In a way, I mean, you really can't lose your skills, right? And so there are ways to think about how to, in a procedural way, put AI into the clinic, right? So, for example, you could do AI first or AI second. I mean, you could say you're not showing the physician the AI opinion until you made your own first guess, right? And then this is one way, right? That there's a AI second process, or you can run the AI in the background for quality check, but you don't actually show the AI directly to the physician. For example, if the pathologist overlooks cancer in a histology slide, right? The AI assistant quietly asks another pathologist to look at the slide again, right? But there was never a direct interaction with the physician. So these are all ways to prevent de-skilling, right? And I fully agree about the upskilling question. We have to learn to responsibly work with chatbots, and there's a lot of new research coming in that that is very difficult. And I haven't thought it through, but I think in medical education and continuous education, we have to test physicians' use of chatbots to make sure that they understand to critically evaluate their input. And I think this is not enacted anywhere, at least not in Switzerland, that I'm aware of, that there's any requirement for continuous education that includes actually AI technology. Maybe that is starting to happen, but I'm not aware of it. Yeah.
Can I just ask a provocative question then? If this isn't happening now, but we know that providers are using ChatGPT or other Gen AI applications in clinical care, what does that mean? What does that mean right now for the medical profession, for the integrity of the profession, and how do we sort of make sure to as either legislators or professional organizations or all the different numbers of actors and stakeholders who can influence this, what does it mean for what needs to happen now?
If I may jump in, so it's gaining momentum. We see across the OECD, so we conducted this survey, and we realized that 5 countries have already embedded AI education into medical curricula, 4 others as well updating the continuous professional development. So it is gaining a momentum on how to do it. And for instance, I can bring France, for example. France, starting from this year, is one of the first countries where it's going to be compulsory for medical students to undergo AI and data-driven training. So we see that there is change happening, but we don't have to forget, as with any new innovation, is that it's a learning process. As you said, we have to see first how healthcare providers are using those tools to then be able to provide critical judgment to it, and as well to adapt it to new demands that might arise in the interaction between the tool and the healthcare providers. So we have to recognize that, yes, policymakers, governments are seeing this as an opportunity and are starting to work on that. But this as well takes time, that there's this human interaction that is also on the ground that is needed to refine it.
And Jana, maybe I can actually connect that with a question to you, which is, you mentioned the MDR and medical device regulations and what's supposed to happen before new technologies get into clinical care on the market. What's different now with AI in terms of the sort of clinical validation process? Are there new dangers? and how can we respond to those, and are there limits? Like, what kind of limits are we seeing in terms of regulatory scrutiny, and what does that mean for doctors who may need to step into that gap and protect patients until those sort of legal structures or regulatory structures catch up?
All right, now it's on. Good question. It takes time and patience, and I think most of the people seem not to have it. Everything should happen here at now. The problem is that the OpenAI, who has developed the ChatGPT, has not categorized it as the MDR. So the use of it for taking care of patients is illegal. And then the question is it a problem if a doctor does something which is illegal? I see it a little bit of a problem. I think there is very good uses and good future what comes to the AI tools, and I know there are plenty of tools which has been categorized as the MDR, and they are widely used, and there is a benefit of them. So that this is not the question that there is something that is totally strange and new, and it shouldn't be allowed, or it's not allowed. That's not the question. The question is that there are tools that are allowed, and then there are tools that are not yet allowed. And as we develop pharmaceuticals, we have to test them. We have to use them for patients in the research setting, that we can study whether they are useful, beneficial, and safe. And that is just a requirement in the medical field. And that unfortunately takes time. The median time or average time for a technology to be widely used in the medical field is 18 years. 18, not 18 months. It's 18 years. The AI has been there for a few years, so we can discuss in the 15 years that what might it look like. Of course, it comes sooner for some purposes, and it's used in a very, very narrow setting, and then it's coming broad and more general, and this is happening in the medical technology all the time. I don't see AI so different.
What about the technologies that are sort of falling maybe on the edge of the MDR regulations, right, which are supposed to make sure that they're safe and beneficial and provide information and instructions for use. But there seems to be maybe some technologies that are kind of falling between regulatory gaps in that process. Let's say just even sort of LLM, general LLM based medical information models or systems, right, that say, okay, well, it's not for the purpose of medical treatment, it's just providing information that a doctor can then use in their clinical practice. Medical encyclopedias are not medical devices, right? But this is different, yeah, in a way, and it can be used sort of off-label. So this feels like a risk. It feels like a new sort of risk, and maybe, Andre, you have some thoughts about this.
Yeah, again, very interesting question. Yeah, the thing is that if you use LLMs for education, this might be considered as fine and legal. If you upload any patient data into the model, if it's OpenAI, DeepSeek, or whatever, then it's not legal. I liked your provocative question. I must say that even though if it's not recommended and it's not legal to use ChatGPT in medical practice, I think that I can raise my hand, not that I'm using it in my clinical practice, but I think that there are many physicians using it in clinical practice, but we already talk about the education and literacy, and we here all know that AI might hallucinate. And we already tested ChatGPT and other LLMs, how it can hallucinate if you add some of the symptoms of the patients, that you can get some recommendations which are not correct, even with some fabricated citation or references. So if it's young colleague, young physician who is not aware about all these regulations. We have MDR, EU AI Act, and so on and so on. And what does it mean to get and not to get certification, and what are the certified medical devices or softwares? Then it's on us. And I'm happy that even Mikael mentioned that they are changing the curriculum for medical students. Well, we did the same, so we already have some basic courses focused on, let's say, very basic knowledge about AI in general and AI in medicine. And because nobody knows everything, we have a brain pool of people, bioeticians, lawyers, medical professionals, people from notified authorities, and we try to give them, let's say, a pocketbook of AI in medicine and AI in everyday practice.
Thank you. And what does this mean for patients, right? So we've been talking about sort of what it means for healthcare providers and their duties, but it's, I think also from a medical ethics perspective, it's more than just sort of checking a legal compliance list. It's something bigger than that. And so how does this all connect back to protecting patients' human rights? Maybe, Mikael, you can start.
Yeah, it's an interesting question, right? I see AI as empowerment really for patients, right? Because the internet already changed the knowledge gap between healthcare professionals and patients enormously. And actually, I was looking that up for this panel, kind of how did the internet change the patient-physician relationship, right? And, you know, patients obviously are more knowledgeable. And I think actually some studies show that it actually enhanced the relationship because patients were more informed. They felt more empowered. I think the discussions with the physicians were on a higher level. So I think there were positive effects. Obviously, also negative effects is information, misinformation stuff, clear. And how will this be enhanced now with access to AI? And I find that extremely interesting. And I see an empowerment factor, but also as I'm going back to this race, right? Who's the better chatbot, the physician or the patient, right? And so I'm asking myself, going into this panel, right, why leave the elephant in the room? Why don't we name the elephant, right? So if the physician uses the chatbot and the patient, why not have a third party in the relationship, the chatbot, right, in the discussion, right? And just think about the patient-physician AI relationship. Why not, right? I think clearly I'm crossing boundaries here, and I should. But as a researcher, I can think about the future, which might look different than the future we know right now. But you know, with voice-based assistants, just on the edge of being introduced, right? I could see a situation where we're sitting together as a physician, and we also ask the chatbot for an opinion. And you would think that this is unrealistic, but we did a study at the University of Zurich, just have one more minute, about situations about life-saving emergency situations where you're not sure, should you treat the patient, should you resuscitate or not? And often it's very hard because no one knows what to do, right? And actually in that survey with physicians and nurses and others, kind of they said, well, why not have an opinion by a chatbot? You know, we don't have to take the advice, but sometimes you need an icebreaker after the discussion breaker, right? And, you know, maybe the chatbot has an idea what to do in a certain situation. It doesn't mean it should override any opinion. It's just an equal opinion, an opinion that should be taken into account on an equal basis. So, yeah, not sure.
No, this is very interesting, and to really sort of think about, okay, is the patient-doctor relationship turning into a three-part relationship in some way. And I think this is the time now that I should talk about digital paternalism, to say, how do we make sure that, let's just assume for the sake of discussion that there is a patient-doctor AI sort of conversation happening. How do we make sure that this digital paternalism fear doesn't play out, and that the AI doesn't start controlling the decisions and taking away therapeutic autonomy from the physician or the healthcare provider, and taking away autonomy from the patient?
Well, I think today the AI as the ChatGPT kind of the solutions are used as a search engines or as an oracle. The people wanted for at least 2,500 years have someone to tell what is the true, and if they feel ill, what they have. And I think that today the systems are used as a search engines, similar than they go to the Google and search internet. I have this and this, I have cough and I have running nose, and what could I have? And then they go to the doctor, and doctor might listen to patient experience of using the internet or ChatGPT, or doesn't listen to that. But in the future, I think it will be used in this kind of the setting that let's call the AI Joe for simplicity. The patient asks Joe, "What do I have?" And then he goes to the doctor and saying that Joe says that I have cancer. And it would be much more difficult for a doctor to say that, no, you don't have any cancer, you have sore throat or whatever. Or they might be a setting where, as you define that, the patient comes to the doctor and doctor asks Joe, what do you think what this patient has? I think that we are having this kind of a future in 10, 15, 20 years, but I don't think it's here today.
It sounds like the discussions are happening now in a way. Patient AI at home, and then patient doctor with AI as the elephant in the room, as Mikhail says. And the question is it better to put it all out there so that there can be more of a discussion? But maybe I can kind of go back to Katarina with a new question about institutions, healthcare institutions, because you talk about the whole workforce, and how can healthcare institutions support responsible, safe, and ethical adoption of AI in a way that's scalable and can protect patients at that larger level?
If I may just come back to what was said previously, I think it's a bit problematic to speak about this triangle. Perhaps we should rather ask the question, how much do patients and healthcare providers rely on the output that is being generated by the AI, which as well raises the question related to trust. And I think we haven't yet talked about trust, but this is also something that we are seeing more and more across healthcare providers, that they're going to have, for example, examples you gave were quite extreme, if I may say, but then as well the patient, how much is the patient going to trust this chatbot, which is going to give them, that just based on some very high-level symptoms that they're going to introduce into the system, that they're going to receive such kind of result. And I think this is also some of the impact that we are seeing into this human-to-human being augmented by AI relationship. And I think it's as well important to keep that in mind, that we're not yet at that stage of automation of agency to this AI, because we haven't reached yet that level. But I see that I'm raising some.
Sorry for interrupting you, but this is a great point. But I think that even from the neuroscientific point of view, we build a trust on anything according maybe some of the let's say, specifics like empathy. And empathy is very important. And I think that healthcare professionals in Europe may be the reasons, there are many reasons, but we are, this is my opinion, maybe losing the empathy. And AI, according to some of the research papers, might, because it's more empathic than a human being, some of the patients might feel that if they have a conversation with AI chatbot, that it's even more trusted than physician because it has more time. You can ask as many questions as you want. But this is, if we are opening this discussion wider and wider, and there are some data that, yes, patients sometimes consider talking with chatbots even better than with physicians because there is unlimited time you can discuss your conditions.
Maybe I just want to add one point about patients adding maybe not enough information to the chatbot and it might be incomplete. But, one of the, I read the conventions and one statute is that patients should have access to their own data, should have the right to have access to all the data. There are these patient records now, you can access all your data. And honestly, why can't you connect the chatbot right to, if you want to, if you give access right to all your data all the time, so we're talking here about almost an avatar situation, right? No, I do believe into a future where patients have a lot of autonomy with their AI, right? Accessing all their data and asking Joe, right, what do you think? Am I healthy today, right? So, and they don't have to actually enter this data. So I could see that future too, right? But that's not here yet, but I could see that future.
It seems that patients have been primed and professionals too a bit with the kind of Dr. Google, but there are differences, and it could make it could be beneficial, but it could also be very risky depending on how we approach it in the next transition phase. I want to go back to something that was mentioned at the very beginning of this conference today, which is kind of the legal standard for healthcare professionals, which is this kind of duty of care. And if we speak in the most general terms, it's about reasonableness. What's reasonable? When can a provider reasonably rely on an AI decision? When can they reasonably sort of put it aside? And now this is coming from me as a lawyer, thinking about liability, but I want to kind of flip that on its head because I know that clinicians don't wait around for lawyers to figure out. There's no time. Patients are coming in today. We can't wait for the case in 5 or 10 years, right? So like, what can we reasonably expect in the kind of near term from healthcare providers in terms of their professional responsibilities? What are reasonable expectations, 5 years from now in terms of integrating AI-driven technologies, whether they come through the MDR as a medical device or whether they're kind of lingering on the outside?
Okay, maybe if I may start, because we already implemented some MDR certified technologies. I'm a neurologist, so I will talk about 2 different diagnoses. One is stroke and one is multiple sclerosis. Stroke is acute condition, so at the time it's very difficult to explain to the patient what it's going to be done with his CT scan. So how it works, if there is a patient with stroke, he's coming to the hospital, he's seen by a neurologist or other specialists, then the CT angio and perfusion is done. And if I want, I can send the data to the cloud, and then the data are processed. And within 2 minutes, I have the CT angio and CT perfusion scans. It's available in the Czech Republic, other countries. And I can look at the scans by myself with radiologist, and then I can have this decision support tool which might show other specific. The sensitivity and specificity will never be 100% because all these tools are trained by, let's say, physician, and even in my early research career I did this like ROI assessment, so I know that it's basically based on the quality of trainers, how good we have the tools. And right now in neurology or radiology, all the AI technologies we use are closed systems. So it's basically a software what we have. It's not learning according to new data coming. And basically what we do in radiology and neurology are post-marketing studies. So we are testing the AI tool in everyday clinical practice. And it's not only about the process of implementing, and I know, Mindy, that you are a lawyer, and contracting, it's a huge bottleneck, like contracting between the hospital, then the company which is developing the AI software, hospital lawyers and the company lawyers, so it might take few months to implement certified AI tool in everyday clinical practice. And yes, I always try to communicate with my patients with stroke that their scans will be processed by AI technology, but sometimes the patient with stroke has difficulty understanding the language. Sometimes there is impaired level of consciousness, so it might be difficult. Another diagnosis is multiple sclerosis, which is not acute, it's not emerging, but you need MRI to measure some specific data on MRI, and based on MRI you can escalate the treatment, so in Europe. So basically you should measure the level of brain atrophy. If you do it manually, it's like, sorry for that, very like time consuming. If you have AI tool which is certified, then you can measure the amount of atrophy within a few minutes, and basically you look at the scans as a neurologist with the assistance of a certified radiologist, and then you have a report from AI. And we always use it as a helper, and also because it's in like a beautiful final sheet, so we can present the patient the data, and then basically the patient is involved in the diagnosis and treatment. So this is just few, let's say, examples of clinical practice, and it's, as we mentioned here, it's a big era right now, but still we are at the beginning. And to be honest, I don't know where we will be in 5 years. Maybe ChatGPT will come with certified tool for healthcare professionals. I don't think that this will going to happen, but maybe, or DeepSeek, but we will never use DeepSeek because thankfully in EU, all the data which are sent to the cloud centers are in EU. So we are not sending data to China, India or other countries, which is also very important to mention to our patients, because if you mention the term cloud, they don't know what is cloud, most of them. Even I didn't know what is cloud 5 years ago, to be honest. So that's from my point.
Yeah, these are really great sort of concrete clinical examples of what's happening and maybe what we can expect. Jana, did you want to add?
Well, I think for some years to come, we are using the AI in the narrow setting as in examples as you defined, and I told earlier. But I start wondering about one word you said, and that was reasonable. Whether in the future, when these kind of the general AI systems come around and maybe perhaps certified for clinical use, if the doctor's role would be priority setting and answering what is reasonable, since if the patient comes with a symptom of headache, the MRI scan is usually not reasonable, at least at the first point. But if you ask a machine what should be done, that might be a logical answer, that the MRI scan would be a good starting point, since without that we couldn't know what it is. And not all headache patients can be done the MRI scan. And well, I don't know whether that would be happening, but I start wondering, since that could be one role of a physician in the world, where AI knows much more than any physician do.
Yeah, no, this is a really interesting question. I think something that legal scholars are discussing quite a lot right now is what is the standard of care and how is it changing? How is AI changing it? So if the standard of care is sort of reasonableness, what a sort of objective, reasonable physician in this level of field of expertise under these circumstances would do. When does that start to integrate AI, or has it already? I think maybe not, but maybe you have thoughts on that. So, of course, reasonableness. Lawyers like to use these broad terms because they allow the law to be flexible, but it also creates quite a lot of uncertainty for providers and for patients, and how that frame is going to be protective, like in the near term. So yeah, I'm curious to hear like how you think the practice will change as AI becomes integrated into what's kind of the conventional treatment, or whether it's experimental, or these kind of thinking about it in those terms.
Well, AI is already impacting. We have Andre who gave us very practical examples, and across the study that we conducted, it is clear it is already there. It's being used by healthcare professionals, by nurses, community workers, but now it's the question on how to meaningfully use it. And for them, we're talking about liability, how to integrate them, but we don't have to forget that physicians, healthcare providers are providing care. And now is as well, raising the question, of course, what is going to be the acceptable level to integrate them into this co-design mechanism of developing those tools, of deploying them, but as well of critically monitoring them. Because at the end of the day, if I may put myself in the shoes of a physician, I would like this tool, of course, to help me in my work and not to add additional burden. And this is something as well that from this professional standards point of view, we also have to consider. An institution in general are also starting to tackle, but we should leverage the speed of innovation, but at the same time, as I said this morning, we should not be creating harm for patients. And now is really this exercise where we have to bring these two directions together in the same way. And I think this is going to be as well the challenge next 5 years, let's say just that, but how to bring these two ethos together.
Yeah, just some general thoughts about narrow AI and this new AI, ChatGPTs that can seemingly do multitask anything, right? And from the reception, that's what doctors want, right? They want this one tool that can do everything. But we don't know how to evaluate that really. And so we do all these narrow tools we heard about before. The problem is, how many narrow AI tools can you actually implement without annoying the doctors, right? I don't want 10 AI tools telling me what I should do. I want one chatbot to tell me what to do. And so we can't really evaluate that. So we have this issue. So we have to find the sweet spot. We have one project we're starting in Zurich. It's called the AI Tumor Board. So that might be a reasonably broad setting where the AI system will suggest a list of potential drugs for beyond standard of care treatment situations. Maybe but you need this kind of reasonably broad areas, and not obviously some narrow areas are very important, like stroke management, but there are not that many where narrow AI really makes sense, right? So anyway, just some thoughts here.
Yeah, those are excellent thoughts. Yes, thanks, Jana.
One thing I've been wondering for some years now, and at least in this panel we haven't discussed it, since typically when you are talking about the AI or ChatGPT kind of tools, you are looking for answers. But what if the AI would be more beneficial in setting questions? And for example, we have a lot of data in healthcare already in most countries. What if there would be some tool to crawl in the data and making questions whether it would be reasonable or whether it would be worth enough to have a second look and research project perhaps?
Yeah, so Jana, this is interesting, and thank you for this comment, because even I was questioning myself if I could upload the data regarding the Czech healthcare system into the ChatGPT. I'm just, curious, and ask what are the bottlenecks in the Czech healthcare system and what we can do to improve our care, how we can be more time efficient, also how we can spare some money, because this is another thing, financial issues. Other thing, we should also mention that I don't know what is the situation in other countries, but in the Czech Republic, all the certified AI tools, except one, are not covered from the Czech healthcare, from the insurance. So I don't know how it works in Finland, but basically if we want to implement any certified AI tool, we usually do it based on some research support. So we need to get the money. The only exception is the screening of diabetic retinopathy in patients with diabetes, which is covered by health insurance, which is public in the Czech Republic. But what is the situation in Finland? Here it's covered by your insurance, or I know that your system is different, and I know that there was, the process of.
Right. We don't cover exact technologies typically, so that if the hospital takes the AI tool into the use, it's in the budget, and it's not covered patient by patient, and not even in the private field.
Just want to go back to something you said. One thing we could do immediately is essentially run AI in the background for all our patients in the hospital. And if the chatbot or the AI sees some discrepancy between state-of-the-art treatment or guidelines and what actually has been done, a caseworker could notify the physician, hey, are you sure that you didn't want to do that treatment instead? There could be this guardian angel functionality in the background, and so that could be a reasonable way of using it. You ask about reasonable ways without directly interfering patient care. It would be interesting whether we could actually do that.
So sort of AI and for clinical risk management purposes, right? To kind of catch the human error that we know exists. Because I think sometimes we think, well, humans are perfect and failing to recognize that they aren't. And how can we improve what's happening now without introducing risks to patients' human rights? We have 4 minutes now, so maybe I'll just pose a question. You can either reflect on it or give one final takeaway, because we discussed this a bit in our pre-meetings about the role of healthcare providers in developing and training and providing feedback. So this kind of life cycle, the importance of ensuring quality of these systems throughout their life cycle, which is a bit different than static medical devices. So either, maybe reflecting on that role for providers, or something else that you kind of want to leave the audience with, maybe sort of 45 seconds per panelist. Tick, tick, no.
I will start my 45 seconds. No, I think definitely there's a blind spot, as you said, and we've seen it across countries. We have the physicians at the beginning of the chain, the data cycle management, if I can say like that, but we lose them along the way and at the end. And this is where I think we should also start to focus our attention in how to onboard physicians into improving those tools, at the end of the day, to help themselves. And in parallel, it's not just providers, but it's also co-engaging patients. And as I said, more than half of OECD countries have implemented some formal processes on how to engage that. And we should see that much more often. And it shouldn't be just few exceptions, but we should learn from that. And it should be this as well virtuous life cycle learning process.
Yeah, I think the future is intelligence. It's both human intelligence and in artificial intelligence, and both of them are black boxes in the way. That also the human intelligence is a black box. And yes, there should be as much transparency as possible. As what comes to the artificial intelligence, it's much more possible or to much widely possible that what comes to the human intelligence. I know a lot of things I cannot explain, but the artificial intelligence can explain more.
So we're in a transition time. You mentioned at the beginning, we have a generation of physicians have never used ChatGPTs, and the youngsters in the medical schools, they only use ChatGPTs. So we can learn from each other, but we should come up with processes to educate the students so that they question the AI, that they form their own opinion. And I think this is the time now where these two generations meet kind of to form this kind of curriculums. And it's really needed, and we should get going. Okay, and me, 45 seconds. So AI is here, AI in medicine is here. Actually, Jana took my idea that even our brain is a black box. So that's the thing. What do we need to take into the consideration? But I just have like one idea. If you close your eyes and imagine the situation that you are coming as a patient to the hospital. There is a human physician and there is let's say bot physician, and both are taking your history and everything, and they are cooperating together. Then they are discussing together what they will be doing. You are sent, based what Jana mentioned, to be reasonable for MRI. There is another let's say system or software which is analyzing your MRI, and then basically you have two human physicians, neurologist or any specialty, radiologist, AI tool for MRI, and then a chatbot, and basically you will get a synthesis what it might be. Can you imagine this situation, and would you say, yes, I want this, or you would just come to, let's say, outpatient clinic with plain CT scan and old cranky radiologist without AI? I know that now I'm a little bit more, affecting your emotions, but I'm not suggesting what you should vote for. You don't need to raise your hands. It's just my closing remark. Thank you.
Thank you for leaving us with that to ponder. I think we will, this concludes our panel, so thank you all for the wonderful discussion, and I will turn it back over to the conference organizers.
Isn't it so that the black box it's not that bad if you think about the aeroplanes? That's a box which contains everything. So let's move on to the last session, health data and AI systems. So, and our moderator, Joni Komulainen, Senior Minister Advisor from our ministry. And then Visa Honkanen, yes please, Director of Customer Relations, Helsinki University Hospital, Helsinki. Marcela, Director, yes, DG Sante, please. Then Andreas Christodoulou, yeah, great. Director, yes, Cyprus Federation of Patients Association, Vice President of Cyprus National E-Health Authority, yes, please. And then we have Tanja Motka, yes, please, Senior Officer, Office of the Data Protection Ombudsman, Finland. And then, please, Yehor Yamurov, Parliament Commissioner for Human Rights, Ukraine. Please.
Okay, thank you, Tula, and it's the last panel of this day. Hopefully you're still awake. We actually barely awake. Okay, I just dropped my nose. It doesn't matter. Actually, I was sort of prepared that it may come to a situation that this being the last panel will be late in the program. But thanks for all the panelists and thanks for all the moderators. Thanks for Tula for keeping an eye on time. So we have plenty of time. That means that I won't be saying to the panelists that you got 45 seconds to answer the questions. You got plenty of time to answer my questions, and we can have a fruitful panel. Many of the topics raised already today are related to of course, data and AI systems. So we will be touching upon the same topics that we have been touching upon the entire day. And I'm going to introduce myself. I forgot to do that. Of course, you can see the slide regarding me. I'm Joni Komonen. I'm a senior ministry advisor from the Ministry of Social Affairs and Health. And I'm a data protection lawyer by trade, EHAT lawyer, and maybe some sort of AI lawyer as well to be. And why I'm here as well is and it's wonderful actually to see this report in my hand, because I haven't actually seen it before. And why I say it's wonderful to see this report in my hand, because I was the chair of the drafting group. So the drafting group did this report, and of course the city bio finalized the report. We did it together, of course, in close cooperation with the Council of Europe Secretariat, Mr. Lee Hiba, so thank you, Lee, for this. And Lee and I got the idea of, not just, publishing a report. We want to have a real launch, and this is the launch, and, do a follow-up. So this is the sort of follow-up to our work, and let it may continue. But today, and in this panel, we will be talking about especially data. We have touched upon many things regarding data protection aspects. We haven't that much touched upon data security aspects, but we can in this panel. But when I was starting to form the panel for this panel, actually, the basic ideas, and actually for all the panels that we had was to have 4 different questions. We're going to start with possibilities. A second thing is going to be the challenges. We have talked about challenges a lot today, so hopefully the third thing will be, and what we have been achieved already today, thank you all for that, is to find solutions for the challenges. And the fourth topic will be what will be the key messages from each of the panelists. One lesson learned, hopefully, for the future. And we're all in this same boat that is being steered by some sort of captain and some sort of co-pilot we have is this AI. And hopefully, we're actually at the moment, we're on the boat, we're the patients, and then we have this new co-pilot. But I'm gonna start with the questions, once I can reach my questions, and actually I can see something. I'm going to start with Andreas, and Andreas and all the panelists can do a pre-presentation of themselves as well. But the first question to Andreas, directly directed to you, is what does meaningful informed consent look like in the age of AI?
All right, hello from me. Thank you for still being here. I know it has been a long day. So just a little bit of myself. I'm Andreas Christodoulou. I'm from Cyprus. I'm a patient and a patient representative, and I also am a board member of the European Patients Forum. I was diagnosed with cancer when I was 16, and also now I'm living with Crohn's disease. So I can say that it's been like close to 20 years that I am a patient. So autonomy, informed consent, this is something really that was in part of my whole life. So now with AI, we see things are changing really quickly. And one of the key challenges that we see is to keep patient in the center of those conversations. By keeping us, we have the right and we deserve to know of how our data are collected, are being used, and we will discuss more about the challenges later on, and Joni mentioned. And so as my starting opening statement is this: we all need to keep patients and citizens, in a way, in the center of this conversation. And with us, we bring a really great stakeholder mind into the table, where it's that health data is not just informational for us, it's deeply personal.
Thank you, Andreas. So Andreas is the director of Cyprus Federation of Patients Association, just to remind all of you. Of course, you can see it at the same time. And then to Visa Honkanen. Visa Honkanen is director of customer relations from the Helsinki University Hospital, Finland. And my question is the initial questions of AI systems, lots of data, health-related data. And we would be happy to hear of the possibilities in the use of health data and health-related data and AI systems, your expertise and experiences from Helsinki University Hospital. It's a wide topic, I know, but it'll take plenty of time. Thank you.
Thank you. My name is Visa Honkanen. I'm a pediatrician by education and statistician by research, and why I'm here, I guess it's because I was in charge of our digital and AI development for 10 years before my current position. And this is really like customer in here means the other organizations and not the patients themselves, but I still see some patients, so I have some touch for the reality as well. So the possibilities are so vast that I think the main challenge is to find what to do first, and then do it well enough so that you actually start to get some benefits of what you are doing. And at the moment, the best results and maybe the most benefit what we get from the AI at the moment is this kind of, in parentheses, conventional machine learning algorithms in diagnostics and helping to help patients. So that's one thing. And then, of course, large language models, they are there already, and they have a lot of possibilities. And as still a practitioner of the medicine, I would say that the elephant is solidly in the room, because at least half of my like when the kid comes with the parents, at least 50% of the cases, the parents have either Googled or discussed with GPT or Grok or so whatsoever. So basically the Grok is there already, and then I have to just to manage the situation. And in here, I think we are at the moment, we are really like searching and trying to find out what would be the best ways of doing these things. Enni Sanmark was here before, and they are doing really interesting work in Western Uusimaa, and we do the same kind of things, and using the language models to in this kind of ambient recording that it listens to the discussion and then makes the notes. And it seems that there is some reluctance from the healthcare professionals to actually teach it enough. So there is some this kind of societal issue in getting those in use. But the lowest threshold and lowest hanging fruits are in the situations where we have patients from different cultures and we don't speak the languages, because these kind of language models, they can be of big help. And then of course you can say that how can you know that it said the right thing because you don't understand the language? But in some cases it can be the same problem with the living interpreter, because you are a doctor and you tell medical things, and interpreter is a layperson, maybe he or she also does mistakes. But I think these kind of administrative purposes, diagnostic algorithms, and then translator situations, they are the three ones which are in use already. Thank you.
Thank you very much, Visa. Very, very interesting, and it shows the huge amount of possibilities, and of course you're raising some challenges as well. Next we move to Marco, and Marco needs no introduction because he was introduced to date already. And I actually decided to ask Marco here is, the initial idea was to talk about the European Health Data Space, but we won't be talking about only European Health Data Space today. We will be talking about a European Health Data Space a lot. It's sort of, I was even thinking of saying it's our mutual baby. And it's a baby of European community and member states together achieving something very quickly. So we have the European Health Data Space Regulation. It's a huge achievement. On top of course, the AI Act and so on. But the question I actually really wanted to ask you, Marco, was regarding the promise versus the reality. So we often hear that AI can enhance care, but in your view, what are the real enablers and blockers to deployment of AI in clinical practice today?
Well, actually, the meeting today highlighted. I get this one. Yeah. So I think that the meeting today highlighted most of them. I said this was a great meeting. Exactly because it pointed to several of the challenges that we are facing today. But, we have started these conversations with the issues of integrating technological solutions in healthcare settings, and we are going back to the same question. So essentially, probably what we should do as a follow-up to this meeting, it is distill some of these elements and possibly even go further. And I say here that it's clear that if you talk about diabetic retinopathy, there was no discussion whether you want to use that particular AI to get the spot, yes, no. I mean, by the way, when you ask the questions, how many images have been used by Google to train that system? It's not millions, it is in the orders of thousands. And it's quite interesting. Now, the real question is, if I want to move from diabetic retinopathy to something else, we were mentioning neurological diseases, where do I find this data? So the challenge, it is to access a real data sets that allow an innovator to propose a technological solutions. And we don't have that level playing field today. Forget. If I go to a hospital, before me there are probably 5 CEOs that are asking the same questions, and either you do the first that comes, the first is served, or the biggest that comes is served, and the rest waits. The point is exactly that in Europe, because of building on these incredible assets that we have, it was necessary to address let's say, the level playing field, so that we do have technological players that come in here. Now, we can solve the problem technologically, probably, the diabetic retinopathy, but if we don't play with the healthcare professionals that will need to integrate in their professions, including on how the liabilities is played for, then it will be it is a change management process. Probably we mentioned that there will be resistance. Now, the real question to me today is, after this discussion, is do we go specific, or do we continue treating AI as this big elephant, with 4 legs and that are, by the way, going in 4 different directions? And probably we need to, at some point, we need to go narrow and decide where we want to go, because the story of the chatbot, it's a pretty interesting one. We are going into, say, for instance, at least there we are going into the digital therapeutics matter, and that opens a completely different new discussions. But even the chatbot with the doctors, it is quite an interesting metaphor, The panelists say you go to the hospital and you are confronted. Actually, I was commenting before, if I have a chatbot, I don't go to the hospital. And that is a little passage in the management process that changes everything. Now, I think that nobody at the moment is saying, well, you know what, let's replace the doctor with the chatbot. So if this is the discussion, I think that, we don't do it, let's move on. So I would distill the elements of today, and Tula probably go bigger. with the next round of discussion.
Thank you very much. Tuula said she's a pilot person, and you know, pilots are always a good idea to test and try ideas. You know, if it's the big elephant in the room, you know, let's cut it in half or in smaller pieces and try to manage with the challenge that we have. Hopefully not cut it in pieces, but you know what I mean. We certainly have lots of possibilities regarding the use of health-related data. Okay, we have the European Health Data Spatial Regulation. We have lots of incentives and possibilities, lots of data available, and you know, maybe slowly but gradually we have higher quality data sets as well. It will take some time. It doesn't happen overnight, but we have the possibilities though, and it's great that we're doing it together in Europe and making it not just a European way of doing things. It's making a way of doing things throughout the world, hopefully. So that's how I see it. But then I'm going to move to just let me check my notes, to Tanja Muotka from the Data Ombudsman Person's Office. And many things related to data security, data protection actually were mentioned today. And the convention, for example, Convention 108+ was mentioned, and many principles were raised by, for example, by Virpi Koivu in her intervention. I seem to be dropping papers today. But there's a question to Tanja. From data protection perspective, how do you see AI providing opportunities to improve patient care? So still we're talking about possibilities. And is it possible to enhance patient outcomes while preserving data protection and privacy?
Yeah, thank you. So I work as a lawyer at the Finnish Data Protection Authority, and it's really nice to be here and see you all. Well, when we talk about data protection in healthcare, we are actually talking about trust, and not only as a regulatory goal, but of course, as we have talked today, it's the foundation of good clinical care also. So if we want AI to be accepted, effective, it has to earn that trust, and one starting point at least for earning the trust is responsible data use. So yeah, obviously AI has enormous potential to improve patient outcomes, and as very much discussed today, it must be realized responsibly, and I personally do think that it is possible also to do it responsibly. So the foundation of effective healthcare is trust, and it shouldn't be taken for granted as we integrate new technologies into healthcare. I'm maybe talking a little bit also about the possibility part, but also the solution part. But from the data protection perspective, the good news is that we don't need to reinvent the wheel from scratch. Many healthcare organizations already have strong governance tools in place, like data mapping practices, data protection impact assessments, and internal governance procedures, and so on. So these can support safe and ethical AI adoption too. But of course, from the Data Protection Ombudsman's Office, we highlight that a careful approach to data protection is essential, and it lays the groundwork for the responsible and trustworthy adoption of AI in healthcare and in all the society. Of course, sometimes we hear that data protection aspects slow things down too much. And I see data protection as sort of a modern extension of the principles of confidentiality, respect, safety that have, of course, been the cornerstones of healthcare for like always. Yeah, data protection supports the solid foundation for sustainable AI. That's my starting point.
Thank you very much, Tanya. Excellent words of wisdom from your side. And of course, we need to take into account basically things like data protection principles, basic human rights, and ethical aspects as well. That's how we gain trust. That's how we have this big elephant in the room, or smaller elephant in the room, that we can tackle and get to know better. But then I move to Mr. Yahur Yamirom, from his Parliament Commissioner for Human Rights in Ukraine. And welcome to Finland, and lovely to have you here. And he's a data protection lawyer. Well, it always was my heart, to have a fellow colleague here as well. Of course, Tanya is as well. But regarding Yahur, the question I wanted to ask you is, what do you see as the main opportunity that AI systems offer for the use of health data in healthcare, and how might they transform the patient-doctor relationship? And this sort of refers to the basic content in the report as well. So go ahead.
Thank you for this question. Hello everyone, my name is Yegor. I'm from Ukrainian Ombudsman Office. Nowadays we act as a DPA. Generally we exercise Parliament control over the personal data protection sphere. And I would like to start and say that during the COVID time, one of the biggest jokes was that when you came to the doctor who studied during COVID time and sleep during online classes, he will surf the internet and try to find the solution how to treat you. And so nowadays it's a reality for us. But at the same time, artificial intelligence can strengthen the patient and doctor relationship, so it not by replacing the human connection, but enhancing it with timely insights, broader access, and better personalized care. So from one side, if you use AI responsibly, it can improve your healthcare that was never previously expected. It can process amounts of health data to assist doctors in diagnosis nowadays, conditions, personalized treatment recommendations, and so on. But at the same time, the most important thing is that AI can give doctors more time to do what no one algorithm can. It's just connect with the patient and the doctor. In Ukraine nowadays, under the war conditions, we witness that digital tools can improve access to medical service. For example, we have a platform, Healthy, which give patients access to the medical data for the treatment process, for the results of the testing, and that is why they test an AI tool that explains the blood test results to patients. The most important thing is that the patient must give their concern and understand all consequences. That AI can't give you a full picture of your treat, and because AI don't know your anamnesis and so on and so on. That's all.
Thank you. May I just add one more thing? I think we could also speak about right to be analyzed, which means that previously research was done and then the treatment guidelines were written, and then the doctor treats the patients individual by individual. But now we have a possibility with AI or with any kind of advanced analytics to collect the data. For instance, if you have 200 patients with diabetes, you can collect the data of all your patients and compare those data to some other group of patients, or then just look that you are actually treating all your patients in the right way, so that there are no like dropouts or anything like that. And this is also part of the informed consent that you, when you give a consent, you also get this kind of benefit of giving that consent. It doesn't mean that you kind of buy the patient's data by that way, but we have to understand that there is, doing medicine is very different today than it was even 10 years ago. Thank you.
Thank you, Visa. You're absolutely right, and we could get into debates regarding the use of consent and what sort of consent we actually talk about it, especially if us lawyers would start to talk about consent, we would be talking about certain kind of consent, and doctors probably will be talking about the informed consent, which is the informed consent relates to, of course, the intervention. And usually lawyers and data protection lawyers are talking about different kinds of consents that relate to the processing of in this matter, to health data. But you raised an important topic regarding the possibilities of using health data for the so-called primary use purposes and also for the secondary use purposes. The purposes that in the primary use settings are benefiting that patient and possibly other patients as well, but the secondary use purposes that are benefiting the general public as well. So many different aspects and very difficult topics can be raised if we talk about consent, especially different kinds of consents. But let's not try to get into that deeply. But I won't stop the conversation regarding that topic, of course. But next we move to. Thank you for the intervention, Visa. Then next I return to Andreas, and now we talked about the possibilities. Now we talk about the challenges again, and hopefully we find the solutions as well. So how can we ensure transparency? And this actually refers to the topics that we have talked about already today. Transparency and trust when AI is involved in clinical decisions.
All right.
A very difficult question, so sorry for that.
It's a difficult question, but it's up to reputation for everyone, for us. So I'm just going to take from the informed consent part of it. In order for you to have an informed consent, you need to understand of how the data will be used and be reused. Most of the patients, most of us don't see that. We want to know our data. It's up to our immediately personal care. So most of us don't understand that they will be reused for building or learning machines and for secondary use. So building trust and getting to know and knowing of what our data will be used, trust and transparency of when those data will be used and how they will be used is building trust between patients and the healthcare professionals or companies that they will use those data for secondary as well, because now with the European health data space is part of that regulation. So yeah, in order to build transparency, patient needs to know of how those tools will be used. And now especially where AI is already here, we're not talking about in the future that they will make our current treatments change. It's already happening. Already treatments are changing based on an AI algorithm. More and more healthcare professionals are using learning machines for that. So the end answer of that challenge is to have mechanisms in place that AI tools it's a tool and will not replace the patient-doctor relationship. So it will enhance and build on transparency and trust. It will make a great tool for both patient and doctors for the future.
Thank you. I'm just going to ask, in Cyprus, do you have some sort of solutions how to handle the transparency requirements, the information of the patients? Because I think that's the real challenge. How to inform the patient what sort of health data is being used for various different purposes, and even that can be done, but it's difficult because one day you will be using for this purpose and the next day will be used in different purposes. Third day you will be using to help others, and then the fourth data you will be using to train on AI algorithm. Fifth data you could be using to help the general public, and so on. And sorry for this difficult questions, but this is the question regarding the transparency and informing. And the real question is how to inform the patients, the national persons, of the AI system being used. Does even the doctor, is he the best expert in explaining the system? Sorry for the question, but anybody can intervene, but you can start, and then Marco.
I wanted to come in on, say, the picture that there is a sort of far west on what we are going to do with the health data, and thank you for highlighting that, because I think that this was one of the great points in the European Health Data Space regulations, which, by the way, I share totally your message that this is a co-creation of European people working with the European. So I very much appreciate your comment there. So the European Health Data Space, when it comes to the reuse of data, so say, what do I do with that data? It's very clear on what you can do with that. So it tells you if this reuse is possible for these cases. There is a list. You cannot go outside that list. And it's one list for 27. But it does more, and that's where it gets very interesting. It tells you also what is prohibited. These things, so if you go in the articles of the regulation, you will see that, for instance, one of the things that is prohibited is the attempt to re-identify people. No matter how you have collected anonymized or de-anonymized data, the act of possibly re-identifying data in whatever form is a prohibited act. And there are consequences attached to it, which are covered in the European data space. In the sense that in terms of transparency and accountability, I think that the regulation there has created not only the level playing field on, say, everyone acts on the same grounds, but also on how you do that, for which purposes and with which effects. And the fact that, that we publish this network of health data access body, by the way, also originating from the experiences in Finland, the fact that that there is these provisions for which the data is being used for something, and that act is visible to everyone, it is contributing to the transparency points that you are mentioning. So, yes, I just wanted to make that point. Sorry.
Thank you very much for your intervention. Visa, would you like to continue with that?
Just continue and just sorry. Is it working? Yeah. Oh, sorry. AI. I can't use the microphone, so that's very convincing. But anyway, let's think about the context for a while. That if you think about like a health data or data and use of the data to know things about our health, we share a massive amount of data on ourselves, on numerous actors in internet, which are not directly health data, but which can be used to do inferences on our health. Already 15 years ago, it was possible to just to check that how do you interact in Facebook. They were able to see whether you were depressed, and then they started to push advertisements for cosmetics or something at that point. And then we have maybe smaller amount of data, but a lot of data, actual health data, which we share with all these GPTs and everything, not thinking about where does it go, who might get it, and so on. And then we have this small amount of real health data created in healthcare. And that data is luckily the best secure data at the moment, like the data in EHR systems and so on. So I think the biggest risks are in that non-health data shared everywhere and health data shared very widely. Thank you.
Thank you very much. Great points. Thank you. Thank you, Visa. Did somebody want to continue on that line? Andreas?
Yes, and that's why I'm going to take the opportunity here. That's why patient organizations are really helpful of educating patients and how your data needs to be shared. So that's why patient organizations are keen to that, and we are doing a lot on health digital literacy, and we need to to implement the health digital literacy of how to educate people, not just patients, in citizens, of where and how and why they should share their health data.
Exactly, thank you for that, and thank you for the excellent intervention by Marco and Visa. And transparency is the key for success, for trust, definitely, and especially if in not all the cases your health data is being processed based on consent. It can be based on legal basis. But you still have a certain amount of self-determination, whether it's co-opted or whatever principle. But you still have the rights. But the transparency is the key to that people understand that the data is being processed and what sort of purposes, and not to certain purposes either. So that's important that we're on the same boat. And we really need to keep an eye on the transparency and informing the patients that we're on the same boat. And the goal is, the mutual goal is for the common good, not just benefiting myself, but benefiting all of us. But then regarding the challenges, I'll return to Tanya again. And we have already raised data security, not actually we haven't raised data security, data protection concerns, but the data security concerns as well, that actually Visa touched upon as well, that the actual health data being processed within healthcare is usually processed and handled in a more safe and secure way. And especially, I'm not going to go much to the European health data space, but in the secondary use part of the European health data space, there are safe and secure audited environments where the health and health-related data is being processed. But to Tanya, my questions would be, what are the biggest challenges in ensuring that AI systems in healthcare comply with data protection legislation?
Yeah, thank you. I will partly repeat what Virpi earlier said in a previous panel. I will try to add on it. From a very simplified data protection view, AI is ultimately just a range of systems, a range of means to process personal data. And of course, whenever personal data is processed, we need to comply with data protection legislation, which sets out obligation to the data controller and also rights to the data subject. But of course, as discussed earlier today, AI has its specialties compared to other kind of means of processing personal data. It doesn't just process data, it can shape decisions. AI is powerful and it certainly has to be governed with care. And depending, of course, the biggest challenges depend on the use case and the specifics of the use case. The biggest challenges are different. We can point some of the most usual challenges, as Virpi already presented many of these earlier today. But of course, the exhaustive list is different in every case. If I would have to analyze from a data protection point of view AI system, I would of course start, as I always would, with complex issues from the basics. Are we processing personal data? Are we doing something else? Who is the controller? Who is liable for this compliance? If we are controllers processing personal data, we have to check purpose limitation, legal basis. It relates to the consent part also sometimes, but maybe we'll get to that point later. But we must first of all look at why we process health data and not just how we do it. So each purpose must have a lawful basis. We need to go beyond a system-based thinking to purpose-based data governance. And of course,
we have to check what we're doing with AI. If we want AI to make important decisions on treatment or have control on treatment-related decision-making, so we need to comply with Article 22 of the GDPR that relates with the automated decision-making. But as said earlier today, and in this panel too, the biggest challenges, one of them is understanding how these systems process data and making those processes transparent and accountable. So the black box effect is problematic from many data protection principles point of view, like transparency and fairness. We need to make sure that both the healthcare professional who uses the AI system and also the patient understands well enough what is going on. So, as also said earlier today, explainability is in this context not optional but a must. And I have new glasses that are really loose. I have to keep pushing them back, sorry. Data quality is of course a huge thing to look at, and as we have talked today, poor data quality presents a significant risk if it is biased, discriminatory, otherwise of low quality. The use of AI system built on this kind of data can lead to harmful outcomes. So this list can go on for quite a long time. There are many important details to go through when we want to be compliant with data protection legislation. But as I said earlier, it is the good news is that we already have the existing tools and governance actions that can be built on. Yeah, and again, as the conversations today have also shown, at least to me, that the data protection questions might not even be the hardest one to tackle in this context that we are talking about today. Yeah, I had one point left that I wanted to say. Yeah, well, data protection principles give a strong foundation, and yes, this one was the point that I wanted to say. Data protection is about the relationship between the data controller and the data subject, which is why it helps putting the patient in the center of use of AI or other systems. Thanks.
Thank you very much, Tanya. So many topics that you raised. We could talk about these sort of topics for weeks, and I'm sure we'll continue with these sort of topics and the conversations in other situations. Thank you. Food for thought for all of us. Already asked, actually Marco answered the question related things this question, but only partially. So I would like to go back to, of course, I'm going back to the Council of Europe's report, and in there it's mentioned that the patient-doctor relationship means making AI explainable, contestable, and supervised. So what is in your view on how EU is putting these principles into action? You mentioned the European health data space and transparency. But what about those other things, aspects?
I should have learned, yes. Now I learned. Okay, so then this gives me the opportunity to comment on explainability. There was an interesting discussion already this morning on some of these aspects, and I want to join the part of the equation. So, and let me say that the kind of technologies that we are talking about, in a way, but not to elaborate much on that, is new in the sense that we ourselves are actually understand how these things works when it's put into service. And the societal and effects or the society effects of this technology are not totally understood yet. So take, for instance, in the context of explainability, yes, so if you talk about deep learning, well, then the answer is in some neurons and weights in neurons that are in a huge neural network. Somebody will come up with an answer. It's very complex from a technological point of view, and they will do it. If you talk about generative AI, this is a huge probabilistic parrot which behaves statistically. You've seen it 100 times, and you will get that answer. And getting the answer there, and now it gets very tricky, because getting an answer of why did you provide this diagnosis, it is very interesting because you can ask the questions to the AI itself, and it will reply, right? Now, a few weeks ago, a very interesting paper comes out of research and says, the LLMs, they are not very good in when it comes to conversations that are called multi-turn, which means what? So you start with a question, and then you say, explain me this, then explain me this, then explain me this. The third time that you ask the questions, the LLM has lost a little bit the reference. So if you feel that they are continuing replying to your initial context, it doesn't work like that. And why do I link this to explainability? Because, you have to pay attention to the false sense of security that you will get if the system explains you why it has given you that technology. So we are mastering technological solutions that, as I said, so for certain elements, well, listen, I worked in this field and I started my career 35 years ago with rule-based expert systems for gastric cancer. So you can imagine that I talk about AI probably all my professional life. It's not new, but this technology, in a way, the way in which we are using it is new, and it is for certain aspects, it still requires us working deeply. Now, that's probably the beauty of our system. What does the regulatory environment provides us? Well, it provides the way in which it is described, including the AI systems, it provides the means to ask these questions and start an investigation before you go to the market, and even after you do so. Even post-market surveillance is guaranteed by the system. So you don't need, probably, we won't have the answer to all our questions at a certain moment, but certainly the systems is so designed that you can go back to the questions in case there is an issue with post-market surveillance in any of the issues that you just mentioned. Sorry if I was long.
May I just
please
add on
do.
that? Yeah, exactly as you said, and I think the large language models, they're a bit like bumblebees, because there's an old saying that based on the physical laws, the bumblebees should not be able to fly, but they still fly. And it's the same with large language models, that basically they should confabulate or hallucinate much more than they actually do. And even computer scientists, they don't really understand yet why they are reasonably accurate, even if they shouldn't be that. So this explainability is one of the most important branches of computer science at the moment. Thank you.
Thank you very much, Marco. We could continue with that for a longer time. But back to you, Yahur. We're still, mean and gloom. In challenges, what are the main challenges related to the use of AI systems and health data, especially from the data protection or human rights perspective, in your opinion?
First of all, I would like to say that the more sensitive the data, the greater responsibility. And in healthcare, we must treat AI not just as technological tools, but and actors with real human consequences. And healthcare healthcare is among the most sensitive categories of personal data. Misuse can result in harm that is deeply personal and difficult to reverse, affecting not only physical well-being, but dignity, identity, and even access to services. And I would like to say that in Ukraine, For example, we have the same situation with AI and health data as in Finland, for example, which already was mentioned. But also I would like to say that one of the most challenges for us nowadays is protection of the health data of the military personnel, because you can see that once hospital for children was targeted by a Russian missile, and that is why we understand that all information regarding the military personnel, our citizen life, all data must be protected, especially health data, because health data is a source for everything, a source for information about the person. So that's all, but also I would like to add that our office, which I honored to represent today, we find some problems in the healthcare sector. It's especially in data protection. For example, we understand that digital transformation is very fast nowadays, but at the same time we have some gaps that need to be fixed. For example, is processing personal data without necessary enough legal basis and so on, which already was mentioned. And that is why in collaboration with the Council of Europe office in Ukraine, we already developed a recommendation on personal data protection in healthcare system to close these gaps, and it's a good roadmap for all healthcare institutions, offices, how to really protect and which steps they need to do before the processing of personal data. And I think it's a good example how to personal data protection can be protected by design and by default. So it's simply before the processing personal data, healthcare institutions must read these recommendations and so and make some steps to protect data.
Thank you very much, Yahoo. Excellent points. Just looking at the time, we don't have that much time left. I thought I wouldn't have enough questions, and I have plenty of questions left. So maybe we will move from one challenge and then move to the solutions that you may have to the challenges that we have had throughout today. And in the end, I will give you more than 45 seconds to have your key message said to the audience and deliver it to the city bio. But I would still go to Andreas, and I think this is still a very important question regarding special patient groups, for example, vulnerable and underrepresented patient groups. Are they considered when developing these AI systems? And are they considered? You know, we have special groups of patients that need to be taken into account when developing AI systems. Do you have an answer for that?
Yeah, and the solution for that challenge is that, we need to talk about equity. So we need, from the start of the designing of those large modeling tools and machines, to implement and have in place mechanisms that we will ensure that we also talk about during the day. We also talk about the bias. So we need to have large data sets from also minorities of people. I mean, most of the people that they are sharing their data are through with a larger common group rather than with minorities like refugees or other groups that they are minor. So one of the solutions is that we need to have from the designing phase of those tools not only patients but from every category. And in Cyprus, if just to take it so we don't have enough time as I see, in Cyprus we implemented a national e-health law in 2019. We were one of the member states, the first member states that we did that. And we set in the core of the national law, we set all the stakeholders and especially patient representatives and doctor representatives to be on the board. So we bring to the table those challenges and we try all together to find those solutions. So this is a message from out there that bring all the stakeholders to the table and give them equal voices.
Thank you very much. Excellent answer. Then I moved back to Visa, and the question is pretty much the same. We have talked about, lots of possibilities. Actually, we have talked more about challenges today, and what would be your solution? I know we had a sort of prep sessions for this panel, and Visa was sort of saying to me that we have new challenges coming every day, and we just need to find a solution. But what sort of solutions, what sort of advice you would give to the audience here and people listening online, and takeaways to the CD Bio as well?
I think we have to, as somebody said already before, was it Enni Sanmark or somebody, that we have to be brave but humble and learn by doing. That's the most important thing. And then also start to think about data safety and protection in the way that, because our health data is so important in treating us, that we can be sure that our data is safe and is protected so that it can't be destroyed or then poisoned with some misinformation which may then harm us. Thank you.
Thank you, Visa. And the same questions to Marco.
Well, I can only advertise a piece of regulation. I don't know how many of you would like to engage with that, but for those who are interested in the matter, I suggest getting hold of the European Data Space Regulations and the AI Act, together with, having also an understanding of what are the effects in terms of cybersecurity and in terms of, say, network and information security. The reason why I would invite that, because making sure that we have the framework is there, but making sure that it is actually used means that it's implemented. And for now we have the regulations for the European data space. We need the member states to engage, and we will do our part in creating the underpinning regulations, the implementing acts that will allow to make it a reality. The same must happen at the member states level, so the more voices pro that exercise, the better.
Thank you, Marco. And we're happy to help in Finland steer the boat in the right direction, because we have, previous experiences of similar regulation, both in primary and secondary use, and we're happy to do. It's a joint effort, and we're still on the same boat, and we have still the same captain, and the added captain is the co-pilot, the AI as well. But back to you, Tanya. What would be your takeaway?
Thank you. Yeah, I'll be really short at this time. Well, as I said, data protection builds the foundation for trustworthy, sustainable use of AI. And without the trust, any fancy system will fail.
Thank you, Tanya. And now to Yahoo, the same question.
Also, I will be very short. So sometimes it's very difficult for people to read the privacy policy, and that is why it is important to raise an awareness around the medical personnel and, of course, around the people. It can be guidelines, recommendations, conferences, and so on and so on. And the second one is the important thing that it's collaboration between companies and control authorities, because this collaboration can bring a lot of good results. For example, it's compliance with the legislative and other things. So collaboration and raising awareness.
Thank you very much, Yahoo. Thank you very much, wonderful panelists. And the key message would be from my side is to do cooperation. We're in the same boat still. So let's do the cooperation and find the best solutions. Thank you.
Thank you so much. Now it's time for the summary, so that I call upon Maria Döso Patronets, please.
Well, as you can understand, this is not a difficult task. This is an impossible task, and should have been you, Lee, to do this summary, not me. I mean, one full day, just in 10 minutes. Okay. Let's see how it goes. I'm sure that at the end, no one will be happy with my summary. I will indeed attempt not to review what was said, but rather highlight some of the most relevant points. And bearing in mind, first of all, our focus here today is on patient-doctor relationship from a human-centric perspective, using the Oviedo Convention as a legal foundation of our reflection. Secondly, the traditional direct face-to-face relationship between two persons, patient and doctor, is increasingly becoming a triadic relationship, patient, doctor, and the third mediator element, the AI. And AI is not a neutral element, is not a simple tool. Thirdly, AI mediation can impact positively or negatively rights and duties of both patients and doctors. That is, it brings risks and opportunities, and it's our responsibility to identify both of them, to maximize the benefits and to prevent or minimize the harms. If it is true that AI poses ethical challenges, not using it would also be highly ethically problematic. Fourth and last presupposition that was here along the day, we must broaden the reflection and the debate. And we must go beyond the classic issues and also beyond just pointing out what the problems are. We need to understand the new reality of healthcare delivery, to identify the specific dilemmas that arise, and propose solutions, outlining a roadmap for the future in this transition of human rights into digital era, ensuring that human rights are not undermined by the way healthcare is delivered. We can start with the recognition that the application of AI in healthcare is likely to be disruptive. This is why it has drawn the attention of various international organizations that have been developing proposals for future action. The Council of Europe has done extensive work on the impact of AI on patient-doctor relationship. It would be important, I would say, considering the profile and the mission of each organization, and we had here, they are still here, many different organizations. So look at the profile and the mission of each of them to establish an effective and meaningful closeness that enables coordination and complementarity among the work that each one is conducting independently. After all, the challenge faced by each community in digitalization of healthcare are essentially the same. We find relevant examples and experience in different countries, but this issue goes beyond any national framework. Moreover, it is a matter that involves not only governments, but also institutions, associations, and citizens. Therefore, One initial proposal that could emerge from this meeting would be to promote global governance regarding an integration of AI into healthcare. A global governance that, through broad dialogue and cooperation, diverse, inclusive, could establish a consensual minimal obligations for each stakeholder in compliance with human rights. And also provide a foundation for clear and straightforward international regulation or guidelines that, without hindering innovation, protects human rights in the digital age. In this process, it is important that patients and healthcare professionals take an active role in the ongoing transition of healthcare digitalization at the level of design, development, implementation, and use. They must be part of the solution. As far as digitalization of healthcare is concerned, doctors recognize the potential of AI in diagnostics, treatment planning, monitoring, as well as in public health, disease prediction, and personalized medicine, enhancing accuracy and speed. It also proves useful in administrative and management tasks, saving time and resources. Briefly, it makes doctors more efficient. At the same time, the increasing application of AI in healthcare is creating new roles of care delivery, new roles of care delivery, such as it was mentioned this morning, security officers. And while specialization is relevant, it also carries the risk that I'm sorry, so tired after such a long day. I'm sure that you have the ethical virtue to forgive and be indulgent in relation to my English, right? Okay, I trust on that. So let me proceed. So I was mentioning that we have the risk that the technological sector takes over the healthcare sector, which would distort the patient-doctor relationship. In this technologically dominated context, the doctors will inevitably have a new role to play, namely integrating AI into the clinical encounter. A second proposal, therefore, could be to produce a short brochure outlining the new roles and corresponding duties and responsibilities of healthcare professionals, with recommendations on how to play them while respecting and promoting human rights. And what opportunities does AI offers patients and their families and citizens in general? What ought to be done for them to truly benefit from AI? And it seems that we need to enhance their understanding of AI's capabilities, therefore reinforcing their autonomy. Autonomy is not a given, but a prerogative, and it must be nurtured. They should be empowered to become truly partners also in this digital era. They should be involved in the design, development, and implementation of AI itself through co-creation by identifying the various roles they can play at each stage of AI life cycle. Therefore, a third proposal from this meeting could be the development of a simple, clear, and direct guide on how AI is being integrated in healthcare systems, what the possible impacts are, and what the rights of patients are in this new context. This booklet would contribute to public literacy and to the preservation and perhaps even strengthening of patient autonomy in decision-making, and also in the control of sovereignty over their health data. Furthermore, without sound information, critical thinking cannot be developed. And without critical thinking, AI can become persuasive and manipulative. In that case, AI would be reducing individual autonomy. These two informative and educational documents for patients, citizens, and also differentiating the publics, namely young people, that they consider that they can go straight to Chat GPT instead of going to a doctor. Well, these documents should have a transnational or a global scope. The challenge then is to integrate AI intermediation without altering the essence of patient-doctor relationship, preserving fidelity to the Hippocratic principles such as beneficence and non-maleficence, as well as respect for human dignity in a context of patient datification. On one hand, it will be necessary to revisit, to reconfigure fundamental issues such as confidentiality, privacy, within the digitalization of healthcare, as well as the process of obtaining informed consent. This can no longer be limited to treatment alone, but must also include data management. On the other hand, both doctor and patient now enter the clinical encounter with enhanced power that may alter the relationship. It can become more distant and briefer. Especially regarding data protection, the role of physicians as the interface between the patient and the collection and safeguarding of data is really, really crucial. It is important then to consider whether doctors understand how the smart tools they use operate, so they can adequately protect the data and explain the new reality to patients, thereby contributing to the protection of patients' rights and fostering trust in the relationship. Without the ability to understand and explain AI, there is no genuine, truly informed consent, nor medical responsibility or liability, which makes the most fragile even more vulnerable. Also, it's need to extend to understand which patients are free, if patients are free to select data they wish to share, with whom, and for what purpose, and the degree of freedom doctors have to choose the best care to provide, to reject automated decisions and data determinism, which may reduce both patient and physician autonomy, as well as undermine physician responsibility and patient protection. AI, or let's say, jump this sentence, at the same time, it is necessary to keep in mind the need for more and better data, which can lead to greater benefits for both individual and public health, while also helping to reduce bias. After all, the type of data inputs to AI systems directly affects their outputs, and we are dealing with systems still in a learning phase that holds significant decision-making power. This presents a dual problem. On one hand, these data often lack accuracy and have not prevented bias. In fact, they may even exacerbate existing bias, operating as an echo chamber of physical reality. On the other hand, they may generate new forms of responsibility, especially for patients, which could affect their inclusion or exclusion from access to healthcare. And this raises the questions of who decides access as a major critical question today. In fact, I believe that we run the risk of access being determined by algorithms. In both cases, the quality and the quantity of data influence the level of discrimination and inequity in access. Therefore, we need further research and innovation in data science. A fourth proposal from this meeting would be not only the revision of the terms of informed consent, including a specific section on health data within a blended human-AI system that continues to protect patients' rights, but also the organization and provision of a short educational course for physicians to empower them as guardians of patient data. The nature and quality of data, as well as its representativeness and objectivity, also play a fundamental role in ensuring equity in access to healthcare, as we have seen along the day. Other factors that may influence access to healthcare include access to technology itself, which can be hindered by digital literacy, availability of devices and internet, language barriers, and certain types of disabilities. On a broader scale, the relationship between public and private healthcare systems and the level of integration of intelligence systems in each can also impact accessibility. I choose to conclude saying that we live in inequitable societies and develop AI within the context of healthcare, a highly sensitive setting involving highly vulnerable individuals. This is our reality. It is essential that AI be not only a technically robust and humanly trustworthy, but also ethically equitable. AI must become an opportunity to reduce inequalities. I'm sure that no one is satisfied with this summary, but please send me any comments that you really consider that should be here and would not mention now. My email is easy to find in the internet, so I'll be more than willing to welcome your comments today or tomorrow or the day after. Thank you.
Thank you so much, Maria. I know it wasn't an easy task, very heavy after a very heavy day. And then our closing remarks, and then I give the floor to Lee Hibbard.
Well, thank you very much. I'll be very short. It's been a long day. Denis had to apologise because he had to catch a plane to another meeting, so he apologised. He sent his regards. I'm just going to fill in for him. But just to say to begin with that it's been a very exciting day. I think apart from all the risks, it's very exciting to see how AI could be so important in saving lives, in increasing survival rates, in reducing healthcare costs, supporting early interventions, reducing hospitalizations, having targeted therapies, and optimizing treatments. I mean, there's a lot of hope as well. Apart from the dilemmas, there's lots of hope, and I'm really excited. And of course, there should be hope in the title of the conference, which is, AI, healthcare, and human rights, supporting patients, enabling doctors, and safeguarding this very important relationship. So it's about both. It's promoting innovation and it's protecting human rights. It's not a trade-off. So it's very important that we think about it in accordance with that narrative. I think just to give a few closing remarks, I think we've achieved the objective of this conference, which really is about looking at the report that's been drafted, unpacking that report, and opening the dialogue, looking at use cases, keeping attention on the values, a value-centered approach, and looking at dilemmas. I mean, we looked at quite a few dilemmas today from different perspectives. There were four dilemmas that Denis made reference to in his opening remarks. I think they're worth reminding ourselves of, because I think they're still relevant at the end of this conference. Can our AI be deployed to serve everybody in an equitable manner? are AI applications empowering or disempowering people in their healthcare journeys? What does meaningful responsibility and oversight look like or mean for health professionals? And what are the implications for medical confidentiality when AI systems become more and more pervasive in the healthcare sector? I think we've also achieved our objective in connecting different professionals today. I mean, the panels have been very rich and diverse, and Joni and I spent time, making sure that we brought lots of different people together. There's a great mixing of different perspectives. It reflected in your comments today the need to have multidisciplinary panels and reflections. I mean, it's really very important to make sense of this relationship, because it's not just about one particular sector, even though maybe you could argue it's being driven by very strong particular sectors. I think we've achieved our objective in keeping our focus on people as health professionals, and on people as patients, but also people outside of hospital settings, and keeping at the centre of our minds the words I heard today from some of you: compassion, trust, empathy, and cognition. And I don't think we should lose sight of those things in going forward. I think we still need those things, and maybe they can be improved with AI. A few words of recognition and thanks to Joni Kamulainen for his stewardship of the report which we had, which is outside, for really helping us get this report over the line with the 46 member states. It's thanks to your guidance there, Joni, and expertise. I really appreciate that. Thank you so much. And I guess behind Joni, if I may, I have to really thank Tula for being so supportive, because supporting Joni and then supporting us here today, being a fantastic host and guiding us through this day, it's been really useful. We've been sticking to time. I hope that's gone well. So I really appreciate that. I think it's what's really great is that you've mobilised so many good experts, so many good Finnish experts as well. And I'm really appreciative to have to mobilise so many different sectors from Finland to come here today and to really share knowledge and expertise. That's really formidable. Of course, this work will not stop here. It will be fed back into our own committees in the Council of Europe in Strasbourg. Thomas Doliza, you saw him earlier. He's the chair of the committee which deals with biomedicine and health. And we have Maria, of course, who is part of that committee. And they will bring this back to Strasbourg. So this will echo in Strasbourg. And I hope it will influence the actions of the next 5 years for Council of Europe member states looking at AI in the healthcare sector. So the work does not stop here. One technical thing is this is recorded, this event, so it will be available to you to access at your leisure and for your colleagues, if you so wish, according to panel. So it's going to be served you as a tool. I'd really like to thank the Minister, of course, for coming today. The Chancellor, of course, who stayed the whole day. Thank you very much, Mr. Chancellor, and the Permanent Secretary, of course. Really important to have them there. It's really great to have such important personalities with us. All the other ministry officials, of course, which are at the desks there, and others, Sala and other colleagues, thank you very much for support. All the speakers and moderators, I mean, you did a great job. I hope we didn't bother you too much in the preparation. We had some preparation talks online. I hope that wasn't too difficult. I mean, thank you so much for being so open and for us to push you a bit, to nudge you a bit in terms of your thinking beforehand. You don't see a very important partner in this event, that's the interpreters. This is being interpreted into French and followed online in English and French. And so I'd like to give a big thanks to the interpreters who have been working hard all day, listening to us. They're back in Strasbourg, but thank you very much to you for your diligence. To the technicians, because of course you bring it together. So thank you to all the technicians here and back in Strasbourg. And of course to the audience, it really matters. The audience here in the room, you stayed to the end, thank you so much, and also to the online participation. I think we had something in the region of 300 people. So, Tula, thank you so much for the event. It doesn't stop now, it's just the beginning, I think. But thank you to you, thank you to all of you, thank you.
Thank you very much for your kind words, and I don't take too much your time, so that the last speaker. And I was just I'll just pick up a few words so that, as we heard many times, elephant in the room, and I think that the baby steps probably it's not that big elephant though. So, but yeah, AI is not a tool, but on the other way, we shouldn't mystify it too much, and maybe it's not really inventing agriculture, maybe not that big issue, or is it? So that and cooperation was mentioned many times, and I think this is a really good example. That is what are we doing right now. And then risks. Well, I think it's very specific for any animal species, so that we are in a way trying to avoid risks. It's a question of survival. So, but at the same time, I think the human beings we are very innovative, and that's why I'm very comfortable that we get the solutions, and so that we are very innovative, and we are really thinking about what we really want. It's not they or there's someone. It's us. What is the benefit for us all? If you think about the AI, a tremendous amount of possibilities, as we have heard, and then education. I think that's the key, as many people have said, that how to educate ourselves, all the stakeholders, citizens. And the legislation, of course, I will come from the Ministry of Social Affairs and Health. We have a tremendous amount of legislation, not only the EU pharmaceutical legislation package and AHDS, which is in the implementation phase, which we very much looking forward to. And we have the medical devices, which have been many times here as well mentioned, and the GDPR, data safety, and sharing the data. That is a big question. We have talking a lot about how to really talk about it. It is really, if you think about the genomes, as we, Saila and I, we were just Monday, we had a big EU meeting with the signatory country about 1 million genomes. So we think about is it the sharing the data or access to data, very sensitive data, so that there is a lot of thinking about that, and we are trying to build up a governance model, and then the legislation that we can move on, so that I think it was very good in that sense. And Marco started that, as you remember, the 1 million genomes, and so that. And then I have underlined trust. It's as we know, if we don't have trust, we lose everything. So I think this is a key, and I think it was very nicely said that it can't be a top-down, it is a bottom-up in a way, so that everybody sees and thinks and is confident that I'm in the same boat, and my opinion matters, and they really want to hear what I'm longing for, and what are my ideas and my wishes. So before I call upon you to the cocktail and to dinner, I want to thank as well the Council of Europe and Lee. Yeah, I think we have very fruitful conversations, and we learned a lot. And of course, the great speakers, great panelists, moderators. And then I would like to, the prospectum, I did a great job, the technicians. And then I would like to my, let's say, my own team. I'd like you to stand up, so that, because it's Minna, Merja, Rosa, Sofia, Joni, and then everybody, Julia, Essi. Yeah, it's a, as we know, it has been a tremendous, as you know, very much work, and thank you. It's very heartfelt acknowledged, so that people are working hard, and I think that then we hopefully will see next meetings to come. So we have now taken the baby steps, and now next meetings. Looking forward to that. Thank you very much. And now we have a hopefully very great conversations, fruitful, still continuing, going on, and having a nice dinner just in the Meri Pavilion, which means a sea restaurant, so floating on the water. So and my team will guiding you, so that please, thank you very much, and now the meeting is ended. Thank you.